Good morning. Good morning, good morning, good morning. Hi guys, I'm Nick Williams. I'm the CEO of American Subcontractors Association of Colorado. Thank you all for being here. If I could ask you kindly to make your way to a seat, we're going to get going with some opening remarks. Well, it's finally here. The Health and Safety Committee and I have been planning this thing for about 10 months. I'm really happy to have you all in the room. Thank you for being here. That's nice. This is a day of collaboration, partnership, and intention. The whole goal is for you to feel all three of those throughout the day. The summit means a great deal to me personally because of what we're accomplishing together here today. Right here in this moment, today's event is more than a conference. It's a fundraiser for construction health and safety. All the proceeds from today will be distributed to the industry partners you met at registration this morning. Because of everyone in this room, our partners at ASA, HCC, the Hispanic contractors, IECRM, the electrical contractors, CCA, Colorado contractors, NUCA Colorado, the underground contractors, AGC Colorado, and RMSCA, the steel erectors. They're each going to have additional resources in 2026 to amplify their own health and safety efforts because you're here today. So thank you guys for what you've done for those nonprofit partners. Just a couple logistical notes before we dive in. Please hang on to your printed agendas if you're going for CSP or CHST credits. That will serve as your credentials. If you're part of a Pinnacle Safety Group, the sessions today qualify toward your education requirement to receive your dividend. Just stop by the safety group table. There's Allison, so at CRS over there, and sign in with accurate information, and you'll be included in the submission for the Pinnacle Group. Before we get rolling, I have the pleasure of introducing Elizabeth Pruch with Project Helping and Spark by Project Helping? Yeah. Elizabeth's here to share a bit about their mission and how you can support their work today and our community through their work. So come on up here, Elizabeth.
Thank you, Nick. Good morning, everyone. How are we doing? Oh my gosh, you started with applause? I haven't even spoke. I like you guys already. I'm Elizabeth Pruch. I'm the Vice President of Partnerships for Project Helping. We are thrilled to partner with Nick for many reasons. I'm going to quickly just kind of tee it up, and then I'm going to introduce Rachel, actually, from our Spark Mental Wellness team. But Project Helping is an organization that knows that when you do good for others, you feel good. So we make it really easy for folks to volunteer. Decades of research shows that when you volunteer and do good, you feel good. Nick and I don't even know how we met, but we met, like many of you meet Nick. Everybody says, oh, Nick, they love him, and we do whatever Nick says. But he came to me and he said, in all the right ways, that was a compliment. We love you. That was a compliment. But the laugh makes me think maybe it wasn't. I don't know. But what he said to us was, the construction industry has a really high rate of suicide and substance abuse. How can we help? What we do at Project Helping is we have something called a Kind Kit. It's a volunteer opportunity in a box. We work with corporate partners all over the globe. We send these to them. They have opportunities to volunteer, either at home, at their office, at a conference, whatever it might be. And it's a really great way to introduce people to volunteering and how good it can feel to do something good for others. So we got together with a lot of his connections and colleagues, a lot of professionals, and said, what can we create together that will benefit and support the construction community? So we created this recovery and wellness support kit that has a really spectacular guide inside with resources and support opportunities. And we built these kits together with him, and now we're giving them out. Oh, you're here? Raise your hands if you're here and helped with that. Yes, yes. Stand up. Let's give them a big round of applause. John's not paying attention, I'm told, but thank you, John, also. This was a really fun collaboration and a really meaningful one. We're giving them away till they're gone. Back in the back, Trenton, raise your hand. Thank you for being here. But this is an incredibly important piece of why we wanted to be here. And so that Rachel, I'm going to have Rachel come up here and talk to you. We recently, earlier this year, wanted to do more than just support folks through volunteering. Mental wellness is so important. We actually merged with another nonprofit organization, a 30-year-old nonprofit here in Colorado, Spark the Change Colorado, now Spark by Project Helping, and they have tremendous mental wellness programs throughout the state. We go into schools, we support people with free mental health support, but I'm not going to talk about it because I don't know it as well. So Rachel, if you could join me on stage. But thank you all so much. We really appreciate you, and we're here for you. And check out Trenton today. And thank you, and enjoy the day. Rachel?
Thank you, Elizabeth. Good morning. Thank you all for having us here. Like she said, my name is Rachel King. I'm here to represent Spark's mental wellness program. And this initiative has really always been rooted in the goal of expanding mental health care access throughout Colorado. And definitely through our partnership with Project Helping, our capacity to do that has really only expanded. So a little bit about Spark. We have always recognized and uplifted the importance of mental health care for our communities in a multitude of ways, and they're always expanding. We have community partnerships where we match qualified volunteers to under-resourced community organizations, and that immediately equips them with mental health care access, not only for the populations that they serve, but also for the staff that are there doing the work for those communities. We also have a supervision and workforce development program. That's kind of my baby. And through there, we support the needs of the next generation of mental health clinicians by removing barriers to accessing supervision and qualified support as they work towards becoming the boots on the ground clinicians that really care for all of us. The other avenue that we take to support mental wellness is through our incredible client line services. You'll see some information about those on those stanchions that are scattered amongst the tables here. This program utilizes both qualified and newly qualified clinicians and their volunteer spirit to provide anyone, and that means absolutely anybody, with up to 10 free therapy sessions. And that's no cost, no insurance, no one's turned away. And as a social worker and a person who has transformatively benefited from my own therapeutic journey, I really understand how very overwhelming those early parts of therapy can feel. And I'm talking about everything that happens before you even get on the couch, so to speak. It's really hard to know where to begin. I found that with a lot of people in my life, a lot of people that I've worked with. There are all these different platforms for service providers. There are endless names of people there to help you with an entire alphabet of letters behind them that even I still don't know what they all mean sometimes. There are obstacles with insurance, confidentiality, or out-of-pocket cost, and at Spark, we really understand this and do everything that we can to remove those barriers for you, so that way you can make prioritizing your own mental wellness as easy as possible. And I think it seems pertinent to address another barrier to engaging in mental wellness, and that's stigma. Everyone in this room has a different story, carries different layers of identity, and has a unique perspective on what it means to be actively engaging in your mental health care. But despite those differences, we all have a heart and a mind that deserves to feel understood and peaceful and cared for. But investing in your mental health in whatever way feels best for you is always a good decision. It's my hope for you that as you move through this summit and all of the experiences of the day, that you pay attention to what resonates with you. So while you're listening to the speakers and to each other, talking with all of these great resources in the room, notice when you feel a spark inside of you. And yes, the pun is intended, but also appropriate. So really, like, what makes you reflect on your own experiences or your experiences with a loved one? What makes you stop and think, maybe there's something there? I don't know you all, and I can still tell you without question that noticing these little flickers that happen inside of yourself is a really wonderful start. You know yourself better than anyone, so start by trusting you to guide you in the direction of the wellness that you're meant for. Once you've done that, you're invited to choose whatever path is best for you. So whether that is calling up Spark and taking that number down on that stanchion over there and finding a teammate to walk along that path with you, or maybe it's joining a local support group with community members that you can identify with and who understand your experience, or maybe it's just as simple as sharing a little bit more of your heart with somebody that you already know and trust. Whatever it is, it's going to benefit you and the people that are around you, as long as you're choosing you. And I understand that investing in your peace and happiness in this kind of capacity may seem a little daunting, but I do assure you that it's worth it. So I commend all of you for your hard work, your attendance, openness, and participation in this day. And like I said, just start by noticing where that energy is. Notice what resonates. Change and motivation do begin with starting to notice where that work needs to be done. And if you find yourself in need of a community that is tenaciously and compassionately supportive of your mental wellness, then Spark will be here, whether you reach out today, come visit us at the table, come to our website, give us a call. We're waiting to support you in whatever way you need. So take care of you so you can continue taking care of the world around you. Thanks so much. Have a great day.
Nice work. Okay, thank you very much. We believe in what Project Helping is doing. We believe in what Spark by Project Helping is doing. Today, they're conducting a fundraiser. So I really need all of you to support the work that we support and go see them at their table and help them raise funds to help construction. Okay, I'm gonna do a selfie with all of you in the background. So look however you wanna look, excited, pumped, hide your face, get under the table, whatever you need to do. Okay. All right, first off, I just want to thank our sponsors, like huge thank you to our Trailblazer sponsors, DPR Construction and Fisher Phillips. We literally could not have done this without you guys. Your partnership, your belief in the mission, thank you both for helping bring this event to life for our industry. Our Narcan sponsor, Signal Behavioral Health Network, is back there in the corner. They've made one of our shared visions a reality. The meaningful proliferation of Narcan into the construction industry. That's happening today, later today, so hang on to your seats for that one. Through their generosity, we're distributing Narcan. Signal, thank you for your help in helping us save lives. Appreciate you guys. To our base camp sponsors, JHL Constructors and Ed Bozarth Chevrolet over here. Thank you guys very much. Your support has helped us deliver a high quality, well-organized event, so thank you guys very much. And to our trail provision sponsors, the breakfast, lunch, coffee service, Rocky Mountain Crisis Partners, Guardian Recovery, and MSC Safety Solutions, thank you guys for fueling us throughout the day. Appreciate it. All right, I want to recognize the next generation that's in the room. As you guys may have seen, there's some young people in the room. You may have wondered what's going on with that. At ASAC, one of our core values is professional development. And part of that commitment means paving the way for the next generation of our industry. We're joined today by students from several outstanding programs: EPIC Campus, Cherry Creek Innovation Campus, Arupe Jesuit High School, the School of Public Health at Anschutz, Careers in Construction Colorado, Pikes Peak region. These students were able to attend today thanks to scholarships support from ASA Colorado, JHL Constructors, and Colorado Public Works Journal. Students, please stand, and let's all give them and their sponsors a round of applause. Thank you guys for being here. That's the next generation there, folks. As you've already discovered, we have an incredible lineup of community partners here for our Industry Connection Showcase. These are top-notch, truly the best of the best. Friends, mentors, compatriots in the fight. They're here to help you carry today's lessons back into your businesses. So please do meet with them. These are hand-picked folks that can literally change the way that you operate. For those of you who are a bit competitive, if you collect a signature on those sheets in your folders from every single company in your showcase sheet, you'll be entered into a raffle at the end of the day at about 4:15. Just turn in your completed sheet with your name to Kelsey. Rob, Kelsey, where are you? Kelsey? Okay, you guys all met Kelsey. She was standing in the front of the room when you guys all walked in today. But turn in your sheet to Kelsey or me. It's fine. And we'll do a raffle at the end of the day. None of this would have been possible without an incredible team of people who worked tirelessly behind the scenes. To our event service team who assembled name tags, Narcan kits, folders. Please stand as I call your names: Jill Rondinelli, Tricia McNaughton, Heather Gutierrez, Brad Gassman, Ronnie DeMana, and Regina Cerna. Thank you guys very much. If you're in the room, stand up, be recognized. And to our ASAC Health and Safety Committee members who have spent months planning and executing this event, every detail of today's event, please stand and be recognized. Kristen White, Jane Waterman-Joyce, she's not here, she's on maternity leave. Trish Ennis, Chris Baker, David Ruddy, David Shapiro, Carol Spelke, Mark Ashby, Allison Miles, Matt Paul, Apollonia Rockwell, Lily Freeman, Mike Fenley, and Joe Martinez. Thank you guys very much for helping execute and plan this event. Go ahead and stand up. This is the ASAC Health and Safety Committee. Everybody stand up. Joe? Yeah, this is the committee. These are your folks right here. So if you guys want to know more about ASA and our Health and Safety Committee, those are the people to talk to. Or me. Finally, a personal thank you to two people who have given so much of their time, three people actually, energy, expertise to me personally to help make this possible, and that's Catherine Case, Allison Miles, and Kelsey Robb. Thank you guys. Please stand and be recognized. Thank you very much. Catherine, stand up. Thank you. Allison, how many times did you stand up today? All right, I owe you something. All right, guys. Let's get this kicked off. What do you say? We've set the stage today for a focus on connection, innovation, and total worker health. It's my honor to introduce someone who's helped with that very movement, Cal Beyer. Cal is the Senior Director of Safe Workplaces for the national nonprofit SAFE Project, Stop the Addiction Fatality Epidemic. He's been a tireless advocate for mental health, suicide prevention, recovery, and well-being in the construction industry. Cal helped ignite the mental health and suicide prevention movement in construction after Hurricane Katrina, and he's been part of the National Action Alliance of Suicide Prevention since 2010, serving as on the executive committee since 2016. He also helped launch the CIASP, Construction Industry Alliance for Suicide Prevention, which has become one of the most important collaborative efforts in our field. Over his 3 decades in Cal? In construction, risk management, and safety, Cal has helped hundreds of organizations bring compassion, recovery, and total worker health into the core of safety culture. His leadership has been recognized across the industry from being named an ENR Top 25, NAHB Mental Health Advocate Award, and a Lifetime Achievement Award from United Suicide Survivors International. Guess that's what you get for 3 decades. Next year, he'll be inducted into the National Academy of Construction for his longstanding service to mental health and suicide prevention. Cal's work reminds us that caring for one another isn't just good business. It's quite literally what propels us forward and makes our industry better. So please join me giving a warm Colorado welcome to Cal Beyer.
Okay, thank you. Good morning, Colorado. I love being in Denver. I love being part of your community. Thank you for embracing this. This is a personal topic. It's a family matter, a community concern, and a social challenge. Why don't we talk about mental health, substance use, suicide, and overdose prevention in the workplace? Because of stigma. We're going to address stigma today. I'm going to share a story of how the word stigma schmigma came about and why I decided to title this session this way. For years, Boston has been 5 to 7 years ahead of the rest of the construction industry. The recovery community in Boston has been propelling this. Colorado has quickly closed that gap, and I've been telling that story across the country. I have been anticipating this day, and yet when I walked in yesterday to see this electric room with no one in it, I was getting goosebumps. And today, it's incredible to see how your industry has responded to this challenge You've already broken the stigma by being here today. I'd like to invite you to please stand up. We'd like to do a quiet moment of silence to honor the many people that we have lost in our industry and in our families to suicide, substance use, mental health, or even overdose. Please join me in a quiet moment of silence. It's one way that we can break the stigma is to acknowledge. So please, in your own way, just take a moment of silence. Thank you. I remember doing that on a job site for the first time, and it was really powerful. It was really poignant, and I've continued to meet many individuals. After many years of being in the risk management and insurance world for construction, I moved to a national nonprofit 18 months ago. It was what I could have made. I'm excited to be here representing SAFE Project. It stands for Stop the Addiction Fatality Epidemic. And we work with campuses, community groups, veterans and caregivers, and I'm the senior director for Safe Workplaces. I want to thank all of the promotional partners who made this event come real. To have 6 associations come together is nothing short of incredible, especially this busy time of year. Also want to highlight 3 naloxone superheroes. 2 are shown here for SAFE Project, and 1 is invisible, although she just walked to the front of the room. Joe Taylor was the photographer who photographed Heather and Nick. After attending an AGC of Colorado meeting several years ago, I asked these 2 individuals if they would please honor us by being our superheroes in a promotional campaign to the construction industry. And so, Joe, thank you for the photography. Nick and Heather, thanks for putting yourself out there. The stigma that you broke down by being part of that campaign, nothing short of incredible. And I just want to thank you for your spirit. Also want to say, one of the things that really impressed me about Colorado several years ago, it was May of 2022. We had 23 construction associations agree to do a joint webinar on the same day. That's unprecedented cooperation. And it was a topic called Waging a Counterattack on Opioids in the Workplace and at Home. It's not surprising, but Attorney General Phil Weiser will be here today as well. He joined us during that webinar. My vision in inviting all of those associations together was to put an industry like construction front and center, that we were going to do something about this crisis and not talk about it. We were going to take action, and you have. And 3 short years later, look at this assembly. So Nick, you're a visionary, you're a collaborator, you're a get-it-done kind of guy. I want to also say learning objectives for today are woven in, but there is an intersection we don't talk about. The intersection between mental health, substance use, suicide, and overdose. It's where I spend a majority of my time working with that National Action Alliance for Suicide Prevention. We need to address the issue of stigma, and we're going to talk about how to do that today. We're going to collectively talk about strategies that we use to break down stigma. And at the end, we're going to send you a PowerPoint PDF of all of the polling questions that we use. But here is something that the National Action Alliance for Suicide Prevention does every September for Suicide Prevention Awareness Month. And I've used this the last 2 years in a row. I spent 5 years lobbying to get that intersection of substance use, mental health, suicide, and overdose built into the 2024 National Strategy Suicide Prevention. And I'm grateful that we have this opportunity to anchor that in a public health document. It's going to change the way the future of suicide, mental health is addressed, and it's going to allow us to embrace opioid risk reduction through opioid overdose reversal. So that's what this national strategy document looks like. And I also represent our industry on the Lived Experience Advisory Committee for the Suicide Prevention Resource Center. I've experienced suicide loss in my extended family, experienced it in countless workplaces, and lost a dear friend in 2015 to suicide, and that's what made me finally declare war. It's when I said stigma schmigma, and I waited too long for too many years for people to be ready to have that conversation. And when my friend Jeff, the big dog, Rudy, died, that was it. I'm like, I could have done more as a leader. So I want to call everyone to action to join this army of helpers that we've been building. The strategy that we used was built with Dr. Sally Spencer Thomas and me when we took it to the Construction Financial Management Association in 2014, before Jeff died. RK Mechanical, now known as RK here in Colorado, was working with Sally on a blueprint. And I said to Sally, let me help you constructionize it, and then let me market that. And there were 4 strategies that morphed into 5. It was a media saturation campaign to get people talking about it. Number 2 was an association penetration. The third, because in some parts of our country, union presence is strong, union participation. But the 4th was exactly what you represent today, build an army of helpers. And the 5th was catalyze different sectors and subsectors of our industry. I spent the next 10 years completing 62 different industries that I was the icebreaker for. I finished my original list of 62 this past March. It was the landscape industry, thank you, and vegetation management. But I sought them year after year. Let me be that person. Let me help find leaders who will then take that to the next level. Colorado, you amaze me with what you've done. I don't like to use a lot of data because I don't believe in shock and awe. Losing one person is too many, and that's why we're here today, to protect and save lives. But this is not often known, that intersection between substance use and suicide. We talk more about suicide prevention in our industry than we do overdose prevention. But we don't understand that one of the root causes is substance use. We have to take away the stigma. We have to stop dehumanizing individuals. We have to stop blaming and shaming people. We need to see them for the people they are. And I say we are. I had experience with prescription pain medication use, misuse, and abuse as a teenager, 3 knee operations. I pretty much had to beg my orthopedic surgeon, who prescribed me excessive pain pills, to help me go through a medically supervised withdrawal. And then I did so I could pass a drug test at a hospital where I took a job. And the first job I had was taking specimens to a lab. But if you ask me, I was saving lives. Because every job mattered in healthcare, just like it does in construction. So if that could happen to me as a 16-year-old, imagine the futures we could help people build today. I just want you to know recovery wasn't something we talked about back then. Back then, almost 47 years ago, I was told don't ever talk about it. It was described as you dodged a bullet. Move on, don't look back. It was painful as I started to see people go through recovery and people started to acknowledge it. I became a recovery ally and a recovery champion long before I could declare my own. I also recognized post-Hurricane Katrina, when I saw the issues of substance use, suicide, overdose, if I told my story, at the time the stigma was so deep, people would not have listened to me. I truly feared people would say things like, why are we going to listen to him? He's just a junkie. He's an addict. Those were the words that were common. So I swallowed that desire to share because I knew I had to. But when my friend Jeff died, his family said, if you ever have an opportunity to make your voice a little louder, please do. So families like ours don't have to suffer in silence. And it was a powerful words because they included me in with their family. So I just want you to know, like, this is real. We have come so far. We have people actively advocating recovery-friendly leader, recovery-friendly workplace, strategies to promote recovery in the workplace. And Colorado, you're one of the leaders in this movement. So this data is real. I don't want this to be shared as shock and awe, but this data was from the Journal of the American Medical Association. And if you look at this, suicide risk 10 times higher for individuals with alcohol use disorder. For persons using alcohol, it's between 6 and 8 times higher. 14 times higher for individuals injecting drugs, and 17 times higher for individuals using different drugs. And it's something that we don't talk about even in our suicide prevention. We know the data better for opioids, so I won't really go through that, but the CDC tells us 56 per 100,000 workers in construction die by suicide. In mining, it's 72 per 100,000. But the data within overdose is higher yet. The highest in construction among 19 major industry groups. And yet, we barely talk about it. What we need to do is shift from the problem of substance use to the solution. And the solution is recovery. So to do that, I break stigma every day. I met an incredible professional through an association on LinkedIn. His name is Nathan Smitty. I met him as a community activist and a harm reductionist in California. He recently moved back to his home state of Tennessee, and he's doing public health in Appalachia, close to the hotbed of ground zero for the opioid crisis. And Nathan inspired me. He said, "Cal, you inspire me, the work you do in construction." I lost a friend in construction. He died alone in a porta-john. He died of an overdose. There was no Narcan on site. Thanks for the work that you're doing. Last February at the 4th Annual Construction Mental Health and Wellbeing Conference, also known as Construction Working Minds, I was asked to do a keynote on overdose prevention. I wore a sweatshirt that Nathan designed. It says naloxone saves lives. I've heard from 10 individuals that me being provocative, wearing that sweatshirt, persuaded their companies to do naloxone in the workplace. Today, with this distribution, this will be the biggest distribution of naloxone I'm aware of in the construction industry. So I don't know everything, but I do know a lot, and I'm really, really proud that I'm here today to get to photograph it with everyone else. So to that, naloxone saves lives. Would everyone just repeat that with me? Naloxone saves lives. Perfect. So I had intended to wear a sweatshirt today because I like to be sassy sometimes. I'm a pretty serious guy. But I find in construction, sometimes we have to be bold. We have to have a little swagger. We have to be a little sassy. One of my former colleagues, when I worked for the contractor in Washington State, she saw the work I was doing. She was very touched to see what was happening on LinkedIn and social media. She saw a lot of families were connecting with me, people reaching out to say, "Thanks, I lost a child to overdose or to a suicide. Thank you for the work you're doing." It was incredibly humbling. It was incredibly sad, but it was incredibly motivating to say, I've been lucky in my family. I've been blessed and fortunate. Not everyone has had that same opportunity. I'm going to put additional time and effort in. So when she gave me the stigma schmigma, she made some matching water cups, and she started seeing the families that were responding. And she'd say, "Do you happen to have an address for them?" At first I thought she was sending a card. She was sending a water bottle, and she was sending a sweatshirt. So I intended to wear that today, but your unexpected seasonal temperature high made that too hot and sweaty. I would have been melting up here. But I did want you to know I used that expression at the White House in 2016. Dr. Sally Spencer Thomas brought 5 males to tell stories of what we were doing in our industries. It was a conference on men's health. And I was chosen to represent construction. There was another gentleman as well named Chris Carlo from Florida. And he does work with the SMART union. Each of us was given 4 minutes, except I was given more because someone said, "You have more to say." But what happened is I got to the 3-minute and 50-second mark, and I'm like, it's time. And I'd prepared this ending for drama. And then when I got to the end, I said, I'm almost out of time. And so before I do, as I always say, and I pounded the table with a little extra zeal, stigma, schmigma. Does anyone have any questions? And a hand shot up. How do you spell schmigma? And I'm like, yes, I got my soundbite. And that was a good thing. Dr. Richard McKeon, he was running SAMHSA in the suicide prevention group. Excuse me, who only gave you 4 minutes? I'm like, oops, probably wasn't supposed to say that. And he said, I think you have more to say. What else would you want to tell us? And so I took a couple extra minutes, and he said, I think you still have more to say. I do, sir, but I want to be respectful of everyone else who hasn't yet spoken. And he said, we got time for everyone. Tell me what else is on your mind and what's on your heart. And I said to him, I worry that this industry is still underserved. Despite the efforts that I foresee, I'm worried that we don't have enough support from federal agencies. And he said, well, we're going to have to do something about that. And then he said, what's interesting, in your industry, you're applying a public health model to an entire industry. No one's ever done that before. And I'm like, we are going to build the best army of helpers. So I've always had that person supporting us, and his successor is a gentleman named Brandon Johnson, and Brandon Johnson is the same way. And today, 10 years later, there are 8 different groups doing work nationally on construction suicide prevention. That doesn't even include the associations. So this is utterly amazing. Let's put the same focus on substance use, prevention, opioid risk reduction, and opioid overdose reversal. We can save lives. So what I wanted to do is shift quickly. I love this expression. I wanted to just share it with you. This t-shirt, label jars, not people. Labels are for filing. Labels are for clothing. Labels are not for people. We still put too many labels on individuals. That's tennis star Martina Navratilova. So now I'd like you to join me using Slido. Scan the QR code or enter a new window on your browser and type slido.com and enter that 7-digit code. This should be working fine. I'm going to double check. Mine is still working. If you're successful, a blue bar, stigma schmigma. I'm seeing some people give me thumbs up. It's kind of a weird thing. You use technology and then you have to ask an old school question. By show of hands, how many were able to launch Slido? But I want this to be interactive, so thank you very much. I'll go to that first question. The QR code will be available on each of those polling questions. What I believe most strongly about addiction is that it is a character flaw, a moral failing, a bad habit, or a complex treatable chronic health condition. There'll be questions I ask later that will be multiple choice like this. There'll be questions that are open-ended. What I have seen in the last 5 years is what gives me hope to continue doing this work. 5 years ago, the first 5 times I asked this polling question, it was 75% of people said a moral failing, a bad habit, or it was a personal problem. Today, we have 86% describing it as a complex, treatable, chronic health condition. Those complex, treatable, chronic health conditions have what are called comorbidities. They affect our health in other ways. They impact the quality of life and they impact the quality and quantity of life. This is powerful to see that move in the last 5 years. Much like I said 10 years ago, if I could get people talking about this, maybe we could do something about it. To see that shift in 5 years is half the time it took on suicide prevention. So the model that we used for suicide is working with substance use. So thank you very much for your answer. And some of you have had experiences with loved ones or ourselves who don't always see this as a chronic health condition, and I understand that. But I would like you to see this definition from the American Society of Addiction Medication. You can follow along. I love how those words are emboldened. Addiction is a treatable chronic medical disease involving complex interaction with brain circuits, genetics, the environment, and an individual's life experiences. That's the most diverse definition that I've seen. It's almost the most accurate. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. It's why sometimes with our loved ones, we don't understand why they don't just stop, why they can't stop, because it's a disease of the brain. And the brain has been wired, and it responds to the addictive substances and the addictive nature. Here's where the hope comes. Prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. Cardiovascular disease, metabolic syndrome, and many others. We have the opportunity to bring people hope, but we have barriers to care. I don't need to be redundant because the introductory speaker from Spark covered those topics very clearly. We have very many barriers, and sometimes it's us not understanding the benefit programs we have available to our workers. We need to have more curiosity. We need to be asking more questions. We need to be challenging the system. We need to be advocating on behalf of workers and their families. We don't take it as the status quo. You're consumers of these health plans. If you want more support and services for our workers, we have to specify it. We have to tell our brokers, our patients, or our family members deserve more. The dependents on these health plans depend on that health benefit. So I just wanted to make that as a quick promotional plug. Now here's another question. One way to break stigma is just to be open and honest. I have experience with substance misuse and addiction, and I did put substance use disorder in parentheses. You have opportunity to vote multiple times. For the audience, this will show a cascade of what we see in our whole group. And there'll be patterns that emerge. And we'll talk a little bit about those, but we'll probably mostly go on. And so I'm seeing what now have been pretty predictable patterns. I've been able to ask this question over 150 times to different audiences. It's always anonymous, but I have the idea of what I'm looking for. 76% with friends, neighbors, former classmates. Within my birth and extended family, 60%. With coworkers and business partners, almost 50%. For myself, 26%. So thank you for your honesty. Only 8% don't have this experience. That means 92% of us have that experience. And that's what I typically find in a construction audience, higher than what those national averages would be. But then I want to ask, have you ever had a hard or straight talk conversation with someone close to you about substance use or misuse? There's different categories. If I did the poll right, you should only have one choice to vote, and this will show us where we're at collectively. Nuts.
Just pick one, right?
Please just pick one. Operator error. I was a little fatigued. Stop making excuses. Terry Olson knows I hate when I make a mistake. I'm a recovering perfectionist also. Thank you, Nick still loves me. My apologies for that. What I was hoping was to set that one properly for just one. So even when we've been around it, we don't always know what to say, when to say it, how to say it. And so when I look at this, though I held back and left things unsaid, almost 50%. Almost 40%, yes, and it mostly went well. And then, no, I never thought it was necessary, less than 10. No, but I have thought about doing so more than once. So that 43%, that's the bubble. What I think is really important is if we lean in and learn more about recovery, we have more to talk to people about. And the shift goes from the problem to the solution that I talked about. Here's another thing I want you to think about, because I've found this pretty consistently, even in our industry. where we know about the overdose risk. List the substances you've talked to youth and young adults in your life about. List the substances that we've talked about with youth and young adults. Now, since I'm not voting, I'm not going to see the same results. I'm going to need someone to tell me what the answer is for that lowest cocaine and methamphetamine. It looks like it's going to be about 50%. And that's about what it is. Thank you, Mike. So 91% on alcohol, 78% marijuana, cannabis, edibles, vaping, 71%, tobacco, 57%, opioids, 55%, cocaine and methamphetamines, about 50%. So despite us knowing the risk of opioids, by doing things like naloxone, most of us don't feel equipped, educated, or empowered to talk to our youth and families in our life. Heather Gutierrez is one of those people. Talk with her about how to have those conversations. She is a total, I think I can say the word badass. She is a total champion for this, and I just admire, Heather, the work that you, your family, your company continue to do. This shows me how much stigma there is. We wait to have perfect information before we have those conversations. The number one thing I hear from people when I'm having meetings is they're not going to tackle alcohol. So we are talking to our children about it, but we're not talking to our workers about it. It took me 5 years to persuade 5 publications I write for regularly to do articles on alcohol awareness. We'd been writing about overdose, but they didn't want to take on alcohol because they weren't sure what the editors or what their readers were focused on. That was one clue. Second, thank God they're just vaping, but they don't know what the children are vaping. These concentrations of THC in the 95 to 98% range are not like THC from yesteryear, where it was 2, 4, maybe 7%. And you'll see the impacts on the undeveloped mind. You have clinicians in the room today who can speak more to the induced psychoses and the hyperemesis, like the perpetual vomiting that occurs. I will stay in my risk management lane and just educate you. Don't say, thank God it's only vaping, if you don't know what substances are being consumed. Same is true on tobacco, and you'll see the chronic health effects from tobacco and vaping. Opioids, one pill can kill. So one takeaway I hope everyone has is to go home and talk to loved ones about the risk of opioids. It continues to be real. The drug supply is contaminated, and people are being poisoned by the substances that are in fake, counterfeit pills. Have that conversation. This has been one of the biggest disconnects. We have educated people to know that our industry has a high rate of overdose, the highest number of fatal overdoses among 19 industries, but only about 50% of us have talked to youth and young adults about that risk. I was really encouraged today. A gentleman that I only know by telephone, thanks to that webinar we did 3 years ago. Russell, I hope it's okay that I call on you, but Russell stopped me as I was introducing myself. I recognized his name, and then he said, do you have a link to a video of a webinar you did? It involved a mother and a daughter who lost their son and brother to an overdose. And that webinar was called A Tale of Two Surgeries. The brother was lost to an overdose that started with his first injury in sports, prescribed opioids. And the mother, when the daughter injured herself playing D1 softball, said to the same doctor in the same health system 5 years later, we're not doing this again. You've killed my son, I'm not losing my daughter. And she said, Cal, Mama Bear came out. And the daughter came and participated in that webinar. And we were teaching people about alternatives to opioids so we could stop first dose exposure. We call it first dose prevention. In most of our health plans, we let the healthcare systems educate the workers, except they don't. I've seen people in recovery, including someone released from inpatient care, 7 days later having surgery, being prescribed opioids during the surgical process. And I know people who have delayed surgeries 5, 7, 10 years because they fear that exposure. The healthcare system doesn't always listen to individuals. We have to teach people how to be better advocates. Any of us that have responsibility for our health plans need to educate that we need more help. It's not working for individuals. So that's why I wanted to share what Russell said. So here's what I wanted to share. My colleague Rana Yablonsky and I have been working with some associations. What we found is the associations are bringing in emerging leaders. Most of those emerging leaders have young children. They want to learn how to talk to their youth and young adults about how to talk about substance use prevention. The Construction Users Roundtable, I've been writing quarterly articles or blogs for them since 2020, and they allowed us to talk about how to talk to youth about mental health. And then recently, they allowed us to talk about how to talk to youth and young adults about substance use. If these 6 or all 23 associations want to do a webinar, I'll bring my colleague Rana, and we can talk about full spectrum substance use prevention and how to talk to youth and young adults. And it would be our honor to do so. Substance use continues to be the elephant in the room, not only at work, but in our homes. So that's what I want to do, is help you, empower others, and educate you. There's 4 key insights. I used to have to ask questions to get these insights, but it became an established pattern. And so I just want to quickly share with you. Remember 10 years ago, stigma on suicide prevention? It was hard to talk about. It was even harder on mental health because we didn't have the data we had on suicide. We can always rally around that 5-alarm fire. But on substance use and overdose, the stigma is 5 to 10 times higher. That's just been my experience. We also have an over-reliance on drug-free workplace policies because of regulatory requirements for safety-sensitive positions. But they can be punitive, and when they're punitive, it can decrease help seeking. So I want to share a third. We have to continue to move upstream. We have to focus more on the prevention. We often wait for the crisis. It's too late to help someone. I'll explain more. And we have to find better ways to support family. One of the things Nick and I talked about is he said, Cal, you're going to see this entire room with exhibitors, people displaying, people involved. It's a community of helpers to help the helpers. You have access to some incredible resources, people who have volunteered, chosen to be here, some who have sponsored. Take advantage of what they offer. Most companies, if they're honest, don't have 2 or 3 resources listed on how they're going to help an employee, even at a point of detox or a person who says, I need support for substance use. We hand them the EAP info, or we give them the healthcare navigation number, and then we say something like, good luck. It's a hard process to navigate. I made HR nervous when I was a risk manager because I was in the room making calls with employees. You can't do that. Well, if I don't, they might not make that call. And by the way, I always offer to leave, and they never want me to leave. Well, you shouldn't be taking notes. Well, they don't know the language as well as I do. I've had more experience. I've had more knowledge. If I take notes, they can focus on listening, build a relationship, establish trust, and if they have a rapport, they're more likely to follow up. I'm just the decoder ring. And then I explain to them, now with all that information you were given and the choices that have to be made, is there someone else in your family that we want to involve? Yeah. And maybe it was a mom or a dad. Maybe it was a young worker who was living with a grandparent because he doesn't have parents. Or it might have been a godparent because my parents are going to kill me, right? Because everyone had that anxiety. Sometimes it was a spouse, a partner, significant other. Occasionally it was a brother Or my sister's really good. She's helped me through crises before. I can always count on her. So I had those conversations and we helped people. And the amazing thing is, when someone gets help, what do? They help others. It becomes this ripple effect. So I just want you to know, relying or over-relying on the EAP or that healthcare navigation number probably isn't enough. So what I say is we have to roll up our sleeves and offer support. And HR and employee benefits, I'm not calling that out. We just were never trained that way. I learned the unconventional way because I knew people didn't understand. Because I'd done that myself with my family, and then as we raised 5 children, we recognized the squeaky wheel is the one that gets support. So I learned through trial and error, navigating that healthcare maze myself. So here's what I want to say. I used to ask a series of polling questions, and I would ask, do you provide resources on substance use, addiction, treatment, and recovery? And then 70% would say yes. But what I found was 80% did so after 5 events. And about 90% of the info we shared was the EAP and the health plan. We weren't sharing info about 12-step and non-12-step plans. We weren't sharing information about our health model. We weren't teaching about alternatives to opioids. It was a very vanilla response. So what I wanted to share with you, there were 5 triggering events. And each of these was a crisis. It showed me we weren't doing enough upstream. It was a refusal for someone to take a substance test. It was a confirmed positive drug test. It was a motor vehicle infraction, either in a personal or a company vehicle. The 4th was a performance-related issue or a disciplinary action. And usually it was kicked someone to the curb without knowing what support would be available for that person. And the 5th, and often the most painful to be part of, was a person who said, hey, I can't come to work tomorrow. I got something going on. How can we help you? I'll be good. Well, we do need to know. Can't help you if we don't know what's going on. Well, I have a court hearing tomorrow. Or, well, what's going on? And it was usually a DUI, or it was a domestic, or a disorderly conduct because of a bar fight. Or I'm helping a family member with a crisis. And frequently that was someone in detox seeking treatment or recovery, or it was a person who made a suicide attempt or survived an overdose attempt. Or, in the worst of cases, I'm preparing for a funeral. We lost our nephew, or we lost my son. It's too late to hand someone the EAP number and say good luck. They're already in the system, and it's too late to hand them the healthcare card, because that's not going to help you with a legal matter. So what I say here is we have to be more proactive, we have to be preventive, we have to move upstream. All right. Big issues, but I needed to challenge the status quo. Remember, for 30 years I've been a safety and risk management professional. I've been in your shoes, I know how hard that is, but those are patterns I've seen across this country in our industry. So here's the idea of stigma. I thought we could build a caring culture. I didn't know we had to tear down a wall before we could build the culture. That stigma was an invisible but real wall. It kept people from seeking help. It kept people from feeling connected. They felt isolated, alone, rejected. Sometimes they felt betrayed because no one understood them. So we've covered a lot of that with our work with suicide prevention. But what I love about this shows a demolished wall. But then look, the bricks have labels. And we need to take away those labels so people don't feel shame. And we need to normalize this, we need to humanize it, we need to give people the opportunity. So here's where I'd love your participation. This is a word cloud. What are consequences of people feeling stigmatized related to substance use, substance misuse, or addiction? What are consequences? You can do human consequences, you can do organizational consequences. But with this many people in the room, this word cloud should be full. It should be overflowing. You'll notice the more times the word is used, it adds size and color. And we'll just wait as that fills in. I'll ask the opposite question in a moment, so start thinking about benefits of people not feeling stigmatized. And you'll see the culture we want that will make us employers of choice. It'll make us an industry of choice. So if you look at these adverse consequences, shame, isolation, guilt, death, suicide, loneliness, depression, helpless, ultimately loss of job, mental health crisis. So thank you for that. That's a reflection of what stigma creates. But it also creates a culture of silence where people don't ask for help. It makes it so it's hard to offer help. And then if it's not being offered, it's hard to accept help. So thank you for that. I want to shift to the benefits of people not feeling stigmatized. So what are the benefits? What does it look like in our cultures? What does it look like in our families? What does it look like in our workplace? And I want to see some amazing words. The next gen of this tool will combine words like empowered and empowering. But for today, look at that. Recovery, support, hope, healing, freedom, happiness, motivated, connection, love. It's pretty clear what type of culture we want and the type of culture that we're intentionally building in construction. Nick used that word, intention, in getting this group together. We did so we could break down stigma. Thank you. At the table, I'm sharing with Melissa Woodring from Red Rock Recovery. I have some of these No Shame Pledge paper forms. You can scan that QR code. You can send yourself a signed No Shame Pledge. On the No Shame Pledge, there's 4 principles on the backside, but I wanted people to know it's a tool for your toolbox. It's available for you. We have these in postcards in both English and in Spanish. The program is being revised, so I didn't want to bring the old supply. After January, this will be revised and available. But this is an opportunity for toolbox talks, for seasonal kickoff meetings, the opportunity for an all-employee meeting. It's a tool where Nick and I bonded several years ago. It's where I got to meet Heather at that AGC meeting, so I definitely wanted to share it with you. We also have a program called the No Shame Education Program. It's downloadable, free PowerPoint, and many construction companies are starting to use that to build their own program. So those are 2 real tangible tools. And then what I wanted to do is shift this to this definition of recovery. I find very few people have heard this definition. It dates back to 2010. Recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. What's amazing about that definition? There's no mention of mental illness, no reference to addiction, or even to sobriety. It is about wellness. So in our companies, a way to break stigma is to embrace this concept of total worker health. It's not just a concept. It's a toolbox full of resources. Many speakers today will be addressing concepts from total worker health. But at the intersection of physical health and emotional well-being is worker well-being. That is powerful. We're not focusing on the problem of mental health. We're shifting to mental fitness. And that's a movement that's really exciting. So I wanted to ask this question. I believe I only gave you one opportunity here. No, I gave you multiple. Do you identify as being in recovery? And I put quotes in recovery. The choices were I'm in recovery, I'm an ally, I'm an advocate, I'm a champion, or not yet. I'm still learning about recovery. And I thought this would be really interesting. I've not done this question this way, but 27%, not yet. I'm still learning how it can play a role in my life, in my workplace, and in my community. 40%, I'm a recovery ally and support the cause. I'm a recovery ally for family, friends, and coworkers, 32%. 16%, I'm in recovery. And then that champion of recovery, 13%. If you helped plan this event, you're a recovery champion. If you helped stock naloxone in the overdose prevention kits, you're a champion. If you're out in your community educating students, young adults, apprentices, you're a champion. So what's important is recognizing we all have a role in recovery. We had to teach that about suicide prevention years ago. We also had to teach that language matters. For many years, when we talked about suicide prevention, we had to unlearn the way it was reported, the way it was communicated. It used to be heavily stigmatized. Words like people committing suicide were very common and prevalent. We had to teach people to restore honor and dignity to the deceased and to stop blaming individuals for wanting their pain to end. We have to do the same with substance use. We have to change the vocabulary. We have to change the context. And we do so to break stigma using person-first language. It's describing a person with substance use disorder, a person with alcohol use disorder. We put the person first, not the label, not the disease. It takes away the stereotype, it takes away the blame, it takes away the shame, and it creates empathy, much like relearning how to talk about suicide prevention. This creates inclusion and belonging. And in case anyone wonders how important that is, here's a report from the Harvard Business Review that looks at the impact of belonging at work. 56% increase in job performance, 50% decrease in turnover. I could continue. People who are engaged, feel like they belong, are better employees, and so are people in recovery. So here is where I want you to help us crowdsource a list of tools. What techniques and methods do you use in your family, your community, your workplace to decrease stigma? In a few words, as few as possible, what techniques have been helpful for you? It could be one-on-one conversations. It could be a book club and sharing information. It could be printed wallet cards. It could be hard hat stickers. It starts with look at this list. Oh my gosh. I'm seeing NA beverages, non-alcoholic beverages, jumped out. Sharing stories, vulnerability, positivity, prayers, mentoring, check-ins, encouragement. These are things we didn't used to talk about. They're starting to happen. They're becoming daily practices, and we're changing the culture of our industry. Week after week, month after month, as I travel different places, I have people tell me our industry is different than it was 3 years ago. And I'm like, look back 10 years. We're at the point of generational change. And when I see these ideas, it's incredible. I'm seeing something like talking. Just talking about it is a start. But there's so much more we can do. So I've given you a few tools. I'm going to share a few more with you. And then I know I have to think about wrapping up. This book was really powerful. It was written during the pandemic. I remember reading it. David Shapiro invited me to be part of a webinar. I referenced the book there. The author reached out to me. I wasn't working for Safe Project at that point, but she offered to send 20 copies to the people that became my colleagues at Safe Project. because she said, I want to thank you for the way you've supported my book. I've heard that you do this often. That book has been a powerful resource. I have a special bond with Heather, thanks to Nick for introducing me. We are featuring Heather not only as a naloxone superhero, but she introduced me to her company and the culture that they're building at JHL Constructors. Joe Taylor took photos, and this was the image that we decided that we would show in advertisements for Construction Business Owner and Engineering News Record. And you'll see every hand in this photo carries a different story, but they're united in one mission: ending shame and saving lives. From job sites to break rooms, recovery belongs in every workplace. Let's keep showing up for each other. To have a company leader like Ben is amazing, what he's been willing to do and to promote and encourage. And Heather will share her story of how the organization supported her and how she supports them. But today, it's everyone supporting everyone. And that image is incredible. It's what gives me hope. What else gives me hope and what helps break stigma is storytelling. It's individuals sharing vulnerability, sharing from the heart how life is different for them. Another person I met through this incredible community in Colorado, through Melissa. I'd invited Melissa to be featured by sharing her recovery story, and she said, you need to meet LB. So Laura Beth Burkhalter is another person who's incredible. And read that quote: we can't give up on people before they get their chance. I'm proof that the story doesn't end at overdose. She was revived by naloxone, and she has lived to help others. She owns and operates 3 recovery centers for women in Colorado. And she's helped 200 women with their sobriety and well-being challenge. That's how we amplify hope, is by storytelling. In Colorado, there's a gentleman who runs a program called Roofers for Recovery. And it's amazing. He's helped close to 200 roofers find their path to recovery. If you want a powerful story about overcoming trauma, of substance use, being sexually abused, among other things, Shauna Clausen is a person I've known for many years, and I invited her to share her story, and it was amazing. The people we've worked on with national public health campaigns had no idea, but she finally said, I feel free to share my story, and it's powerful. There are not enough people willing to share that intersection between substance use and suicidal ideations. So this is a really hopeful story. And then I'll share, Vulcan Materials is one of several companies. They put naloxone last year in 550 operating facilities. Yesterday, while I was traveling, we took a call with a national drywalling contractor that has 62 different operating entities. They're ordering 170 cases of naloxone, and by January 1st, they're launching their new program. Every month, there's more companies taking incredible actions. So I wanted you to know how important those stories are. It's why we post them on the Safe Project website. If you have a story to share, if you know someone that should be amplified, please reach out, share with me. Nick introduced me to John Narain, and David Shapiro had previously offered to, but I met John. I'm so impressed with the work. Been reading his book, Recovery Friendly, his book, he's with Recovery Friendly Leader, and he has an incredible book about managing or leading workplace addiction. So I just want you to know there's plenty of resources. We didn't used to have these. They're available. So as I move toward conclusion, here's a quick question. I plan to use the No Shame Pledge in my organization to begin or continue teaching employees there is no shame in help seeking. And give me honest feedback. If you're not sure yet, check it out at the table. I hope that stack is gone, so I'm not taking them home with me. We're averaging right around a 8.8. It's a powerful way to break the ice. The last question I'm going to ask you, what are the top 2 action steps you'll take or recommend in your organization? So thank you for that. And then I have one closing comment. Top 2 action steps you'll take or recommend. I'm going to leave that open. This is going to cascade. And the ideas you list will be shared with others. So we're going to share this and allow you to crowdsource other ideas. So I'm grateful that we've had this time together. The journey has come a long way. I wanted to share a powerful quote one of my colleagues shared. It's from a gentleman who talks a lot about full spectrum prevention. His name is Dave Clausen. He said the best prevention programs and the strongest recovery journeys are both about helping people become their best selves, not just avoid their worst moments. That's the promise of a life in recovery. Let's encourage others to find that path, and let's make it be in construction. Thank you very much, Colorado. Nick, thank you for the opportunity to be with you. Enjoy the rest of the day. Thanks, Colorado. Thanks, man.
Cal's a friend, a mentor, and just somebody I love very much. So thank you, Cal, for being here. 2 logistical things. One, we're going to go right into the breakouts, okay? No break. So in this room, this is track 2. It's called Workforce. What is it called? Workforce Wellbeing and Leadership. I can't remember what I wrote, right? And then track 1 is in the room right next to us. It's called Job Site Safety and Risk Management. So make sure you're in the right place, and we'll get started with the presentations in 5 minutes. This right here is the showcase thing that you need to get filled out if you want to be eligible for the drawing later. And if anybody wants to take a look at that truck that's out front, that fitted out truck, go talk to the fellows over here at Ed Bozarth. They'll give you a tour of that fitted out truck you walked in. All right, let's get started with the content. Thanks, guys.
All right, well, I'm going to get started for the sake of time. Welcome to our session on transformational leadership in construction. I'm Natalie Schwatka. I'm an associate professor at the University of Colorado on our Anschutz Medical Campus in our School of Public Health. My background is in occupational safety and ergonomics. I have been working with the construction industry for 15 years or so. I do want to say that I don't have lived experience working in the industry, but I have worked with folks like you for 15 years or so on projects on how to keep construction folks healthy and safe on the job. So, and I'm just going to say there's a delay between what I'm saying and what I'm hearing, and it's throwing me off. Thank you. All right, so I'm with the Centers for Health, Work, and Environment. We educate future leaders, so we train students to be healthy and safe professionals. We do research on how to keep people healthy and safe, and we focus on designing practical solutions with users, businesses, and workers. And we use a total worker health approach in all that we do. And I'm going to talk about that first before I get into the topic of today's session, which is on leadership. And our focus is on improving the overall health of the worker. So the agenda for the next 50 minutes or so is to talk about total worker health first as the key outcome for leadership. Talk about why leadership matters, and then I want to take you on a journey on what effective leaders can do, from what you can personally do as a leader, you all are leaders, what you can do to start using those behaviors to change your organization's strategy to workforce health, and then blowing it up even more to thinking about how you can work with other people, sharing leadership responsibility, distributing that influence so that you can have a greater impact. And then I'll close with some resources. All right, so my goal today is to help you leverage your leadership to apply the total worker health approach in the organization that you work with, or if you work with multiple ones, do that as well. And what I mean about total worker health is that first and foremost, we want to protect people from becoming injured on the job. But we also recognize that people have various mental health challenges. They have lives out at work. There are things like chronic conditions that they need help supporting. And so we will also want to think about promoting their mental health and physical health. And we do that through systematic work design. And total worker health encompasses everything you could probably think of that would touch employee health. There's things in the workplace, ergonomics, safety, chemicals, the built environment, the way we interact with technology. There's also the psychosocial, a little bit of what Cal was talking about earlier. But also stress coming from the work, burnout, how demanding your job is, relationships in the workplace, career concerns, and also employment, like how much do you get paid? What benefits do you have? What are your hours? Do you have EAPs? Do you have work comp insurance should you be injured? And then life. We also have lives outside of work. We have families. We have needs for housing, transportation, and also things like generational differences impact health in the workplace. And so I want you to turn to your partner, a person next to you, introduce yourself if you don't know them, and say one thing right now that is concerning you that in your workplace. And it could span any of these issues. Take 2 minutes. And you're welcome to get up and move too if you want to. Take just 30 more seconds. All right. Does someone want to shout out the one thing that is concerning them right now? Just get a couple examples. Just shout it out. Accountability. Okay. What else? Other example? Burnout, for sure. Work-life balance. Yep. Always a struggle. All right. So in our total worker health approach, we rely on the hierarchy of controls, which I'm sure many of you use, are aware of. And we use the same principle. We want to address working conditions before we think about individual behavior change. So what in the workplace is contributing to burnout? What in the workplace may contribute to stress? What's contributing to folks not wearing their PPE all the time? Get to those root causes. And obviously there's cases where you need to focus on encouraging personal change, giving folks resources to AAPs or giving them training on safety. But those shouldn't be your only tools in your toolbox to achieve total worker health. And so that means organizations have to change. You can't just change individual people, you have to change the organization. And there's two ways you can do that. The first way is transactionally, through policies and programs and practices. That's often where we're inclined to start first, it's easier. But we also have to change organizations transformationally. We have to think about leadership, we have to think about culture, we have to think about what's driving behavior when no one is looking. And so today, we're focusing on leadership because in the research space, I'm in academia, so I'm going to share some academic facts with you. The research in total worker health intervention research shows leadership commitment is such a strong predictor of how effective new total worker health initiatives are. Other things matter, but they're very much directly influenced by leadership. So worker participation, evaluation factors, resource allocation, communication, prioritizing hazards, complexity of work sites, all of these things can be influenced by leadership. And if we want to influence that systems change in the organization, we have to think about building stronger leadership for total worker health. And in leadership research specifically, we see that leadership is a critical facilitator. It appears in nearly every successful study of folks trying to apply the total worker health approach. Things that matter include having visible leadership, committed to health and safety. Leaders set the tone for participation. So if you want employee engagement in an initiative, leadership sets the tone for that. And culture follows leadership. So what leaders are doing over time, consistently or inconsistently, is going to influence the culture of the organization. But the challenge is that leadership development opportunities in businesses is lacking. And if they have it, it's maybe a one-time training and not so much support on actually using those skills on the job site. So in my research with Colorado employers, I found that employers immediately, when they think about total worker health, a lot try to say, okay, we have to change employee behavior. We need to get them to use this resource, do this training, wear this PPE. But what they don't know is that that is indirectly influenced through their leadership. And so employee behavior, if you know health behavior theory, it's influenced by how motivated someone is to engage in that behavior, right? But what influences that motivation in the workplace? Well, the data shows that if they think that their leadership in the organization cares about their health and safety, consistently communicating that care, that's going to increase their motivation. And what influences those perceptions? It's leadership. Of course, having the right policies and programs matters, but what leaders say and do in support of those policies and programs matters a little bit more. And there are lots of leadership behaviors that leaders can use in businesses, and some are better than others. I don't know if any of you have had an abusive supervisors, but I bet you can tell how poor of an impact that those kinds of leaders can have on people's health and well-being. But there's a lot of people who fall in the middle. There's a lot of folks who care about their employees, but they don't take steps to act until it becomes an issue. Or maybe don't even act. They just assume someone else is going to take care of it. Those kinds of behaviors don't elicit good health and safety outcomes. But transformational leaders do elicit the best outcomes according to the research. And we'll talk about those skills in a second here. So this figure is really important. And I think it's interesting because when we're talking about injury prevention, which is very important in construction, the way we get there can be done a couple of ways. The first way is through transactional leadership, which is more like it's a good kind of leadership. You're focused on tasks and getting people to complete those tasks in timely manners and with good quality. That kind of leadership will make employees think that you care about their health and safety if you're also talking about it at the same time as other tasks on the job. That kind of leadership increases compliance with safety protocols, which in turn can increase occupational injuries and illnesses. So that's a good kind of leadership. But if your goal is to get folks more proactively engaged in your health and safety efforts, the way that happens is through transformational leadership. So leaders who are role modeling, inspiring, and motivating, and providing recognition and feedback to folks. You can use both styles to elicit positive health and safety outcomes. But if you want that true engagement, you need to focus on those more transformational leadership styles. But what's interesting is, back when I was in grad school at Colorado State, another student in the industrial organizational psychology program did a study with about 1,500 construction workers. Some were here in Colorado. What she found was what all of the transformational leadership styles that like a foreman on site could use, the one that mattered most for injury prevention was related to how people saw them for health and safety. And that's, you can think about that in two ways. The internal qualities that people have, their values, their integrity, how trustworthy they seem. Are they respected by others? Do they have good moral character? And also how they're visibly displaying that on the job. Are they doing the right thing even when it's hard? Are they putting the team before themselves? Are they being consistent and reliable? And do the decisions that they're making on a day-to-day basis reflect these values? So the punchline is there's lots of great things that transformational leaders do, but workers will feel safer and more supported when they can trust who you are and see your values in action. In the academic literature, there's a lot of leadership research, so much leadership related to a variety of outcomes in businesses. But as it relates to health, these are all the things that I could find on what leadership is linked to. So it's related to injuries, like I've been talking about, burnout, satisfaction, but it's also related to things like disability, sickness absent, heart disease, stress, depression, sleep quality, blood pressure, substance misuse, smoking. So leaders on the job have a powerful influence on their workers, whether they know it or not. And I'm going to go through 5 critical leadership skills that's framed around the transformational theory of leadership for construction. This stems from my project called the Built to Last Toolkit. This is a NIOSH, or National Institute for Occupational Health and Safety, funded research project. We're in year 2 of 5 of the project. We've developed this toolkit with the idea being that we want to support those in construction who are working to build health and safety and mental well-being efforts. And part of our toolkit is a leadership training. And the skills that we teach are listed here. I'll go through each of the 5, but they're based on the Foundations for Safety Leadership Training. Has anyone heard of or delivered that or been part of it? Thanks, Nick. So the FSL was something that my team and I developed about a decade ago. We tested it with Colorado subcontractors, and right now it's taught nationwide. It's an OSHA 30-hour elective. I think about 1 million construction workers have taken it so far. And what we've done is updated it to have it not only talk about how you can use these skills to promote safety on the job site, but also promote mental health and well-being. The first skill is leading by example. This is one of the most important skills, especially because of what I said about earlier, about how people see you matters the most. And this starts with demonstrating a positive attitude about safety and mental health. Don't put down initiatives that maybe your employer has for safety or mental health. And doing so, talking about in a way that shows that you make this a core value of the way that you and your team gets work done, and you have a vision for workforce health, that you communicate, for example, when we're doing our work to be productive and produce great quality product for our customer, we're gonna do so in a way that doesn't harm our health and well-being. You establish expectations. So you establish that everyone is going to own health and safety and mental health on the job. Everyone has a role to play, and we need to do so consistently. One of the easiest things that you can do today after you leave is to start to walk the talk. Follow safe work practices. Take care of your mental health and find good ways to cope with stressors that you're dealing with, including asking for help. And starting the conversation about mental health in the workplace. I'm sure lots of leaders in the job site hopefully are talking about safety. They've been doing so for decades. But now it's time to start talking about mental health and well-being with teams, which can be really hard to do. But it's so important to break that stigma, like Cal said earlier. The second skill is engaging and empowering team members, which means explaining first and foremost why it is critical to work safely and in ways that support mental health. And this involves engaging and empowering other peoples, not just yourself, to act and identify upon unsafe and unhealthy situations. And they can do this by asking for help when they're overwhelmed, burnout. If you're feeling overwhelmed or burnout, ask for help. Reporting working conditions concerns. And so going back to that list that I showed earlier in the conversations you were having amongst yourself, report those concerns to folks. If people don't know it's a concern, it's not going to get managed and approved. Having folks participate in decision making. If you want to, implement some new mental health initiative, get folks' opinion on it. Make sure it makes sense for them. Make sure they need it in the first place. Get their input on how you're going to roll it out across your job sites. Supporting coworkers in need and stopping work if unnecessary. The third skill is actively listening and practicing three-way communication. This is one you can use with your small children as well. I use three-way communication with my 5-year-old. Make sure she's listening. This one is, an idea of we want to be actively listening to what people are telling us. Treat them with respect. Don't be looking at your phones, working on your computer, finishing your task. Make sure that they know you're listening. Pay attention to nonverbal cues. A lot of times our body language can give us more clues into how people are thinking and feeling than what they're saying. Are they slouched? Is their hygiene changed? Are they not looking at you? Were they once really social at lunch, but now they're eating lunch in their car? And then, if people are willing to chat with you, listen to hear what they're saying versus to come up with a response. I'm certainly guilty of this, but the risk of doing that is that you're not going to hear everything they're trying to tell you. And then ask clarifying questions to make sure you understand. And for the three-way communication piece, making sure you have folks' attention. Be very direct and concise. Ask them to repeat the message, clarify misunderstandings. This makes a lot of sense for safety-specific situations. It could make sense for mental health, too. The fourth skill is developing team members through teaching, coaching, and feedback. Teaching and coaching involves helping folks do something better. It's not necessarily always telling them what to do, but coaching them towards a better solution to help them learn. Treat them with respect. You know, if folks are doing something the wrong way, don't automatically blame them and focus on their behavior. Focus on the task so that they don't feel defensive and they're willing to learn. You know, after you've found a solution and you are ready to move on, watch them fix the hazard. You know, if they're trying to learn how to wear fall protection, watch them try to put it on. So you can make, you know, corrections as necessary and continue to check in with them as needed. And when you're giving folks feedback, the important thing here is to focus on facts, not the person. When you start blaming people, they get defensive. And so focus on exactly what the situation was that was happening, explain the impact and consequences, provide suggestions, and be timely. And another kind of feedback is our last skill, recognizing team members for a job well done. This is the positive side of feedback. It should be done separately and just as frequently, if not more frequently, than the sort of negative or constructive feedback. And be timely, be sincere, and be specific about why you're praising people. This is often the easiest skill, but it's one that a lot of people forget. I know maybe 20 years ago, people were telling me that, you know, if you got a paycheck, that was your praise for a job well done. People need to hear that they're doing good work, that they're trying their best. And the other thing here, and the last thing I'll mention, is that public praise isn't always a good thing. Some people hate that. And so know your team members, only give them that public praise if you think that they would appreciate that. Okay, so I have another activity. Feel free to stand up and stretch while you talk to or find a new person to chat with. But I just went through the 5 skills, and I want you to pick one of these questions and share with your partner. So you can focus on any of the skills or any of the questions. They're focused on your specific leadership, but you're welcome to reframe it on, you know, another leader you've seen on the job site or just very generally about leadership in your company. So take 5 minutes or so and chat amongst yourselves. All right. How did your conversations go? How did you rate yourself or others on at least one of the questions? Raise your hand and we'll run a mic to you. Yeah. Yeah, share out loud. Oh.
We were talking about Michael as a leader really does a good job. Oh, thanks, Adam. Michael really does a good job of 3-way communication, like actually listening and responding. And I was sharing with him, opining really about how I'm not very good at that, and I have to try very, very hard. But then I found by listening really well, I can actually provide a much better solution if I truly understand the needs of an employee, rather than just trying to fix a problem that I think exists, identifying the problem that really exists. That's what was on my mind.
Thanks for sharing. That's another skill I found is useful with husbands and relationships. Active listening with your partner helps. Oh, yes, thank you.
So Mark, Matt and I were talking about sometimes like how we just go in and talk to the superintendent and let them vent to us, right? You know, architect issues, owner issues, and just that venting alone helps it's kind of therapy, right? You know, lets them get some stuff off their chest and at least have someone to listen to, right?
Yeah, I love that. It's a great example, a way of using active listening to support mental health and well-being. Someone else? Oh, right here in the middle, thank you.
All right, so basically, when in class, you know, when addressing everybody, instead of like having small groups, it makes everybody feel more included, you know? Instead of having like small groups, us 3, maybe me and him, we would talk well, but then she'll be like not included. But when it's the whole, I'm addressing everybody, everybody feels included and can like get their word out. You feel me?
I love that, making sure everyone feels included.
Indeed.
So it's using the active listening skills, not just with the favorite few that you're like the most, you're comfortable with the most, you know the most, but talking with everyone and supporting everyone. Love that. Oh, one over here. Excellent.
So I was talking with this wonderful lady over here. Her name is Sherry, and she was telling us about her experience with the help crisis line. And the main thing we were talking about is how you can't always include everyone and expect to satisfy everyone. And she was telling me about how that's a little bit hard, and how at the end of the day you just have to do there and be persistent and always do it. So one example she gave me was they used to have chili cook-offs with their employees, and mind you, they had a very rapid growth, so this was like off like a really stressful time. And she told me how one year almost no one would come, and then the next year like 100 people would come. So it's just about like always staying persistent in the workplace, and just trying to do the right thing all the time.
I love that. Great example. Thank you for sharing. And I think that's really important. I said it earlier, consistency matters. There's actual data that shows if you're waffling between this active transformational leader and someone's a little more passive about it, people can see you waffling back and forth, and that's not going to motivate them to engage in safe and healthy work practices. So consistency visibly matters. Thanks for sharing, everyone. So now I'm going to, if it moves, oh, that's too far. So now we've been talking about what individuals can do, one-on-one with people to support their safety and mental health and well-being using leadership skills. But now I want to take it up a level to using these skills to focus on changing the workplace. And something that we teach at the Centers for Health, Work, and Environment, and shout out to David Shapiro over here, who's taught this model with several employers with me. We teach that leaders need to use these skills as they try to influence their business's strategy. So that's the policies and programs and practices you have. The culture in the organization, which is sort of that employee perspective, and also focusing on leaders' own individual health and safety and well-being, so that you can get towards that goal of changing your organization transactionally and transformationally to have the greatest impact that you can. The first step is the business strategy. And what we teach is the model that is through HealthLinks. If you have questions about HealthLinks, David's right here. It's a great nonprofit organization through our center that provides assessment and benchmarking and advising and certification around total worker health. It assesses business strategy. So when we work with leaders, we're trying to help them understand what tactical organizational supports do they have right now. What are they doing to understand the scope of their health and safety and well-being challenges? What policies and programs do they have around health and safety? How are they engaging workers? How inclusive are those efforts? And are they engaging in quality improvement efforts and continually to improve this strategy? But we also teach leaders about the culture in their organization, which is the employee perspective. There's lots of different ways to think about this. You could do an employee perception survey. You could do job walks to listen to folks' concerns and perspectives. Many ways to do that. But I think if you haven't seen it yet, Google the Surgeon General's Worker Wellbeing Framework. It has a nice framework that talks about the different things that play into people's physical and mental health in the workplace. And the 5 essentials can give you some clues into what you might want to look into to assess how employees are doing, what they think about their workplace, and whether it supports their health and well-being across all of these domains around protection from harm, which is safety and security, their connection in their community that they have in the workplace. Do they feel supported? Do they feel like they belong? Work-life harmony, someone mentioned that earlier. Flexibility and autonomy, especially for folks who have people that they may care for out of the workplace. Do people feel like they matter at work? Do they have dignity? Do they feel like they have meaningful work? Are they contributing to something? And opportunity for growth. Do people feel like they are being recognized for their accomplishments, for trying, for learning new things? And it's all centered on worker voice and equity. The Surgeon General doesn't have a survey that measures all of this. There is something called the NIOSH WellBeQ that you can download and use for free that kind of gets at some of this if you're interested in a survey to assess this. And the last piece is your personal health and well-being. So we did a large small business study, which I'll talk about in a second, to assess this sort of leadership training strategy around total worker health. And we intentionally built in how to support the leader's own health and mental health. And what we realized at the end of the day was that when you're trying to train new leaders on these concepts to think about safety and mental health, it's overwhelming. We're trying to get them to something new. And if they're not also taking care of their own mental health, they're not going to be as effective as they could be. But it's a challenge for leaders because you're always thinking about someone else. You're thinking about your business, you're thinking about your employees, you're thinking about your kids, your parents, your friends, and you're putting your health last. And if you're going to be an excellent total worker health leader, you can't do that. You have to take care of yourself as well. So from that study that I just mentioned, we learned a lot about how folks in organizations can build their total worker health leadership and translate these into real-world change. The first is that you have to focus on more than just your business strategy if you want to change. You can't just develop a new policy, institute a new program, and expect that to be the magic trick. You have to think about your culture and your own health and well-being. 2, data is important. There's so much data that you guys probably already have to assess what's going on with health and well-being in your organization, but there's probably some other things that you could collect to better understand current needs and challenges, and having that data helps you make decisions that will be more effective. And then leaders need to focus on, first, like I said, their mental health. 2, build a team of other folks who can be leaders. So it can't just be you. It can't just be the safety person. It can't just be HR. It can't be the owner. It has to be everyone. And then the last thing, find your leadership community outside of your organization. That's kind of what we're doing here today, thanks to Nick and the ASA. But there's opportunities for you guys to get together and share challenges and wins and learn from each other. And that's what we did in our small business study. We brought together leaders from lots of different industries and used to be surprised that like a social services organization had a lot to teach a construction organization and vice versa. So community matters. You need a team of leaders because total worker health is complex. It's overwhelming. It's going to require safety, it's going to require HR, it's going to require management workers, it's going to require everyone to do the steps needed to do to change the business. Formal leaders need to have visible support for this, but they should seek expertise from lots of other individuals. You'll have greater impact if you do that. Creative solutions are needed. It's really complex to figure out how to address burnout, right? It feels overwhelming. So you need lots of great minds in the room to solve that. And from shared leadership research, it shows that if you want to start sharing leadership responsibility for this, it's especially important when you're in the thick of developing these new initiatives and executing them. But at the start of it, it really takes some strong leadership, potentially from formal leadership, to say, this is the strategy we want to take. This is what we're going to do. Here are the resources. But then from there, it should be the responsibility of multiple people in the organization to get it done. And I've done some of this research in construction here in Colorado with some subcontractors a few years ago. What I found was that in construction, people will start to share responsibility, first and foremost, if they think their coworkers take a personal interest in them. So I asked a lot of different reasons, like why would you start sharing responsibility for safety and mental health? And the thing that popped up for everyone was this coworker support. Like, you're not gonna work with someone that you don't like, that you think they don't like you. So that's a prerequisite. From the employee perspective, if you want to get crews out on site involved in some of this, there's an element of training. I think a lot of folks don't feel like they have the right knowledge to do this kind of change work, and maybe they don't, so they need some upskilling. And they also need to feel like they can be a leader. There's a lot of folks, students here in the room, which is really exciting. My message to you is that you already are leaders, whether you know it or not. You're leading your peers, you're leading yourself. There's specific things you can do, like walking the talk. It's very basic level. That is leadership. And as you work on developing these skills, it's going to help you get jobs, keep jobs, and get promoted. Folks are looking for these leadership qualities. But I think as we recognize there's a lot going on here. It's really complex. It sounds very exciting. We may want to do some of this, but there's roadblocks. Good leadership doesn't just happen. It has to be purposeful. People have to try, make mistakes, try again, and they need to work in an environment that supports them. So if you're trying to build a team of people who are motivated and passionate to influence change around total worker health, make sure that there's the right support for them in the workplace to do this. They have the time, they have the resources, they feel supported by each other. But it is possible. So I'm gonna wrap with a few things by mentioning my soapbox that has been for a while, that everyone should be leaders. So owners and other members of senior leadership should be role modeling, allocating resources, holding people accountable, and recognizing people. Supervisors on site execute the total worker health approach. They talk about the availability of EAPs. They make sure people are pre-task planning for safe work. Safety and risk management provides safety leadership. They know the methods to keep people safe on the job, and that's their responsibility. HR and wellness, a lot of them understand health and wellness, and they can bring knowledge of benefits and mental health and EAPs to the table. If you're in a union environment, they should also have a role and input on supporting policies and programs. We don't have time for this, but I want you to consider who are leaders in your organization right now, and are they using these leadership practices? Are they leading by example? Are they empowering team members? Are they actively listening? Are they developing others? And are they recognizing others? But I think importantly, from what I said earlier, are they working on developing some internal qualities and visible actions that seem to matter the most, at least from research? Are they working to understand why they may value safety and mental health? Do they seem trustworthy? Are they respected by others? Do they have that moral character? And are they displaying that in their day-to-day works and actions? So, not bad. So in summary, I spoke with you about what total worker health is and why it should be a key outcome for leadership. I talked to you about why leadership matters. There's lots of different health and safety outcomes that leadership is linked to in the academic literature, and I'm sure you've also seen it in your own experience and felt it. And I talked a lot about what effective leaders do, those 5 leadership skills that you can do one-on-one with folks, the opportunity to use those skills to influence organizational change around the policies and programs, but also culture and your own health and well-being. And then I've ended on a note of the idea of sharing leadership responsibility. So my call to you is to, one, reflect on what leadership skills you're great at and what you need to work on. Consider how you can use those skills to support your organization, both tactically and transformationally. And then 3, consider who else you can bring to the table in your organization. Who could be champions with you to support this effort? And that could be within your company, it could be a peer in another company, or associations. And I do want to end with some resources if you're interested. Our Built to Last toolkit is something that we're currently testing right now to support sort of the organizational change effort in a way that elevates leadership on job sites for safety as well as mental health well-being, but also promotes employee engagement and building the leadership of frontline crew members on site, and increasing teamwork capabilities on site to solve real challenges around safety and mental health that people face. Our process includes leadership training, which is those 5 skills I talked about. But then we also have a design process, or design sprint process, that asks both management and workers to use these skills as they work through the process of hazard identification and control in a quick manner to identify solutions to relevant challenges, whether that's safety like falls or electrical hazards, or mental health like stress and schedules. So we are currently, we have funding right now from NIOSH to test this, and so we're looking for contractors who'd be interested in helping us test it for free. And the last thing I'll mention is that there's a lot of total worker health training and development opportunities from our Colorado School of Public Health. If you're interested in learning more about total worker health, there's HealthLinks, which I mentioned earlier. This is just sort of like a one-on-one mentoring program that David Shapiro runs. We have a Leadership 101 that's online, so if you like some of this content, we have it online for you, for others to complete asynchronously. We also run an executive style program that talks about all of these concepts. There you go. And then we also, if you're interested in more information on the total worker health concept in general, we have an asynchronous 6-hour training that you can take online. It's a great intro to the field and the approach. And if you're really crazy, you can come back to school for 15 credits. Nick did it and graduated. He did a great job. You can become an expert in total worker health. There's also a lot of other total worker health resources across the country. There's other folks like us who are passionate about it and have developed a lot of resources. So if you have a specific need or question, I'm happy, and we don't have it here, I'm happy to connect you. Anyways, thanks so much for your time. I appreciate it.
Thank you, Natalie. Dr. Schwatka is a mentor of mine. She was my professor. She taught me all about total worker health, and she is the authority in construction leadership training. So if you're interested in the Built to Last program, Heather is, you need to talk to her. Please work with her on that. Okay, we're going to take 5 minutes. In this room in 5 minutes is Substance Use in Construction, The Growing Challenge from David Shapiro, the aforementioned. And in the other room, we have Stop the Drop, Preventing Falling Object Hazards. Again, in 5 minutes. Thank you, guys.
All right, everybody, we're going to get started.
All right, thank you. Okay, good morning. My name's Kristen White. So I'm an attorney with Fisher Phillips, and I have the privilege of introducing our next speaker. So David Shapiro is going to be doing our next talk. He's someone who's had a real impact on how we think about health and safety in construction, not just from a compliance standpoint, but from a people-first perspective. David Shapiro is with the Center for Health, Work, and Environment at the Colorado School of Public Health. He leads the efforts that connect science, leadership, and culture to improve the health, safety, and well-being of workers across all industries. David's also been a key leader in Colorado's Recovery-Friendly Workplace Initiative. It's a program, if you're not familiar with it, that helps organizations supporting employees that are impacted by substance abuse and mental health. I think that's, Dave, where you and I met, was kind of how his world interacts with my world on the legal side, and how employers can, have a recovery-friendly workplace. It can be legal, it can be ethical and moral and everything. You can have it all, which is great. So David's perspective reminds us that, when we build safer job sites, it builds stronger communities. People can bring their full selves to work and find the support. So please welcome David Shapiro. And David is recovering with his voice today, so listen closely today.
All right, everybody, can you hear me okay? In the back, you're going to hear some modulation and squeakiness in my voice. I hope that's okay for everybody. Thank you, Kristen, for the introduction. Thanks, Nick, and to all the health and safety professionals here for being willing to have this conversation. It's one that I've had a lot in the construction sector about supporting employees affected by substance use disorder. Let's go to the next slide, please. As Kristen mentioned, I work as a researcher, but also a public health practitioner. I'm at the Centers for Health, Work, and Environment, which is at the Colorado School of Public Health on the Anschutz Medical Campus. I'm a student. I'm getting my master's degree in public health as well. I'm a person in recovery, and that's really important to mention as part of this conversation. And what recovery means for me is that I no longer use cannabis. I'm somebody who has cannabis use disorder, and I used cannabis for over 30 years to manage and self-medicate to treat my generalized anxiety disorder. And it's been about 8 months since the last time I used cannabis. Thanks. We talk about opioids, we talk about alcohol a lot. We're starting to talk a little bit more about cannabis, and I know that a lot of you in the workplace are looking at cannabis and thinking about it from an impairment standpoint. And so my own research is focused on how workplace characteristics are either supportive or hazardous or barriers to people in recovery. We're going to get into that a little bit on this presentation as well. Go to the next slide. I take after my friend and colleague Cal Beyer that kicked off this presentation of, I've been labeled a buzzkill every once in a while when I talk about the spectrum of substance use disorder. I think Cal predates that title that from me I've heard, but I want to mention that using psychoactive substances is on a spectrum, right? There's some of us, like myself, that choose non-use. I don't use psychoactive substances at all, unless you count caffeine, which I really like caffeine. I don't drink coffee anymore, but I drink a lot of black tea. And so from one end of the spectrum is not using at all. And on the other end of the spectrum is substance use disorder or addiction. But there's all sorts of categories in between, as you all know, right? There's religious and ceremonial use, there's celebratory use, there's prescribed use for opioids, right? We talk about lower risk use quite a bit. That this spectrum comes from Canada. Canada uses lower risk use whenever they're talking about people using psychoactive substances. Psychoactive substances are anything from alcohol through heroin and opioids, and cocaine and amphetamines is in there. LSD and hallucinogens are in there. And then things, we don't usually talk about caffeine and tobacco, but they are psychoactive substances as well. So there's lower risk use, which is perhaps, going out and having a moderate amount of alcohol after a hard day of work. We talk with a lot of students in college campuses as well, and sometimes we interchange the word lower risk use with experimental or social use, which was my background in using cannabis, right? It started as a very social activity when I was in my teens, and at some point it flipped to be my coping strategy of how I dealt with anxiety disorder. And then it's when things become more problematic, where we are in higher risk situations. For me, and hopefully for a lot of you, you recognize that showing up to the workplace impaired from a psychoactive substance would be a higher risk activity. I'm not sure if that would classify as an addiction yet, but it's certainly high risk to be using alcohol, cannabis, opioids, that are not in a prescribed way on the job site. That would be a high risk situation. You're putting yourself, your colleagues, and perhaps the community at risk in those types of situations. So I just want to mention, for the sake of not being called a buzzkill too many times, that there are reasons that people use substance use. It's when we start using them to cope with stress. We start using them because we like the feeling of impairment more than the feeling of being sober or having sobriety, where things get a little bit more problematic, right? And I want to acknowledge that in addition to individuals who are abstinent like me, there's also harm reduction, and I'm well connected to the harm reduction crowd. You may have heard that term before, you may not have. Harm reduction means that you're using less of a substance, or you're using a different substance that's not quite as harmful in order to make it through and to deal with your disease. And substance use disorder is a disease. And so there's something like medication-assisted therapy or medication-assisted treatment, MAT, That would be individuals who get methadone which is a small dose of opioids in order to not be sick with their disease. And so all of these are on the spectrum, right? We're not only talking about, this is not a binary yes, no, 0, 1 kind of situation. And so I want you to be thinking about your own experience with psychoactive substance, your colleagues, how you approach it in the workplace. We're getting ready for holiday parties right now, and a lot of companies have talked to me about how Christmas parties and holiday parties in the workplace are really centered on alcohol and celebratory beverages. And one of the things we recommend is adding signature mocktails to your holiday party, right? Just having a balance so that the only fun drink you're offering isn't the alcoholic one. There's a risk situation of having your holiday parties center around alcoholic beverages as well, especially if people are expected to drive to and from the holiday party. So doing things like offering ride shares and having mocktail options is a really great way to have a more recovery-focused holiday party. We can go on to the next slide. So since we're talking about substance use disorders, I'll try and use the lower register of my voice for a little while, and I can change it up for those of you in the back of the room. Since we're talking about substance use disorders, what we have here on the screen are the 11 diagnostic criteria that addiction treatment specialists, behavioral health professionals use if they're going to diagnose a substance use disorder. There's 4 main categories of physical symptoms: loss of control, giving up important activities, and problems that are caused by the use. So within those 4 categories, there's 11 criteria that doctors are looking at if they're going to diagnose someone with a substance use disorder. We can go on to the next slide to talk about a little bit more what this looks like. So data from 2021 here at the CDC, more than half of individuals have just 2 or 3 of those symptoms. That's considered a mild substance use disorder, right? It's still a medical condition. Substance use disorder is a medical condition. You can have a mild substance use disorder with 2 or 3 of the symptoms on that previous list. A quarter of individuals with substance use disorder have a moderate substance use disorder. That would be another 4 to 5 symptoms. And then severe substance use disorder would be 6 or more of the symptoms. And we classify the terminology of addiction as a severe substance use disorder. One of the reasons why I use cannabis use disorder to describe my experience is because I had 8 or 9 out of those 11 symptoms for the bulk of the time that I was using cannabis, right? So that would be considered a severe substance use disorder. It feels a little bit weird for me to say that in such a high register, at least hearing in my ears, but ultimately that was my experience with cannabis. We can go on to the next slide. We have a video here from one of the leading researchers and publishers around the world on addiction, Johann Hari. He wrote a book called Chasing the Scream, and I'll let the AV folks take over.
The idea of addiction we've all got in our heads, that story, comes partly from a series of experiments that were done earlier in the 20th century. You get a rat and you put it in a cage, and you give it 2 water bottles. One is just water, and the other is water laced with either heroin or cocaine. The rat will almost always prefer the drugged water and almost always kill itself quite quickly. In the 70s, Bruce Alexander, professor of psychology in Vancouver, comes along and he looks at this experiment and he noticed something. He said, we're putting the rat in an empty cage. It's got nothing to do except use these drugs. Let's try something a bit different. So Professor Alexander built a cage that he called Rat Park, which is basically heaven for rats, right? They've got loads of cheese, they've got loads of colored balls, they've got loads of tunnels. Crucially, they've got loads of friends, they can have loads of sex, and they've got both the water bottles, the normal water and the drugged water. But here's the fascinating thing. In Rat Park, they don't like the drugged water. They almost never use it. None of them ever use it compulsively. None of them ever overdose. You go from almost 100% overdose when they're isolated to 0% overdose when they have happy and connected lives. What if addiction isn't about your chemical hooks? What if addiction is about your cage? What if addiction is an adaptation to your environment? This has really significant implications. The most obvious implications are for the war on drugs, right? We punish addicts, we shame them, we give them criminal records, we put barriers between them reconnecting. Now, there's a place that decided to do the exact opposite, and I went there to see how it worked. In the year 2000, Portugal had one of the worst drug problems in Europe. So one day, the Prime Minister and the leader of the opposition got together, set up a panel of scientists and doctors to figure out what would genuinely solve the problem. And they came back and they said, decriminalize all drugs, from cannabis to crack. But, and this is the crucial next step, take all the money we used to spend on cutting addicts off, on disconnecting them, and spend it instead on reconnecting them with the society. But the biggest thing they did was the complete opposite of what we do. A massive program of job creation for addicts and microloans for addicts to set up small businesses. And when I went and met the addicts in Portugal, it's fascinating. What they said is, as they rediscovered purpose, they rediscovered bonds and relationships with the wider society, and the results are in. Injecting drug use is down in Portugal, according to the British Journal of Criminology, by 50%. Overdose is massively down. HIV is massively down among addicts. Addiction in every study is significantly down. We talk all the time in addiction about individual recovery, and it's right to talk about that. But we need to talk much more about social recovery. We created a society where, for a lot of us, life looks a whole lot more like that isolated cage and a whole lot less like Rat Park. What I try to do now, and I can't tell you I do it consistently, and I can't tell you it's easy, is to say to the addicts in my life that I want to deepen the connection with them, to say to them, I love you, whether you're using or you're not, and if you need me, I'll come and sit with you, because I love you and I don't want you to be alone or to feel alone. And I think the core of that message, you're not alone, we love you, has to be at every level of how we respond to addicts, socially, politically, and individually. Because the opposite of addiction is not sobriety. The opposite of addiction is connection.
Okay, I really love Johann Hari's message. Again, his book is called Chasing the Scream, and he went and looked at addiction and substance use disorder across countries around the world. There's two parts of this first section of the presentation I want you to take home with you and explore and think a little bit more about. One is that substance use disorder is a medical condition. It's a disease. I talk with HR directors, safety professionals, small business owners multiple times a week, and I feel like in the workplace, if someone gets diagnosed with cancer, cardiovascular disease, type 2 diabetes, we have some idea of what we're gonna do as a company. We know what the accommodations look like. We all say F cancer, and we do walks, and we raise funds, and we rally around and support individuals with a number of chronic medical conditions. We don't have that playbook for substance use disorder yet. I'm really grateful and honored that I get to be part of a experience and a movement in Colorado where there's companies like several of you in the room that are saying we're gonna talk about substance use disorder as a medical condition and we're gonna do it differently. And work is a really critical component of Rat Park. I don't think I like the analogy of workers as rats inside of a Rat Park situation, but the reality is work encompasses so many elements of support for individuals, right? There's social connections, there's the benefits that people get, and we're gonna talk about some of the supports in just a moment. There's structure in the day-to-day lives of individuals that are clocking in or going to work and coming home. So whether you like it or not, the workplace is a situation and a scenario where for people, whether they be in recovery or people who are experiencing active addiction, have a lot of elements where people can draw support from. Now, you're probably not going to look over at all of your colleagues and talk to them about how much you love them. That might be a little bit awkward. But you can treat your colleagues with the same care and respect as you would a neighbor, a friend, a colleague that you care about. And so what I encourage you to think about is, one, if we recognize that substance use disorder is a medical condition, then two, when someone is impaired due to psychoactive substances in the workplace, or they come to you and say, I'm in recovery and I'm struggling right now, we don't approach them with any sort of judgment, and that was what Cal's presentation was about, or any kind of stigma. We try and leave our own preconceived notions at the door and say, what if that person was coming to me and they just said, I got diagnosed with cancer? How would I approach that conversation? And if you can just start to shift your own mindset about how we approach individuals that are willing to be vulnerable and disclose that they have a substance use disorder, we'll make a lot of big changes in the workplace. Let's shift gears a little bit and talk about the terminology of recovery. I run the Recovery Friendly Workplace Initiative for the state of Colorado, where we certify employers as recovery-friendly workplaces. SAMHSA, the Substance Abuse Mental Health Services Administration at the CDC, defines recovery as the first bullet point up here on the screen. It's an individual, self-directed process of change where people improve their health and well-being, live a self-directed life, and reach their full potential. I really love this definition of recovery. It's very inclusive. It includes people who have chosen not to use a psychoactive substance maybe for a day, and it includes others that have been sober for 36 years. As a researcher and a scientist, this definition is challenging. And I'm looking at my advisor and preceptor, Dr. Schwatka, who just spoke in the back of the room. She knows how challenging it is to have such an all-encompassing and inclusive definition of recovery, where in some senses, recovery means complete sobriety from substances, and in others it may mean not using for 24 or 48 hours. So when we research recovery, that makes things a little bit challenging. And it also makes it challenging for those of you who are in a human resources position or safety managers. What recovery looks like for me may not be the same thing as what recovery looks like for my friend Heather or Nick or other people. So it's a very individual process. And in workplaces, we like things to be maybe a little bit more standardized. It makes things a little bit easier to say, this is how we're going to approach each person. But this disease doesn't hit each person the same way. And so therefore, there needs to be an individual approach in terms of how we react to each person. When we talk about what is a recovery-friendly workplace, so we talked about recovery. A recovery-friendly workplace is specifically an employer or an organization that uses evidence-based policies. And I'm really honored that I get to work at a research institution in running this program because we can study what's working and what's not. We're starting to build the evidence base of specifically which policies, practices, and programs are most supportive to people in recovery. So we're using evidence-based policies, practices, and programs to bring the organization together, to unite the organization by recognizing that people with this lived experience have a lot of strength. They're assets to the organizations. Just like having an inclusive workplace that includes a lot of different people from a lot of backgrounds is a strength, having people in the workplace that are living in recovery, like myself, is a real asset to your organization. And ultimately, the end result or the goal is that we're creating safer, healthier, and more productive workplaces, right? That's our intention here. We can go to the next slide. I just want to mention that Colorado is part of over 35 or now I think 36 states that has a recovery-friendly workplace initiative. Those are colored here in purple on the screen, and so if your workplace is operating in multiple states, we're connected to the people who are running the initiative in other states as well. This map is shaded purple for states like North Carolina that have a program in just one city or county, or us in Colorado where we have a statewide program. So we have companies participating up and down the I-25 corridor and pretty much in all four corners of the state. So this is a national movement that's going on. We can go to the next one. There's a lot of people in the US, a lot of adults that have a substance use disorder. Again, we've got data here from 2021, and I'm light on the data in this presentation, even though I am in academia. But it's estimated that at any given time, I actually like the 26.7 million data point a little bit more. This would be Americans ages 18 and older with a diagnosed substance use disorder. So about 27 or 28 million US adults that are 18 and older with a diagnosed substance use disorder, and most of them are employed. Almost 80% of individuals are employed, so we're talking about somewhere between 20 and 22 million US adults that are employed with a substance use disorder, and most people recover. So 75% of people through therapy, treatment, and other social supports are in recovery. So there's a large body of individuals that are living in recovery in the workplace. We're just not talking about it that much. And the other thing I want you all to consider, and I know some of us are close friends and family members and certainly colleagues for people in recovery. For each one of us that's in recovery, we're usually closely connected to one or two other adults that are impacted by our disease. And so this number is probably a 2 times X, whatever the number is, of someone with a substance use disorder in terms of workers that are coming into the workplace each day that are impacted by this specific disease. So there's a lot of people out there. There's people in your workplace right now that are either struggling or experiencing their substance use disorder that we can be more supportive of. Go to the next one. This was already brought up in the keynote presentation. Most substance use disorders are co-occurring with a mental health condition. For me, cannabis use disorder was to treat generalized anxiety disorder. It wasn't until I got older that I understood that really my underlying root condition was generalized anxiety disorder, and the cannabis use was a byproduct of me being able to treat it and deal with it effectively. It ultimately was not helpful for me, but when I was younger, it was a pretty successful way for me to treat and handle my generalized anxiety disorder. And that's true of a lot of mental health conditions. Cal Bayer talked in the beginning about getting a pain med prescription at a young age and that leading to some problematic experiences. Excuse me. There's a lot fewer percentage of just being prescribed the pain pills without any underlying mental health condition and leading to an addiction or substance use disorder. Most of the time, there's something underlying related to mental health that's the root cause of addiction. We can go on to the next one. All right, so we're going to break this down into specific hazards and supports in the workplace. So first we're going to talk about hazards. We can go on to the next slide, which describes some of these hazards. Stress is probably the biggest hazard in the workplace, right? I guess we could argue that if you're in the restaurant sector, or even sometimes in construction, that frequenting bars and after work and having celebratory events, or in the case of restaurant professionals, working with the psychoactive substance right behind you at the bar, could be just as hard or difficult of a hazard as stress. But most likely, chronic stress is the most important factor for us to consider when we're looking at root causes of people coping through using psychoactive substance. And so work influences stress in either positive and negative ways. And so that's what I just want to get across. It's important to have a healthy level of stress. A little bit of stress helps us get out of bed in the morning and get us to work, or brings us to conferences when we're not feeling that great during the day. But too much stress, perhaps like I've had for the last few months of my life, can end up, with disease states and disease situations. And so, I just want you to recognize that we're not talking about removing stress altogether. Having a little bit of stress is healthy, but it's easy to go overboard. And in healthcare is another sector we work closely with. A lot of individuals end up using alcohol to deal with the stress. It's a pretty common experience for doctors and nurses, where people congregate similar to construction after work at a bar, or drink alcohol together. So my recommendation is look at how we're coping with stress and find healthier alternatives to beer, wine, and alcohol for how we congregate and deal with stress at the end of a long day. We can go to the next slide. I wouldn't be a researcher without having a cool logic model or some other bar chart on the screen here. This research is from 2022, and in the middle of the graphic is the substance use disorder to recovery sort of horizon. So it starts with the disorder, it goes through treatment, and you can either experience abstinence or recovery with or without treatment, and then it ends with sort of recovery in red over there. And what I want people to recognize is there are hazards in the workplace at the top of the chart that can either support or disrupt this horizon, right? So hazards can actually lead directly to a substance use disorder. I've been looking at the cannabis sector and the cannabis industry in Colorado, and I've been talking to people that work at dispensaries, and many of them tell me, David, I was a recreational user. I used a little bit of cannabis before I came to this job, but within a month or two of being at the dispensary, I feel like I have a full-on blown cannabis use disorder. There's been free product. There's been this culture that this is what we do when we're in the workplace. And so in that scenario, the availability of the product itself has led to the substance use disorder in that industry. And we've deregulated a lot of cannabis stuff, specifically within the industry and within the dispensary. And I think that's leading to more addiction and disorder for people who work at the cannabis dispensaries. So that would be, a hazard that people face that can lead to a substance use disorder. There's also hazards that interrupt whether or not we're successful in treatment and in abstinence and in our long-term recovery. So we need to experiment. We need to understand what those hazards are and work to reduce them. On the bottom of the chart are supports. We need as many supports as possible to buffer and to be a barrier to those hazards, right? So supports can disrupt the substance use disorder. That's what those dotted lines are. They can also lead to better increases in treatment, abstinence, and recovery. So we're going to talk briefly about specific hazards and supports in just a moment, but this is generally the sort of trajectory I like you to think about. How do we decrease hazards and increase supports in order to be a recovery-friendly workplace? We're not going to remove all of the hazards. We're not going to be able to implement all of the supports, but we can understand what they are, and we can work to minimize the risk of the hazards, and we can work to increase the benefits of the supports. Next slide. So hazards are in 4 main categories, and they're up here on the screen. We already talked about the availability of substances in the workplace. Culture, we talked about that a little bit too. What does our culture look like? Are we in a happy hour culture, or is there social pressure like in financial firms and technology? My friend Dr. Narayan over there talks a lot about workplace experiences where in order to get the promotion, he felt like he had to go and after work to happy hours and experience and celebrate like the rest of his colleagues in the legal profession did. And that was pressure to use substances, whether they be alcohol or other things, right? So that was a culture that was created. I've heard from a lot of you in construction that the common place where everybody celebrated and got together was a brewery or a distillery for years and years. And that's how everybody chose to do happiness together. Well, that can lead to addiction for individuals, right? Especially ones that are already on the borderline. The other experience I like to talk about is I'm a Broncos season ticket holder. Go Broncos. I'm hoping I can make it to the game against the Chiefs on Sunday. I'm on the fence right now about whether or not I'm going to make it. But last season, all season ticket holders were given a free beer for the first 3 games of the season. And I went up to the counter, which is great for some people, right? I went up to the counter and said, "Can I get a Diet Coke with my season ticket?" They said, "No, we're only giving out free beer." And so, you know, when you look at cultures there, for someone who is on the fence with recovery, that one beer easily turns into a couple. It may turn into, well, more than a couple by the end of the game. So as a society, we need to look at how are we approaching sobriety and how are we approaching how we're giving out free product, especially things like, you know, alcohol and cannabis. There's a lot of stress in work environments. We talked about that already. The last one, number 3 up here on the screen, remote work and hybrid work, is actually, it can be a barrier, but it can also be a support. So that one's in both categories. You heard from Johan Hari that isolation and living solo can be something that's a trigger for people. It can make addiction rise, it not having social supports, but it can also be a supportive situation for people that need to get to meetings or need flexibility in their schedule to get to doctor's appointments, etc. So number 3 there, technology and remote work can go either way. Let's go to the next one. Stigma is such an important component of this conversation, right? If you can recognize that substance use disorder is a medical condition and you can start talking about it differently, if we can start to build social support around this conversation, we can raise awareness and we can reduce stigma. And so I think that's a really critical component of this. You know, I want you to think more broadly about how you talk about people who drink too much or people who use psychoactive substances amongst your social crowds and at work. And especially at work, are you approaching people with the same care and compassion as you would if they had other chronic medical conditions? Because stigma is a real barrier. It's a barrier in a lot of ways. It's a barrier for people like me disclosing that we live with the disorder, and it's also a barrier in terms of having workers be productive and bringing their full selves to work. It's actually a barrier to the company because we're not giving everybody the full experience of understanding who they are and what their background is. Employers often want and view substance use disorders with a lot of mistrust for good reason. If someone shows up impaired and they're on a forklift or another big piece of equipment, they're putting a lot of people at risk. And you know, people have asked me since we've started this initiative, "Hey David, can we be a recovery-friendly workplace and still fire someone who's on the forklift and impaired?" I say, absolutely, yes. Safety is always the first major concern. Would I prefer your policy to go from zero tolerance to something that's a little bit more recovery supportive? Yes, that would be my preference. And you can switch the policy to say, in those situations, we're clearly going to remove the person from the job. They are in an unsafe situation and they're making themselves and other people unsafe. But what we do next is pretty important. And if what we do next is just fire them on the spot, that's one way to approach the situation. And let me tell you, you can still be recovery friendly and have that be your reaction. My hope is you can say, gosh, there must be something going on with this person, that they're showing up impaired on a major piece of equipment at our work site, right? And so what would you do with a neighbor, with a friend, with a cousin or a niece or nephew that showed up in that situation? You'd probably say, what can we do to get this person help or support? And that's where my friends and colleagues like Dr. Narayan and Melissa from Red Rocks Recovery are in the room to provide supports for that person. And it could be that the person gets all these supports and they still end up losing their job or getting fired. But if we could treat that scenario and that situation in that acute moment with care, compassion, and support instead of stigmatizing it and say, you know what, you put a lot of people at risk, you're fired on the spot, that would be my hope. Again, safety comes first, so removing the person from the situation has to happen. But then what happens next is really important. And our goal with the recovery-friendly workplace experience is we're treating people like human beings and saying, let's do everything we can to get this person the help and support that they need. This is clearly an impaired situation that's not a normal experience, hopefully. And if they're able to meet us where we need them to be as a workplace, we want them to come back. We have a story at the end of this presentation that I hope we get to about Grayson Long at JHL and his experience, and it gives a really good story about what that could look like in the workplace. Let's go on to the next one. So before we do that, we have another video on how we use language that I'd like to share with you.
Words can become grenades, strategically spoken at times to do the most damage. And when those words come from family and friends, they cut deeper. Labels erased my humanity. Total strangers felt allowed to criticize or judge me, saying that I was just a drunk or addict. These words also carried the connotation that I was lazy, selfish, or criminal. After a while, I began to believe the words, concluding I no longer served a purpose or deserved hope. Luckily for me, these feelings were eventually replaced with words that provided healing.
The research is clear. Not only do words shape how we view people, but words also shape how we treat them. For example, studies show that when someone is described as an abuser or addict, the general public and even clinicians are more likely to believe that they should receive punishment over treatment. Tragically, for those with addiction who are looking to lead fulfilling lives, hearing the terms drug abuse or addict is paralyzing and demotivating. It blames people for their own illness, ignoring environmental and genetic factors. It feeds into the stigma they experience from society, their family, and treatment providers. To help decrease stigma around language, the Office of National Drug Control Policy recommends using person-first language to replace judgmental and negative terms. For example, a person with a chronic medical illness that impacts their brain is not an abuser or an addict. They are John with a substance use disorder. John, a person who requires treatment and support to recover from his illness. Words matter. They can hurt and reduce someone's motivation.
Together, let's choose supportive, non-judgmental words that lead to treating people with respect and compassion.
Okay, I said in the first section of the presentation I had two main takeaways. This would be my third takeaway from the presentation today. So if we recognize substance use disorder and recovery as medical conditions, if we're committed to being social in how we wrap around and connect with people, then also the third thing would be we start using person-centered language, and instead of labeling someone as an addict or as an abuser, we talk about David, a person who's experienced cannabis use disorder, right? I'm okay with a lot of different labels, so I'm actually okay with people calling me a whole bunch of different stuff, but the more we can do person-centered language, the more we can sort of frame what we're moving to, which is support, it's holistic support of an individual, and we can reduce stigma, right? We do this with people experiencing homelessness all the time, or people who are unhoused. We've tried to change that situation as well. It's a moment in time where someone, doesn't have a roof over their head. It's not who they are as a person. Similarly, I was a stoner or a pothead for a long time, I guess, but I'm not carrying that label right now, right? And so now that's in my past, and so you could have called me that for a while if you wanted to, but that would have been sort of just saying that's who David is, right? Not that he's a person who lives with a medical condition, lives with a substance use disorder. So to buffer the hazards in the workplace, we need to start talking about what supports look like. And whenever we talk about supports, we talk about them across 3 main sections, which are policies, programs, and practices. I'll wait for the presentation to get back up on the screen, but I'll let you know about what those 3 Ps look like and what they mean. We can go forward to the support section. So policies, I think policies might be first, but let's see. Policies, so we can go to the next one as well. Policies are going to include things like, what is our drug-free workplace policy? Are we zero tolerance or not? But they also, programs and practices include what are the conditions that people work on. It's really hard to be healthy and have healthy coping strategies in an industry like healthcare. If you're a nurse and you're expected to work 2 night shifts and then 2 morning shifts and then 2 night shifts, right? Our bodies just aren't made for that type of situation. Similarly, in construction, if you're working super long 14, 16-hour days for a long stretch in a row, it's really hard for us to cope with those scenarios. We're not really built for that. And then having a long stretch of no work, right? We want consistency. And so having positive work conditions includes access to the right types of benefits and supports. It includes accommodations for people returning to work after leave for mental health or for a physical condition. We already talked about the importance of recognizing and rewarding people for a job well done, or even people that bring up near misses. I think that's an opportunity to be recognizing individuals. It includes having security and stability on the job as well. All of these things make an inclusive culture. Go to the next one as well. From an organizational standpoint, we talked about policies, right? So it includes our drug-free workplace policy. It includes reasonable cause or reasonable suspicion. I've worked with the team at Fisher Phillips a lot on reasonable care or reasonable cause policies, how we approach that situation. It includes policies around impairment testing. And I want to make sure that everybody realizes if you want to have one-on-one and individual coaching about any of the things that you've heard today, over there on the green table or green tablecloth is the Recovery Friendly Workplace table, and we have one-pagers there, and my business card is there, and I'm happy to have conversations one-on-one with you about what your specific workplace looks like, because you may already have some policies and programs in place, and you may be looking specifically at leadership-specific training or something different to move to the next level. We can go to the next slide as well. I cannot understate the importance of leaders bringing this up. We're starting to change our trajectory of how we talk about mental health in the workplace. And this has come, I really feel like, out of an evolution of COVID. People started talking to me about mental health in winter of 2020, right? So COVID, March of 2020, I got asked by the CDC to do, how do we translate public health guidelines to small businesses, especially essential ones that stayed open, with mask mandates and airflow, ventilation rates, and all sorts of other very technical things. But within a few months, all the companies started talking to me about isolation, people not feeling like they were connected at all, increase in mental health leaves of absence. And so we're starting to do a little bit of better job of talking about mental health, and leaders are as well. But substance use disorder is behind that, and it's still in the dark in a lot of ways. So thinking about like my own experience, and I'm someone who feels comfortable talking about my own background and my own medical condition, but if you work in a workplace where you don't feel like somebody's gonna respect, or you may even get reprimanded for bringing up mental health or substance use disorder, you're probably not gonna bring it up, and you're not gonna ask for support and help. And so it really does start at the leadership level, whether that be HR or business owners, someone in a manager or supervisor role. We hear consistently from our recovery-friendly workplaces that the ones where this stays and sticks is because it means something to the leadership group at the organization. This is a grassroots effort. There's many of us in the room that are doing this from a grassroots, but it's also really important for us to recognize that we need the grass tops talking about this and being willing to support this conversation as well. So I cannot underemphasize the importance of leadership in this conversation. A really critical component here. We can go to the next one. You may have employee assistance programs already. There's also employee resource groups for people in recovery. We know of several organizations that not only have access to EAPs or employee assistance programs. If you have a union-based shop, you might have member assistance programs or MAPs. Same thing, but for union members. We're moving, and one of the next key objectives for the Recovery Friendly Workplace Initiative is start to have ERGs, employee resource groups for people in recovery, where people can get some support, on a Tuesday Tuesday afternoon by grouping together, or once a quarter. There's a survey on the table there. We would love for you all to scan a QR code. It's not in my presentation. And give us a little bit more feedback about how you feel like your own company or your own industry is talking about substance use disorder. And the end of the survey is, do you want to find out more about employee resource groups? So there's going to be a lot of talk about ERGs coming from our initiative over the next few years. So you're going to hear that more and more. Let's go to the next one. We already talked about policies and there being a balance. I think the biggest thing to get across here, in addition to the first three key things I talked about, which again, I like to repeat myself, so sorry for those of you that already got it, but substance use disorder is a medical condition. 2, the opposite of addiction is connection. 3, words matter and how we talk about it matters. The fourth one is this one, which is it's a two-way street. A company can do all the things, and if someone's not willing to speak up about it, it doesn't really matter. And vice versa, people can speak up, but if the company's not ready, it's not going to make a difference either. And so this is both parties, the employers and the employees, have to come together to make this work. And the Grayson's video is such a great example of that at JHL. And so four key takeaways we've got now. Substance use disorder is a medical condition. Connection is the opposite of addiction. The words we choose matter, and it's a two-way street. It's going to take both the employees speaking up, and it's going to take conditions from the workplace that are conducive and supportive from the employer side that create the environment where people feel willing to do that. We can go to the next one. There's a little bit about the initiative here before we get to the last video. We can go to the next one as well. When we talk about, excuse me, when we talk about what it means to actually be a Colorado recovery-friendly workplace, there are 4 steps, which are listed on the next slide. We can go to the next one. Companies sign a pledge or a letter of intent that says we're willing to have the conversation about recovery and substance use disorder, that we're going to work with families and provide evidence-based resources, that we're going to participate in the initiative, and we're going to raise awareness and reduce stigma, like the No Shame pledge that's in the back of the room. So those are the 4 steps that are in the letter of intent. That's how you start working with this initiative. You get an orientation session with me or a member of our team. There's a survey for the organization and also a training that's a much greater extended version of this training that employees get, and we deliver that training online, or we can bring it to you in person on Zoom or physically in person. And then ultimately, once those steps are completed, you get the certification as a recovery-friendly workplace. Attorney General Phil Weiser will be here a little bit later for lunch. We just designated the Department of Law and Phil Weiser's office and department as a Colorado recovery-friendly workplace. That was 2 weeks ago in Loveland, and we're going to have some numbers here on the next slide, which we can go to. But that's the goal, is you go through the steps from intent to being certified. You do the work with our school on getting certification, and then we follow up with you on an annual basis to make sure that you have the resources that you need. Let's go to the next slide. It's really important that we have resources ready, and I tell businesses this all the time. If you're willing to have the conversation about recovery, you need to be ready to provide resources to people, because people are going to raise their hand and ask for support. A classic example in safety is ergonomics, and Cal knows this one well in the back of the room too. Anytime we do a training on ergonomics in an industry or in the workplace, and we tell people what ergonomics means, all of a sudden somebody's going to say, oh, that knee pain that I've had forever, maybe that's related to my sit-stand situation, or that shoulder injury that's been bothering me for such a long time. Maybe that's because I keep lifting things and reaching them over their heads, and now I'm going to go to my workplace and ask for support. So this is the same with recovery. The more we talk about it, the more we need to be ready to provide resources to companies and to your team members. And so we have a resource guide that's available on our website. It has treatment providers like Red Rocks Recovery and others that are ready to start talking about what we're going to do when someone raises their hand and they need support. But I want everybody to be prepared that if you're going to come back to your workplace and start talking about this, that people are going to stand up and ask for help or support. That's a good thing. Next slide. Yeah, we've currently got 128 companies participating in the initiative. There's a one-pager on our table about this, and 26 of those are certified. You can see some logos from partners in the construction industry that are somewhere on this participation to certification trajectory, and the purple dots represent sort of where they're located. I was saying that there's a cluster on the I-25 corridor, but we're really starting to reach a lot of corners of the state with the Recovery Friendly Workplace Initiative, and so our hope is that you can take this back to your company and say, hey, we're ready to start or build on this conversation. And David and his team are here and ready to provide one-on-one coaching and support of what it's going to look like. Go to the next slide. let's hear about what this looks like in person, and Heather's going to be featured on this video too.
I'm Grayson Long. I'm 35 years old. Been in construction for like over a decade. I love fly fishing. I got 2 awesome dogs. I'm getting married in October. Bought a house a few years ago, and life is grand. I've suffered from addiction and mental health issues for over 15 years. I was homeless at one point. Always had dead-end jobs, and my life was always out of control. Everything was always a disaster. It was just a constant state of anxiety. I lost my family, thought I lost my job, lost my home, and I couldn't handle living in the constant state of anxiety and depression and wanting to commit suicide. I had been clean and sober for about 6 months, and I went and interviewed at JHL. And I could tell there was something different about them. They were extremely friendly, and they kept preaching how everyone there was a family. And I could really feel it, I guess, when I went to the first interview. They were just extremely nice and accepting.
When I first met Grayson, he was the foreman. I didn't know his story at the time. He was a great worker, a great team player. And he reached out to me and told me that he suffers from substance use disorder.
I went back to detox because that was the only thing I knew on how to get myself clean, and I ended up emailing our director of field ops after about a day in there, and I was expecting a termination letter back in the email, and he reached out to me and told me he wanted to have a meeting with me in HR. I thought for sure I was getting fired at that meeting, and I showed up, and the first thing they asked me was how they could help me and what they could do to help me succeed.
If you're honest about what you're going through, if you're honest with, if you're authentic and explain where you're at, then they'll do what they can to meet you and support you through the process, especially with substance use disorder.
I've never felt anything like that before. I mean, it was amazing. They asked me what I needed, and they gave it to me, and it was up to me to succeed if I wanted to or not. My supervisor would constantly ask how I'm doing and what they could do to support me. And I was just honest with him. If I wanted to leave early to go see him go to a 12-step meeting, he would be like, okay, that's fine. I think that the company could see how hard I worked on making my life better and being in recovery, that they saw how valuable of an employee I could be. Now I'm second in command on a job site, which is pretty crazy considering where I was 6.5 years ago. Nobody would even trust me in their house alone. I think the future holds bigger, brighter things. I've worked my way up at JHL from apprentice carpenter to now I'm running projects, so I can only imagine it's going to keep going as long as I stay in recovery and continue to work on myself.
We're not judging you for what you did yesterday. We're here to help you get to where you want to be tomorrow.
I speak so I can hopefully help other people in recovery and let people know there is hope.
There is more risk in not being a recovery-friendly workplace than there is in being a recovery-friendly workplace.
When I first started in recovery, I thought there was no hope. I didn't think any heroin addicts ever survived, but here I am 6.5 years later, and I have an amazing life.
I want to thank everybody for being here at the presentation today. You have people like Grayson on your job sites right now, and you have the opportunity to support them. We're here to support you and your companies and how you do that. My contact information is on the last slide if we're able to pull that back up. But thank you for being here today. Thank you for being willing to have this conversation. And the Colorado School of Public Health and the Recovery Friendly Workplace Initiative is here to support you in this work however you need. So thanks so much. Thanks, Nick, for the invite.
All right. I'm going to introduce Melissa Woodring. I was just having a conversation about Die Hard and whether or not it's a Christmas movie. It is a Christmas movie. It's almost time to watch Die Hard. Okay, this is my friend, Melissa Woodring, and I'm very, very excited to hear her presentation today. Melissa is with Red Rock Recovery. She's also on the AGC Mental Health Working Group and helps with all sorts of things. She and I have done so much work in this community. Thank you guys for being here. I'm going to go corral everybody outside, and you can go ahead and get started. Thank you, Melissa.
Hey, can you guys hear me? Okay, let me know if the mic is messed up at all. I've never worn one of these before. Hello, I am Melissa Woodring. I'm so truly honored to be here today. This is just such an unbelievable event. This is such a cool opportunity, and I just want to thank all of you for showing up today, and especially for picking this track too, and coming to these sessions and learning about a really, really important topic. So a little bit about me. So I always start with this picture because this is me as a little kid with my dad, and I always start with this photo too because I think a lot of the time when we're interacting with people in early recovery, or really anyone, right? Like, this is who we're talking to. We're kind of talking to the little kid inside of them. And then my dad is also my reason why I love working with the construction field. He was a contractor, he owned his own company for a while and lost everything due to his mental health struggles. And so sometimes I just wonder, like, what could have gone differently? You know, what kind of support did he need? And does that exist now? And, you know, what could have just changed things? So that's kind of why I have this photo. And then another one of my whys, you know, we've talked about a lot of statistics today and a lot of data, and construction is almost double, right, other industries as far as overdose deaths go. And so this is, you know, what grounds me, what motivates me. These are some of the most beloved people in my life, some really dear friends, and unfortunately, these are also all people that lost their lives to overdose in the last couple of years. So a little bit about me and my story. I am a woman in long-term recovery. This is the duality of addiction, right? This is the duality of substance use disorder. And so I also like to start with these photos. You know, I grew up like a pretty average child, I would say well-adjusted. I, you know, participated in sports. I participated in the community. I was class president. I did all of these things. Everything on the outside looked good, and inside I just was really lost, right? And I just couldn't seem to quite figure things out. And as, you know, I got older and entered high school, substances entered my life and became that answer. I realized, oh, as long as I have a substance in my body, then I can show up for school. I can do all of these things that I've always wanted to do. It felt like I kind of found the answer to life. I found like the cheat code, the hack. It was there as long as I could just keep that substance in my body at all times. And then substance use disorder is a chronic, progressive, and fatal disease, right? So over time, it gets worse, it doesn't get better. And so things escalated over the years and escalated. And this picture on the other side there is a photo I took after a pretty bad relapse right before my 25th birthday. And I took this photo because when I relapsed on IV opiates, my skin basically burns off. I'm pretty allergic to opiates. And I took this photo as like a reminder. I just remember in that moment being like, we are never doing this again. Like the shame, everything. And so I took this photo to remember. And then of course, you know, within 2 days I was back to using. But it's a pretty horrifying photo. And a little bit more just about my recovery journey too, and what it looked like before I found recovery. So things escalated, right? So it started with alcohol, it started with prescription pills, and within a couple of years I was injecting heroin, meth, pretty much anything. And I was working in an emergency department, right? Everything on the outside still looked pretty normal. And I was using in the emergency room department bathroom, like injecting drugs, right? Which I think a lot of people don't think that this can happen to us. A lot of us don't think it can happen in our workplace, to our employees. We don't think it's happening around us, but it very much so is. And so that's also kind of why I put these two pictures together, just to show you like this is the same person and at a very similar time in her life. Also, that was not a real degree. I totally faked my graduation because I picked drugs, right? But I wanted things to look good on the outside. A little bit more too about my recovery journey. I really found recovery through the help of people meeting me where I was at. And what that looked like, it wasn't someone saying the perfect thing. It wasn't like this, one person said like the perfect sentence and that's what got me out of things. It was people who showed up in my life and created a sense of safety. It was people who were vulnerable and shared their struggles. And it was people who showed up consistently for me while telling me your behavior is not okay, but we're here and we love you. Like that's what made the difference and that's what helped me find recovery. And kind of the final event that really led to me finding sobriety was I, was in such a pattern of trying to break my use. And I worked at the hospital, right? So I worked 3 12s and then I would have 4 days off. So every week I said, okay, I have 4 days to detox and withdrawal. I can get through this, go back to work, I'll be sober. And so I would use for 3 days, try to get through withdrawals for 4 days, and repeat this cycle over and over and over again. And I was having really bad withdrawals, and I wound up relapsing and had this moment. And my whole life I'd been pretty apathetic toward life, right? I'd struggled with anxiety, depression. I didn't really care if I lived or died. I didn't think I had a future. My escape plan was always suicide. I didn't think much about future. It wasn't even an option, right? And so I had this moment, I relapsed, and I used substances, and there was this voice in the back of my head that was like, wait, we want to live. And it was this little voice, and it started to get louder. It was like, no, we want life. Like, there's so much we haven't experienced, but it was too late, right? I had already taken too much. And I just remember that was kind of the last thought before I went out. And that continued for the next couple of months. And it was such a terrifying stage that I had reached in my use because now I wanted to live, like I wanted sobriety. And I'd wake up every day and be like, I want this, I want to live. And my body and mind had different things in plan for me. And so I'd go to sleep that night not knowing if I'd survive the next day. And every time I used it, I didn't know if I would survive, but I wanted to, right? But that's the disease of addiction, and that's what we're talking about here. So I shared that, and this was my last day of use. So March 20th, 2018. Yeah. Thank you. Yeah, it's really wild. It really is a life beyond my wildest dreams. I never thought I would be here. It's really incredible. And a little bit about what my life looks like now. So I've worked in the substance use disorder treatment field in behavioral health now for almost 7 years. I started as a behavioral health tech, and we have some in the back, and I kind of worked my way through. I worked in admissions for a while. I led an admissions team, and then I moved over to the community outreach side of things. And life is really big and beautiful now. I'm, a sister. I show up for my family. I'm an aunt, and I love it, and I play sports, and I contribute to the community, right? I've been kind of returned to usefulness is how a lot of people define recovery. I love the definition that was shared earlier. And life is really big and beautiful, but none of that would have been possible without this. A little bit about early recovery and what it's like. This is a very accurate representation of what it feels like in your first 24 hours. And I can also say a lot of our patients in detox also look like this. And early recovery is a period of chaos and instability, and it's a miracle, and it's full of hope. But a little bit about what it looks like so you can just better understand when you're working with people who are in those early stages. Physically, it's really rough, right? There's withdrawals. Withdrawals can vary based on the substances you're using. So I mean, everything is affected, right? Sleep is affected. Either you can't sleep at all or all you can do is sleep. Your sleep schedule is usually off. We have insomnia, pretty severe physical anxiety typically, tremors, fevers, chills, appetite is all messed up too. Same, either all you can do is eat sugar usually, that was me at least, or you have absolutely no appetite. And a lot of times too, you don't really have the life skills to even feed yourself, right? Like I remember going to the grocery store in early recovery and buying a 2-pound bag of Sour Patch Kids. So I was like, what is food? Like this hasn't been a priority in my life, right? So everything is out of whack. And then we also have the psychological, emotional, spiritual side of early recovery, which typically people are pretty racked with shame and guilt. The way that substances sort of hijack our brain, and when we look at the disease model of addiction, substances become absolute survival. They become as imperative to survival as food and water, right? They really, really hijack our brain. And so if you think of someone in early recovery, like they're fighting for their life. You've taken away their number one survival tool, their coping mechanism, everything, and now it's gone. And so the body and the mind are just in shock. So that also leads to pretty severe cravings, which can be really physical as well. I'd say just really unpredictable emotions, really cloudy thinking, often depression, everything. And I think it's super common too for that shame and guilt for people to just come in thinking it's the end of the world. And often people want to try to fix everything day one of recovery too. They're so eager to start running around and fixing all of the things they've, maybe messed up in their lives. So I really encourage telling people to wait, pause, right? Get some stability first. I think other things too that people are dealing with in early recovery is most of their relationships are really damaged. Trust is broken. If they are even lucky enough to still have those relationships, a lot of times they're, pretty lost at that point. Housing can be uncertain. There can be legal issues. There can be pretty severe health issues too. Often too, people coming into recovery haven't necessarily been on top of things like ooh. They haven't been on, that was fun. I also juggle. They haven't been on top of like dentist appointments, medical appointments, all of these things, right? So it's just basically years and years of this avoidance, and everything you were avoiding because substances were the priority kind of comes all crashing in at once, right? So early recovery is a lot to deal with. There's also financial issues, huge concerns about work. I'd say work is one of the number one barriers for people entering treatment. They're really worried about losing their jobs, and they're really worried about financial security. And specifically with the patients we worked with from the construction industry, they feel a huge burden that they are supporting their households and that they have so much pressure on their shoulders, and they feel like they can't step away often. Because they feel like they're responsible for so much. So we've noticed that a lot. And then just some testimonials too from some friends of mine that are in long-term recovery, and just a little bit more about what those early days feel like. And so you can see a lot of the things I just talked about, feeling weak, being scared to sleep, right? I think there's this huge fear of being alone with yourself because you haven't had to actually sit with yourself and everything you've been avoiding for a long time. And often too, substance use is a result of trauma. Trauma can really dysregulate our nervous system. Substance use is a tool to regulate our nervous system. So you take away that tool, and people are extremely unregulated, which is a terrifying place to be in. That's just constant fight or flight is what I mean by that dysregulation. So some more as well. And I think Gab makes a good point too. She's talking about 6 months, right? So we're talking about the early stages of recovery, but post-acute withdrawal symptoms can last a pretty long time. They can last a year or longer, and especially with a lot of the mental health co-occurring conditions too, it can take a long time, right, for these things to get stabilized and to get better. And then I love this one too. So overstimulated, the lights hurt. I can absolutely, or smell the lights, I can relate to that. Okay, so meeting people where they are. So this is the best way to really support people not only in early recovery, but also prior to entering recovery. And this is a really good way to tie in a lot of what we heard this morning, right? About tying in all that we know about how stigma negatively affects the workplace, about how prevalent substance use is in construction. This is a really, really great tool for generating change, and this can also be used, you know, with anyone in your life, and it doesn't have to necessarily be substance use disorder either. It really applies to everything. And so how I would define meeting people where they're at is really seeing the holistic view of a person. So when we're meeting with someone and meeting them where they are, we're looking at every aspect of that person. So we're not just defining them by substance use disorder. We're looking at maybe they're going through some of these withdrawal symptoms, right? Maybe their sleep still hasn't regulated and they're a couple months into recovery and they're still not sleeping. Maybe they're going through a divorce. Like, we're looking at all of these different parts of a person and seeing the whole person. And also by that means we're coming in with compassion, we're coming in with empathy, and we're not lowering the bar. We're not making exceptions for people just because they're in recovery. We're also not making things harder for them because they're in recovery. I think that's a super common thing that I've heard, especially in construction, is that people come in recovery and they're ridden pretty hard. They're expected to do a lot more to prove themselves, or they're kind of given a free pass to do whatever. So we're keeping that bar high, right? We're keeping it stable. And I think also by showing people that we still have high expectations of them and we're holding them accountable and boundaries, we're giving them the dignity of seeing them as a whole person. We're validating that they matter, that they're important. We're empowering them to know that they do have these skills and they do have this strength. And also, we're not feeding into kind of the addiction cycle, where often if we let people get away with things continuously, it just contributes to making them sicker. And then it just validates they can get away with anything, and then they're probably going to continue to act out in that way. So that kind of goes into some of the other things on this slide as well. Leading with curiosity instead of judgment and listening before fixing. So these are huge too. I think two things. Sometimes we want to help someone more than they want help, right? It happens. And also, I think sometimes our ego can get in the way of things. So I think a lot of us are really eager to help people, and we want to help people and have those conversations, but we have to understand what's going on with them. We have to sit down with an open mind, not coming in with a treatment plan already in mind, what we're gonna say in mind, like really sitting down and understanding and listening to someone what's going on, and the whole picture of what's going on. And I think this can be kind of where ego comes into play too, right? If you want to be the fixer, you want to be the helper, and not one thing that works for someone isn't going to work for everyone too. So it's super important to really listen, understand, and some people just need to be heard too. That's really what they need. They just need validation, and they need someone to sit down and listen to them. I think a lot of people too are kind of screaming out internally for help when they're pretty deep in substance use disorder, and so sometimes you can make all of the difference just by listening to someone. What else? So balance compassion with boundaries. That's what I was saying, like we keep those expectations high. I remember my friends Matt and Joe when I was in recovery. So we went through treatment together and we got out and they stayed sober and I couldn't get it. I just kept relapsing. And I lost pretty much all of my friends from treatment except for Matt and Joe. And they checked in on me consistently, and every time they said, what you're doing is not okay, but we love you and we're here for you when you're ready. And I was taking some time yesterday to just think back on those like pivotal moments, right, in my journey and what really helped me get sober and like who I called when I needed help, and it was them. And it's a 100% because they listened, they understood where I was at, and they still like held these boundaries and they still expected things of me. And then recognizing readiness and adjust your approach. So we have to also understand what stage of change people are in, and we can't try to force someone into a rigid recovery model. Maybe it worked for someone, it won't work for everyone, and just because we have an idea of what we think they need doesn't mean that we should try to force them into it. So that goes into stages of change. So this was created for substance use disorder, but it really applies to any behavioral change. So I'm sure everybody can relate to this. If you think about a time that you wanted to start working out more, maybe, or eating healthier, or anything, and at first you're like, no, I'm not gonna do that, I'm in denial. right? That's me. I don't need to stop eating gummy worms every day. I'm fine. It's not a problem. Contemplation. Okay, so I got some labs back. Maybe my numbers are starting to be a little concerning. Maybe I get a headache every time I eat 2 bags of gummy worms. Maybe I should stop, right? You start to like contemplate, you start to think about it. And then preparation and action is like, okay, I'm gonna start researching gyms. I'm gonna start buying fruit, like whatever it is. And we start to actually plan to change. And then there's maintenance, which is when you're actually active in change and maintaining it. And then you can see relapse. So usually this is in a circle, and that's because these stages of change are dynamic. So you can really return to any of them at any time. You can kind of hop in and out of order. And then relapse is a really effective way to learn more about yourself. Yes, it can be negative, but it also can be a way to go through the stages of change again and maybe have a more effective outcome. So specifically how this applies to meeting people where they're at. So some examples would be pre-contemplation. What does this look like in the workplace? So remember, pre-contemplation is going to be denial. So it's someone saying, I don't have a problem. And they genuinely might not think they do. You might be recognizing that they have a problem before they even realize it. So this could be things like their attendance starts to suffer, they start missing days, maybe you even notice a pattern in which days they're missing. Maybe they're missing Mondays often. Like, okay, interesting that you always miss a Monday. And then showing up late, small behavioral changes as well. Maybe they're isolating a little bit more, they're a little bit more distant, they're a little bit more aggravated, irritated, they snap a little bit quicker. Maybe they start making small mistakes. Something just seems off. Maybe they even start smelling like alcohol, right? These are all kind of those signs in the beginning. And typically what that conversation will look like and how you meet someone where they are in that stage of change, pull them aside, have a private conversation, don't do it in front of everyone, and come in super empathetically, come in with a lot of compassion, keep things calm, and just come with curiosity, right? Hey, what's going on? I've just noticed a couple of things. Is there anything you need to talk about? And this isn't always substance use. It could be mental health. It could be just something going on at home. It could be a phase of life, right? But all of this still applies. So just sit down with them, everything all right. You're really focusing just on safety and curiosity. You're not trying to accuse them of anything in this stage of change, because if someone is in denial, you accuse them, they're just going to come back with defensiveness. It's not going to go anywhere, right? And again, remember, substance equals survival. So if something is your survival, you will do anything to protect it. So if someone comes in and accuses you and threatens that, you're going to build up walls immediately and do everything you can to maintain that substance use and to protect it. So that's kind of how you deal with that first stage of change, right? And then, the safety side of things comes into play too. So if it's a genuine safety threat to work, right, then we have to have boundaries and we have to have expectations and rules in place. So that's where you can start to plant seeds too. And that also goes into contemplation. So that's where you have those private conversations of like, I'm so sorry, this is our policy. You have threatened the safety of whatever it is, but I'm here for you when you're ready for help. Here's the resources, I'm here for you. But unfortunately, we can't employ you any longer. Like, you can still have those conversations. Like I said, hold those boundaries, have those expectations, but do it in a way of like, I still care about you and I'm still here for you when you're ready. And typically these first 2 stages of change, you're looking around 6 months. So that's kind of what they say on average. And that's a broad range, right? Someone can be in denial much longer than that, much shorter. But patience is key as well with this. Consistency is key too. I think continuously checking in and showing that you really care and you really mean it. Things that people often say when they're in contemplation, it's gonna be like, yeah, I probably shouldn't be drinking, right? Like, yeah, I know, but it's not a problem. Or, yeah, I've been stressed, so I've been drinking a little bit more, but I can control it, right? Those are kind of the things you're hearing at that stage of change. And then when they're in preparation, so people will then come to you and start asking questions, typically in this stage. They're like, hey, so you mentioned that treatment center in our staff meeting the other week. Can you tell me a little bit more about that? Or maybe can we sit down and go over the EAP benefits? Like, what do those look like again? When people start asking those questions, it's a super important time to start having these conversations, because that window of willingness can be really short. I mean, it can be hours. For me, it was often about a day. Like I was saying, with that 3-4 day schedule of me using and trying to withdraw, that window of willingness, tiny, right? So we really want to jump when we have that window. And when they're in this stage of change, educate them on their employee benefits. Talk about FMLA, talk about family leave, start talking about the options they have available. And then once they're in the action and maintenance phase, once they actually, enter recovery or go to treatment or, work on their mental health, whatever the issue is going on, you really want to come in and validate. You want to have really, really clear expectations for them returning back to work or what those accommodations will look like. And this is also where you can, adjust duties to meet them where they're at. Again, like holding the bar high. I know I keep saying that a lot, but I think it's super important. And then I think in the maintenance stage too, something you can do is just regular check-ins and celebrate them too. Celebrate consistency. Don't expect perfection, but celebrate the small wins and the small change. And then with relapse, kind of starts all over again, right? Private conversation. I care about you. I care about your safety. Looks like things might be going wrong again. You might be struggling again. Like, what can we do? And then, what does this look like in the workplace? So this has been talked about with the last couple of presenters, but some practical actions you can kind of instill to be ready for all of those conversations and be ready to meet someone where they are in those stages of change. Communicate clearly and empathetically. Clear communication is so, so key, because you don't want there to be confusion. You want people to know what to expect. And then collaborate to reduce barriers. So again, you're not making their lives really difficult at work, but if they need to go to a recovery meeting at lunch, can you figure that out with their schedule? Can you find a way to make it work? Set clear expectations, educate employees on their health benefits. I think this is super important to do proactively as well, and not just doing in that crisis moment. So have a staff meeting and really go into what their EAP looks like. Or if you have additional counseling services, talk about a recovery center, talk about resources, right? Have brochures, have flyers in the staff room, have things accessible, easy. Talk about what confidentiality looks like too. Understand that they can go to treatment and things can remain confidential and it won't affect their future employment with other companies, with you. Make these things really clear. Help them understand what FMLA is, help them understand what family leave is and how your company works with it. And then, again, know how and when to refer and connect to people. So super important to be prepared for this. So build connections. Go around this room today. There's multiple treatment centers. There's multiple, behavioral health programs here. Start to build those connections. Grab some cards, grab some flyers so that you're ready. You can call me anytime, and I love to help connect people to the best resource for them. I've done it plenty of times. You can always use me. You can use all of these people in this room too. So I highly encourage that you go out and do that and be proactive about it. And warm handoffs are really helpful too. So it was mentioned earlier, sitting in the room with them and making that call is so helpful when you're like, oh, I know Melissa, we can call her. Or I know Karen, and we can call her, right? And sitting there with them and having that warm handoff so they don't get lost too in the system of healthcare that all of us have gotten lost in. And we all know how frustrating it can be to try to navigate an EAP or try to navigate a therapist and making a new appointment. So help them, do it with them, educate yourselves. Okay, and then where to turn. So this is kind of the next step too, and a little bit more education. So there's multiple paths to recovery. There are many ways to enter recovery and to reach sobriety. Treatment is one of them. It's not the only one. I've worked in treatment for a long time though, so I'm gonna talk about it. So what does treatment actually look like? There's multiple levels of care offered. So the most intensive level of care typically starts at detox and residential. So these are inpatient levels of care. That's where you're living at the facility, you're spending all of your time there. you're in group therapy all day, you're getting individual therapy, often family therapy, you're getting psychiatric services, you're meeting with medical professionals. You have like this very well-rounded team taking care of all aspects. And they're feeding you, right? You sleep there, everything is taken care of. So that's kind of probably what you see in the movies, right? And think of when you think of rehab, is probably the detox and residential portion of things. Something I will say too is that people don't always need to jump to the highest level of care first. I think it's super common for us to get scared and nervous, especially when it's a loved one and we just want to protect them, we want to help them, and we want to put them in the highest level of care as soon as possible. But it's not always appropriate. So there are other levels of care as well that sometimes people do better in, and sometimes it's nice to have an option to step someone up as well, versus when they start at the highest, sometimes there isn't a place to go. On that note, some withdrawals are extremely medically dangerous. So things like alcohol, benzodiazepines, you need medical detox. Do not withdraw from those substances on your own. They can result in seizures, they can result in death. Other substances are really, really uncomfortable and can potentially be dangerous as well, but those are like the big two. Especially often they're combined, so just be really careful, right? So that is when you need to immediately jump to the highest level of care. The other outpatient levels of care would look like partial hospitalization and intensive outpatient. So these are all outpatient programs. So that means typically you're either living at home or you're living in a recovery house on the premises or another sober living. And this also consists of group therapy. PHP, which is partial hospitalization, means that you are in group therapy typically from like 8 to 3. So it's kind of your full-time job. And that can last anywhere from a month to 3 months, typically, and you're still receiving individual sessions, typically, you're still working with your family and still getting those psychiatric services. Intensive outpatient is gonna be 9 hours of group therapy a week, so it's typically like 3-hour groups in the evenings or the morning. This is where you can go back to work, you can kind of start to return to your life and integrate back into the community. This is a level of care we've worked with a lot of people in the construction industry. As long as they're stabilized, as long as they meet our clinical recommendations based on their use and everything, that's a good place to start people too, because they can continue work as long as they get those accommodations. Our hours are from 6 to 9 at night, 8 to 11 in the morning. So typically we'll work with jobs for the most part, and there's other programs that have different hours as well. And then again, what does treatment look like? So you're just in really intensive clinical services. Most treatment centers nowadays are dual diagnosis, meaning they're treating the mental health conditions alongside of substance use disorder. And some treatment centers are more 12-step based, some are more clinically based, some are a little bit more harm reduction based. So there's a whole spectrum. And there's treatment centers that are a little bit more like luxury, that the accommodations are really nice, and you go out and do surf therapy and go do equine therapy, right? There's this whole range of things. So no matter what you're looking for, there's a program that can fit your personality and kind of fit your unique needs. And then how to refer. So I think this is also a place where people get stuck, right? It can be really hard to navigate the healthcare system if you don't know people, if you're not familiar with the industry. Insurance can be really hard to navigate, all of this. I've done it for family members. It can be really difficult, right? You Google treatment center, who knows what's gonna come up, right? It could be a place out of state sometimes even. It could be a place that doesn't accept your insurance, but on the website, they have a picture of your insurance, so it looks like they do, right? There's all of these barriers to navigate. So just be prepared. Do some research beforehand. Again, go around this room, build contacts, be prepared with those resources. And then typically what the referral process looks like is you call up, you call me, you call someone in this room, you call an admissions number, and they typically do an assessment over the phone, and they'll typically verify insurance. And typically you're looking at either an out-of-network program, right, or an in-network, depending on what benefits you use, so those are kind of options as well. Some programs also only take cash too, some are self-pay. And I think it's super important to be there with them, do that warm handoff, or ask if they want you there, and ask permission to share resources too. Not everyone wants the resources. So again, that's like the listening and understanding before jumping to an assumption that they're ready for help and they want help. So just ask, are you ready for resources? Do you want some? Do you want me to sit here and call with you? Do you want them to call you, right? These are all things that they can do. And then I think normalizing treatment too. The more we share our stories and the more we have resources and pamphlets around, the more normal it gets. It doesn't become such a taboo subject, something that seems so shameful that people need to hide. I think the more we talk about it, the more normalized it gets, and we can start treating substance use disorder like any other chronic health condition. Someone left to go get treatment for diabetes or cancer, right? We wouldn't have the same shame and stigma. So start normalizing treatment. It's healthcare. And then some recovery resources too. This is by no means all of the resources, but it's some. And just to give you some examples of what else is out there. So there's treatment, of course, some community support options. So I kind of split them up between community and professional. So there's 12-step meetings. There's a 12-step fellowship for basically anything you can think of. There's Alcoholics Anonymous, there's Marijuana Anonymous, Pills Anonymous, Heroin Anonymous, Sex and Love Addiction Anonymous, there's Codependence Anonymous, right? There's really everything out there. Crystal Meth Anonymous. So 12-step resources are awesome. All of that is online, all of the meeting databases. And there's also an app called Meeting Guide that will show you meetings nearby. So super awesome resource. Not everyone's into 12 steps. Totally okay. Again, important to come in with compassion, and we're not projecting our idea of what recovery looks like on them. So if we think recovery only looks like a 12-step attendance, we need to set that aside and listen to what the person actually needs and what they're saying, and realize that there might be something that works for them better. So some other recovery support meetings would be Smart Recovery, Dharma Recovery, there's also LifeRing Recovery, and then some really awesome local organizations. So the Phoenix is a sober gym. They have CrossFit, they have lifting, yoga, really amazing events. They go rock climbing, all of these things, and everything's free too. Really great organization. A lot of people find their recovery community there. TSRA, which I'm a huge member of. I love TSRA. It's changed my life. Honestly, I'm like obsessed. So 12-Step Recreation Association. So they have softball leagues, they have volleyball leagues, soccer leagues. They do pickleball, all these different sports, and it's so beautiful. And everyone gets together and like does the Serenity Prayer, and we all just sit there and talk about how we can't believe we're alive, and then we go play softball. It's really cool. There's also CARE, so Colorado Artists in Recovery. So they hold workshops, and it's really amazing community if you're creative and looking for that kind of thing. Red Rock also does open mic nights monthly, so just more places to find community, right, if 12-step isn't your thing. And then SAFE, Sober AF Entertainment is awesome. They will tailgate different college sporting events, different concerts. They host Super Bowl parties. They host all sorts of different events for people. Positive Recovery is a really cool organization as well. So they will foster pets and animals for people to go to treatment. And it's also a good way, if you're an animal lover and looking to help out, you can help foster. So really cool organization. That's another huge barrier for people trying to enter treatment. Typically it's concerns about work, it's concerns about money, family, and pets. Like those are some of the biggest barriers that we see. And then professional support. So of course there's treatment centers, like I talked about, detox, residential, outpatient, the whole spectrum. There's also sober livings. So there's houses that are dedicated to building sober community, and typically they're pretty structured. So they will include like drug tests, breathalyzers, curfews, right? So they provide a really supportive sober living environment. And then there's also peer support and recovery coaching. This can be a little bit more accessible sometimes to people who either can't access treatment due to financial reasons, due to scheduling, levels of stages of change, right? So coaching is a really awesome thing, and it can also be added on to treatment. And then there's also intervention. So interventionists, right? There's people who do companionship work. So people will hire someone to be with them basically 24/7 and help in their recovery journey. A little more rare, but still an option out there. It's just good to know everything. And then I wanted to leave a little bit of time for questions, and just to end this too on saying early recovery is rough, right? But it's also this really beautiful, hopeful period. And you all in this room could make a difference in that stage of someone's life, and you could be the difference in them slipping back into substance use versus maintaining their recovery. And it really does start with things like this. Again, like I said, I don't remember specific things anyone said to me. It wasn't that they had the perfect thing to say, which is something that always trips me up too, right? When I'm talking to someone and I want to say the perfect thing, and so sometimes I just don't say anything at all. Like, throw that out the window, because I don't remember what people said, but I remember how they made me feel. And all of these things that I talked about today is how you can make someone feel safe and validated. And sometimes, again, it will be 6 months or years, but they'll remember that conversation they had with you, and they will come back when they're ready. So be prepared, educate yourself, and meet people where they are. And I would love to, just if anyone has any questions or needs clarification on anything, just wanted to leave a few minutes for that. So thank you all so much. It really was an honor to be here. I know it's a big room, so it's hard to ask questions, but we'll have a mic coming to you if anyone wants to ask anything. Okay, also one thing I wanted to say really quick too that I forgot to mention is just that substance use doesn't discriminate, right? So as you can kind of see by some of the pictures I showed in the beginning, it looked like a perfectly normal, average person, right? Standing there in like a graduation outfit. You would never know everything that was going on beneath the surface. And when I say it doesn't discriminate, I want to make it very clear this is not a field issue, right? It can be, but it's not just a field issue. And if that's something that you've been thinking and picturing in your head this whole time too, I think that's a really awesome opportunity to start to talk about stigma, right? And kind of channel some of your internal biases and be like, why do I think that? This happens in the office just as much as it does in the field, and it can happen with any executive, it can happen with anyone in leadership in any position, and it can also happen at any time in life. Someone can be, a perfectly normal drinker for 30 years. 50 years, and something happens, and then they kind of start to struggle with substance use. So it doesn't discriminate age, race, ethnicity, sex, gender, anything. So just wanted to make that clear too. Thank you.
My question was that I have someone in my life that's struggling with addiction, and I would really like her to stop, but it's really hard when someone keeps saying no, and like you said, like that feels like they don't. So is there anything like I can do differently? Like, how do I get her to know that what she's doing is wrong?
Yeah, that's a great question and super common, and it's a really hard, frustrating, and heartbreaking place to be in, right? When you're watching someone struggle and you see the solution and you see the hope and they're not there yet. So I would say consistency, super important, continuously check in and come from that place too. You can say, I love you and I care about you, and this is not okay. Like, this behavior is not okay, and I'm worried, and I have resources. I know of this treatment center. I know of this. So if you're ever ready and you're ever interested, let me know and I'll be here. And I still love you. I still care about you, but I don't support this behavior. I think you can be really honest. You just do it in a calm and empathetic way. And then you also say, like, what do you need right now? What's going on? And try to understand, maybe she's just really, really scared. Right? And so maybe you sit down too and be like, what's going on? What do you need? Maybe she has a misconception about what treatment looks like too, or something, so you can educate her.
Thank you.
Yeah, and you can always call me too. I'm happy to talk to you or her.
Melissa, fantastic job up there. It's great to see your presentation. I think you nailed it. I was hoping, you touched on this point of how raw people can be in those early stages of recovery and even pre-recovery. I was hoping you could elaborate a little bit more on the chronic nature of this disease and how just from an employer standpoint, expectations of people in that early recovery process. Maybe they completed inpatient treatment, and the expectation sometimes could be, hey, you went to treatment, we're expecting you back at 100%. And just speaking to that process, that this is going to take some time for somebody to adjust to a life in recovery, and that even through those early stages of recovery, they can still be really raw as they're learning these new tools and skills. So just wanted to see if you could elaborate on that a little bit.
Yeah.
Thank you.
Totally, great question. Brian used to be my boss, by the way. He's the best. So yeah, that's a great question. So that comes into like the whole curiosity. So learn what's going on with them, learn what they're going through, and come up with accommodations too that fit them. And so I would say recovery is a long process, right? If you think about how long a lot of people have been using too, you can't expect them to then all of a sudden recover physically, emotionally, mentally, all of these things in a month, because they've been using substances for years and years, right? And you're also taking away their solution, you're taking away their survival, their coping skills, all of these things, and they have to develop all of those new skills. Often too, kind of the executive functioning and the life skills are kind of put to the side when you're using substances, because it really is just about survival. And it hijacks the brain in a way that is all you were thinking about, right? And so you are creating a life that will support your substance use. And then you put that aside and you're in recovery, and it's like, okay, how do I actually face life? Like, I did not know how to deal with responsibilities. I didn't know basic things like how to get myself up on time for a job, right? And so that's why I think clear expectations need to be made of here's what I expect from you, and then conversations and check-ins like, is this working for you? What's working? What isn't working? And what do you need? And just educating yourself too on patience. These things take a long time. People can be really sick. I've seen people go through opioid withdrawals for months, like sweating profusely, sick for months. So it's a process, right? And I think in treatment too, we often will see people come into treatment. I think they say the average is like people go through treatment 7 times before they reach recovery. It can be one time, it can be more, right? It can be anywhere in there. So having patience, having understanding, and just always coming in with a curious mindset too.
Thank you,
Yeah.
Melissa. Thanks for being vulnerable and asking questions. I have the pleasure of getting to spend a lot of time with her. Melissa's one of my very favorite people on the planet. Thank you for knocking it out of the park. If you guys have any questions about the morning content that you heard either in here or in there, now's the time to connect. It's lunchtime, but that also means it's the showcase time. So go grab lunch, connect with those in the room, and get your own solutions going. All right, guys, we'll hit it back at 1 o'clock. All right. If I could have everyone's attention, I could just have everyone's attention. If you all could please find your way to a seat, we're about to do something pretty special, something that has been in the works in concept for about 2 years. I mentioned earlier, Signal Behavioral Network, back there, have come in a big way and made this possible. This is a vision shared by the AGC Mental Health Working Group and the ASAC Health and Safety Committee. We're about to do something in this room that has not been done in Colorado before. So find a seat, and as soon as I see Cal's gonna make his way up here. Yeah, Earl, if you wanna see if Cal's in the hallway back there. Yes.
Hi, good afternoon. I think we left one thing out today. Nick recognized those of us who are on the Safety Council for the ASA, but we forgot one very key person in thanking, and that is Nick Williams. Without his leadership, his vision, this would not be possible, so thank you, Nick.
Thank you. Okay. All right. Once again, you guys are going to hear from Cal. He's about to do a very special introduction. Mr. Cal Byer.
Thanks, everyone. What an incredible day. Every presentation has been heart-touching. This is an incredible event. Just seeing the energy, seeing the vibes, seeing the connectivity, seeing all the booth sponsors being visited. What an incredible event. In a moment, we will be joined by Attorney General Phil Weiser. He's been an incredible champion of opioid abatement, opioid risk reduction, opioid support, and the distribution of naloxone. So I'm going to save some of those words for when he comes in. But I mentioned earlier that webinar we did for 23 associations on the same day. And you could tell his heart was in this. It was sincerity. It wasn't a soundbite. It wasn't a political ploy. It wasn't anything but a sincere appreciation for those associations to come together to fight for people's safety and well-being. It was so sincere. So when Nick asked me moments ago if I would do the introduction, I said I would be honored to, but I really, of all states, Phil Weiser's been a remarkable leader in this cause. So Mr. Weiser, if you come up, I'm in the middle of introducing you. Nick Williams from the American Subcontractors Association of Colorado and some of his friends have hosted this incredible event today. And it's my honor to have the privilege of introducing you, as I did May 11th of 2022 when 23 construction associations joined forces to join a webinar on waging a counterattack against opioids in the workplace and at home. And you joined us on that day. I had the vision that our industry would be ready to respond when the Attorney General's office was ready to support the opioid abatement movement in our industry, and you've done that. And the messages of hope that you've given through the opioid abatement conference continue to resonate throughout our nation. And I was just telling the folks here, I had the privilege of keynoting today, but when I met you, this wasn't about politics. This wasn't about a soundbite. It wasn't a campaign clip. It was utter sincerity for people. And I just want to tell you thanks on behalf of the construction industry. Thank you for making time in your busy schedule to join us today. Hope matters. Hope starts the saving life process, and it's my pleasure to hand this over to you. Thank you very much, sir. Thank you.
Thank you. You can introduce me anytime you want. The title of my talk is Stigma Schmigma. Stigma Schmigma. And I love the spirit behind it because I believe we're going to get past stigma. How many people here, it's going to be a low number, have seen the movie Terms of Endearment? One. Oh my goodness, I'm wrong. For those who haven't seen it, you should. It's a really good movie. And one of the points about it that I want to lift up is it captures circa 1980 the stigma of cancer. For young people growing up, you're used to hearing about cancer like, cancer sucks. I'm dealing with cancer. I'm fighting cancer. You don't hear people say, which is a line from Terms of Endearment, it's okay to talk about the cancer. We don't have to be afraid to talk about it. How many people here know who Fred Rogers is? All right, I'm not going to do an exact count, but if you said to me before, have more people seen Terms of Endearment than know who Fred Rogers, I would have said no way. There's a good movie I'd recommend, 2 movie recommendations now. The first one, Terms of Endearment. Second one, It's a Beautiful Day in the Neighborhood. It captures Fred Rogers, who has the following to say: if it's mentionable, it's manageable. If it is mentionable, it is manageable. What stigma does is give you, this is kind of like the voice from the devil, you can't talk about mental health. You can't talk about domestic violence. You can't talk about addiction. All these things you're not supposed to talk about. There's a stigma. To which my answer is stigma, schmigma. We got to get past the stigma. Here's the good news. We got past the stigma around cancer. We as a society, by and large, are not afraid to talk about cancer. It's mentionable, therefore it's more manageable. The problem that stigma does is at least twofold, and maybe more. First, for the person struggling with addiction, with mental health, a victim of domestic violence, when there's a stigma, they're afraid to get help. The other problem with stigma is for the rest of us, we have a distance. We have a disconnection from others because we're afraid to mention or ask. And one thing I've learned from the work we've done on the opioid crisis is the opposite of addiction is not sobriety. The opposite of addiction is connection. And a problem with stigma is it gets in the way of connection. And what the Surgeon General has told us for America, for Colorado, we have a connection crisis. To help people with their mental health, their wellness, and recovery journeys, we need connection and we need less stigma. Because people who are in recovery, they are courageous. And every day they're saying no to alcohol or to opioids or to other substances that have taken them to a dark place. And instead they're making a choice to lift up their spirit, to live as their best authentic selves. And we should honor that courage. We should honor it, and this is something that we've walked the walk. I know John's back there. We are at the Department of Law, the Attorney General's office, over 700 people. We are a recovery-friendly workforce. We all need to recognize that this addiction crisis is not something that happens to somebody else, an other. It's us. It's all of us. It's our friends. It's our families, our neighbors. And what's painful about addiction and mental health challenges is how many people might say, well, I don't know anybody who's really struggling with addiction. Oh, no, you do. You just don't know that they're struggling with addiction because you are maybe suffering from the stigma because you don't know how to talk about it, or you're afraid to talk about it, or there's not space to talk about it. And so we, as a society, have a challenge, and I'm so proud that Nick and the construction industry here are asking, how can we be leaders to move forward in our society, creating space to talk about it, to mention mental health and addiction? How can we create the space to ask our friends, our colleagues, our family, are you okay? How do we create the culture that it's okay not to be okay? It's just not okay to suffer in silence, to be isolated, lonely, and disconnected. Young people now are growing up and they are more disconnected than ever, which is why we have a youth mental health crisis. Young people are spending 6 hours a day on phones. It's another form of addiction. And those addicted to their phones and social media are twice as likely to consider suicide and self-harm. Because people who are feeling a lack of connection will sometimes turn to a substance or a phone, and then they're going to be feeling worse because of the addiction. Which means the answer to our addiction crisis, to our connection crisis, is more connection, is more honest, open communication. It is not easy to do that. And here's where I want to talk to the business leaders here and the people who own businesses here. You have a choice you can be making about the culture of your workforce. You can have a culture where there's a lot of stigma, where there's a lot of things that we don't talk about, and people are going to be disconnected, more isolated. They're not going to be their best, authentic selves. Or you can have a culture that says, I recognize you as a whole person. I want you as your whole person. I want to support you who you are. I want you to have come through the challenges you came through that made you stronger, and I want to honor you for it. Now, I know which of those two cultures I want to build at the organization I lead. Everyone here has got to ask that question, because you know what? Every organization has a culture, whether you know it or not. You may not know what your culture is, and that's probably a problem. Because if you figure out what your culture is, you may start saying, we can and we should do better. One way to build a better culture is to say stigma, schmigma. I don't want people to be affected by a stigma or any numbers of stigma. I want to create a workforce where people feel seen, heard, and supported, where people feel they matter, they're cared about. The benefits of such a workforce is people will be more dedicated. They will feel more a part of a team. They will feel cared about and thereby inspired to do their best. And so it is in every organization's interest to be an employer who's committed to supporting recovery, whether it's mental health, addiction, behavioral health. And we as a society, we still have a lot of work to do, because unlike the stigma that we've overcome in cancer, for many people it's not mentionable, which means all of us have to train ourselves to be more sensitive. And the sensitivity is not only those who are directly affected, but the people around them too. Because when people struggle with addiction, and some pay the ultimate price because of a disease, they die from an overdose. Some die by suicide. The family members who are close to that experience need our empathy, our support, and our open lines of communication too. So we have a robust agenda ahead of us as Coloradans. Colorado can be a state that leads in how we take on these challenges, starting with young people going out through all ages, working through workforces and employers, working through communities, making sure people know if you are struggling, there is help out there for you, and that you can live your best authentic self and not be affected by stigma. I'm committed to this work as Attorney General. The way we've done it has been first by going after those who are preying on people. Purdue Pharma, for example, pushing out addictive pills, lying to people, getting people addicted to make a quick buck. Or Juul, who pushed vaping in schools, taking advantage of a youth mental health crisis and getting young people hooked on substances that make them feel worse. We're taking those funds and we're investing in improving people's mental health. We're investing in recovery, in treatment pathways. And we still got a lot of work to do, because there are a lot of people struggling with addiction today who don't have access to treatment and recovery. And the thing is, for our society, is if we don't deal with mental health issues, if we don't deal with addiction health issues on the front end, we're going to see them come up in other ways, such as in the criminal justice system, where people end up committing crimes to feed their addictions, which is why we've pushed to have medication addiction treatment available in every single jail in Colorado. We have work to do, and we have to do that work together. I want to salute all of you for the work you're doing. I appreciate this important convening, and if there's time for a couple questions, I'm happy to take them. Is there time for a couple questions? All right, time for a couple questions. Not afraid to call on people either. Come on. Thank you. And your name is?
I'm Dave Wright.
Hey, Dave.
Dave. So my question, okay.
Go ahead, Santa.
My question to you is, with regards to the efforts coming out of your office, is there a committee, a program that Nick and the safety committee and anybody else in here who might be interested in getting a hold of to support the group at your level?
What a great question. The answer is yes. We want to support the work you're doing. Nick's connected to me and Jamie Feld, who's the head of our opioid response. And ideally, as you guys chart out the path for your industry, you can be a role model. You can be an example for others. And so we are committed to your success. We want to find ways to support you, and I look forward to that work. Okay, another question? Yes, we have one in the back.
So a lot of people, specifically back here, are students at junior and senior level of high school. And I'm just curious, from your experience specifically in this form of work, what do you suggest we do at our age to pretty much prepare to help fight this coming into adulthood?
The fact that you're here asking that question, you are like 9/10 of the way there, really. The key is open your eyes and open your heart. And as you get to know people and you really listen to their journey, it is going to enrich you. You're going to build more meaningful relationships, and you're going to support them. And one of the challenges, particularly for your generation, is what social media is doing. And so for you and your friends, recognize social media and their algorithms are a drug, some might say poison, and if you can limit how much of your life is taken over by it and create space to go take a walk outside, to have a conversation with someone face to face, you're going to build a healthier life. You can help others build a healthier life, and that's what our society needs. Thank you all very much.
Well, thank you for that. In the spirit of getting busy and doing something that means something, I want to say a statistic. We don't talk a lot about stats for the same reason that Cal said earlier. We don't like shock and awe. This isn't about shock and awe. In construction, in Colorado, every single day, somebody dies from opioid overdose. That's got to stop. We have a dream that we're going to reduce those rates, that we won't be number one, that we're going to set a good precedent, that we're going to set a good example. And that starts today in this room. You are all going to leave here as lifesavers. So we're about to show you guys a video. It's a training video. It's going to teach you how to use what we're about to hand out. Everyone in this room is going to get a full kit of naloxone, which is life-saving medication that's ready to go out and help the folks in our construction industry stop dying. So go ahead and play that video, and then our health and safety committee and some other volunteers are going to come forward and hand those kits out.
Is an emergency treatment designed to rapidly reverse the effects of a life-threatening opioid emergency. If you suspect an opioid overdose, check to see if the person will not wake up, is very sleepy, or is not breathing well. Do not test the nasal spray device before use. Narcan nasal spray is for use in the nose only and is safe to use even if opioids are not present. Hold the nasal spray device with your thumb on the bottom of the plunger. Insert the nozzle into either nostril and press the plunger firmly to give the dose. One nasal spray device contains 1 dose of medicine. Call 911 immediately after giving Narcan nasal spray. If the person does not wake up, continue to give doses every 2 to 3 minutes until the person wakes up. It is safe to keep giving doses. Stay until an ambulance arrives, even if the person wakes up. You have the power to save a life. For more information, visit Narcan.com.
Okay, you all have information in your packets about Narcan. It goes a little bit more in depth than the 1-minute video that we just watched. But you all now have in your hands life-saving medication that can make a difference. If there are early adopters in this room, if there are people who are thinking to themselves, I'm in charge of safety at JHL, these are early adopters I'm talking about, and I want to have Narcan on every one of my job sites. I want to have Narcan in all of our trailers, all of our vehicles. Yes. Oh, okay. We have plenty. So come see me. I'd be happy to equip you with many more kits so that you can go make a difference. So come see me at any point for the rest of the afternoon, and we'll make that happen. We're going to break into our afternoon sessions now. So if you're interested in talking about suicide prevention in construction, you are in the right place. If you're interested in talking about saving 5% on your workers' comp premiums and doing cost containment, go right next door. Thank you guys very much, and we'll go into the afternoon.
All right, so hopefully you got a chance to meet the folks next to you. That was just literally, guys, an exercise in how easy creating a community is. I think that is really important. You know, a lot of what we've heard about today has been about how disconnected we all are, and so we need to start building that community up to strengthen our industry as a whole. A little bit about me, guys. My name is Tad Lindsay. I was a superintendent in our industry for a long, long time. I was with Coggins & Sons. So we were down in the bottom of a lot of excavations downtown Denver, up and down the Front Range, drilling holes, caissons, all kinds of fun stuff like that. I'm honored to be here today, guys, to discuss a topic that is vital, yet too often overlooked in our industry. Mental health in construction. Whether you're a field worker, an office manager, or an executive in the C-suite, the mental health of our workforce is a concern that affects all of us. The success, safety, and sustainability of our industry depend on addressing this issue. Construction is often seen as a tough, resilient sector where workers are expected to power through adversity. Behind the toughness, mental health struggles run deep in our industry, guys, and it's something that we can no longer afford to ignore. I want to be clear, I'm not asking anyone to be a therapist, right? However, as leaders, we must create an environment where mental health is not just acknowledged, but actively prioritized. Today, we will explore why mental health must be a priority, the unique challenges faced by construction workers, and how addressing mental well-being can transform our industry for the better. So, what is mental health, right? It is basically your state of well-being. It's how we cope with life's stresses, how we realize our abilities and contribute to society. It's the way we feel psychologically and emotionally. Mental health is not just the absence of mental illness. It's about emotional, psychological, and social well-being. It influences how we cope with stress, relate to others, and make decisions. Much like physical health, mental health plays a foundational role in our overall well-being and performance. In the construction industry, mental health is critical, not only for individual workers, but the entire workforce's safety, productivity, and cohesion. So I know that Cal and Nick are not into numbers, right, and shock and awe. However, I want to paint you guys a picture of kind of how deep this issue runs, right? So I'm going to show you a bunch of statistics, hopefully to scare some of us, right, or at least, you know, make it a little easier to understand really how widespread this problem actually is. So 1 in 5 adults, around 53 million people in the US experience mental illness in any given year. Depression is probably the leading mental illness, right? Over 17 million adults in the US experience at least one major depressive episode each year. Depression is the leading cause of disability in the US for people aged 15 to 44, which is going to be almost everybody in the room, right? Anxiety disorders affect about 40 million adults Roughly 18% of the population in the US annually, making it one of the most common mental illnesses in the country. However, only 36% of those affected receive treatment. In 2023, there were over 49,000 suicides in the US, making it the 12th leading cause of death. 79% of those were men. Suicide rates have increased by about 35% over the past 2 decades, with the most significant rise in the past decade. Suicide is the second leading cause of death for people aged 10 to 34. So think about that statistic in particular. Suicide is the second leading cause of death for people aged 10 to 34. That's a terrible thing to think about the next generation of young people coming up, especially in our industry. So we definitely need to do whatever we can, guys, to change these numbers. Among U.S. high school students, 37% report feeling sad or hopeless nearly every day for 2 or more weeks in a row. The suicide rate among adolescents aged 10 to 19 has increased by almost 60% from 2007 to 2018. 1 in 7 Americans aged 12 or older have had a substance use disorder in the past year. That's 12 years old and older, right? 1 in 5 adults has experienced a substance use disorder in their lifetime. Again, these are our nephews, our cousins, our brothers, our sisters, our fathers, our mothers, our grandparents, our uncles, right? These are people that we see every day. Over half of us report drinking alcohol in the past month. Almost 15 million adults, that's 6% of us, have had an alcohol disorder in 2021. And about 25% of the adult population binge drinks at least once a month. Almost 17% of U.S. adults aged 18 or older have used illicit drugs in the past month. 20 million adults aged 18 or older reported using illicit drugs in the past year. Opioid overdose deaths have obviously surged in recent years, with fentanyl-related deaths contributing significantly to the rise in fatalities. Over 2 million Americans have a substance use disorder related to opioid use. 18.5 million people misused prescription drugs in 2023, with the most commonly misused drugs being pain relievers, tranquilizers, and narcotics. So in construction specifically, guys, construction workers are 3 times more likely to die by suicide than from work-related injuries. In Colorado, construction workers are 5 times more likely to die by suicide than workers in any other field. Nationally, at least 10 construction workers die by suicide every single day, okay? Every day, 10 guys in our industry go home, and that's the last we ever see of them, okay? That's something that we can definitely change. Mental health is equally as important as physical safety in the productive and safe work environment. Let's start thinking about total worker health. Ignoring mental health is not just a missed opportunity for improvement, it is a direct threat to the well-being of our workers and the overall success of our industry. Mental health challenges lead to decreased morale, increased accident rates, and an unproductive workforce. Mental illness costs the U.S. economy about $225 billion per year in productivity. The overall cost of mental illness, including medical costs, low productivity, and other factors, estimated at more than $1 trillion annually, okay? We're spending a lot of time and money trying to figure out how to fix this problem, guys. So in construction, right, we have unique challenges that we face, which is probably one of the reasons why our guys are particularly at risk for mental health issues as well as suicide. It's a high stress environment, right? We're in a constant state of danger. And similar to our veterans and first responders, that leads to an added amount of stress, right? When everything you're doing on site, is potentially deadly, it makes how you think about your job different. Despite safety protocols, the pressures to meet deadlines and produce results creates chronic stress. That stress takes a significant toll on mental health, contributing to burnout, anxiety, and depression among workers. The physical nature of construction work leads to long-term health issues. Injuries are common, and physical pain, disability, or permanent changes in identity can cause severe emotional strain. Financial strain caused by injury-related time off only exacerbates these struggles, leading to anxiety and stress about bills, job security, and recovery. The physical demands of construction are hard on the body, but when the mind struggles to cope with it, the effects are even worse. Is there paid time off for physical or mental health needs for someone working in the field? It's a really difficult choice for guys to have to make, whether they go to work to make a paycheck that day or they take time off to go take care of their head or their body, right? We need to give guys the opportunity, the permission to be able to go take care of themselves, okay? And for a lot of these folks, given the choice between going to work to make a paycheck, to feed your family, and going to the doctor is an easy choice for them to make, okay? The cyclical nature of construction work adds another layer of stress, right? Economic conditions, weather, and project schedules all influence the stability of jobs in the industry. Temporary, seasonal, or contract positions leave workers with constant job insecurity. The anxiety of not knowing where the next paycheck is going to come from or when the next project will begin has profound impact on mental well-being. This financial strain affects mental health, creating stress, depression, and a sense of hopelessness. Beyond the personal challenges of the job, construction workers also face cultural stigmas that have been deeply ingrained in American society. Influenced by higher education, the media, the narrative has long been that blue-collar work, especially in the trades, is inferior to white-collar professions. The education system and the media, or our culture, however you'd like to think about it, in all forms have perpetuated the myth that a degree from a university is the only path to success, while skilled trades are seen as lesser careers. This narrative has devalued the contributions of blue-collar workers, making them feel invisible and unappreciated. The constant undercurrent of judgment and under-evaluation creates feelings of isolation, frustration, and burnout. What is the result of that? Workers in construction and other trades face not just the stress of their jobs, but also the emotional burden of being socially undervalued. How do we attract younger generations when this is the example they can see with their own eyes? As leaders, we have the power to challenge this stigma and reshape our culture. We must show our workers that their skills, labor, and their well-being matters to us, and that we stand with them in valuing their contributions. Mental health in the trades is not just a luxury, guys, it's a necessity, and it starts with how we treat our workers both on the job and in society. The consequences of poor mental health are particularly dire in construction due to the physical nature of the work. Mental health issues can impair concentration, judgment, and decision-making, putting workers at risk. The risk of accidents or fatalities increases when workers are mentally fatigued, distracted, or depressed. We cannot afford to continue to ignore these issues. The economic impact, right? Mental health issues reduce productivity and increase the... Yeah.
I kind of talk loud. I don't know if I need this. I just want to know why in society today, after everything we've gone through, why do we still call people blue collar and white collar? Why don't we title them with the trade that they're doing today? Because I came from white collar, I'm in blue collar now, and to me, there's really no difference.
See, I came from blue collar and I'm in white collar now, and there's a huge difference to me.
Well, maybe money and stuff like that, but if we're trying to get rid of a stigma for people, it's just like calling people black or white and getting rid of those. So.
Right? And blue, white collar, that's just a way to put people in a box, right? We're so focused on putting people in boxes, or how do we, what is our differences, right? That's what we're so focused on, it seems like, right now for some reason. And really, what's ridiculous to me, right, is that we are so similar in so many ways that it makes zero sense that we're putting people in boxes, right? Because when you put someone in a box, that's just a way to be able to point your finger at them, right? That's really what the goal there is, okay? If we look at each other as human beings, right, and not as like labels or boxes, that is how we're gonna get through this kind of stuff, right? It's reestablishing that connection as human beings, okay? That's what's so important. That's why we need to establish community again, because we are so disconnected. Let's take a moment to reflect on the cultural climate around us. There's an ongoing devaluation of blue-collar work that is deeply rooted in our society. Higher education and certain societal elites have pushed the narrative that undervalues the work that you, the leaders in the construction industry, are responsible for. This narrative teaches that skilled labor is inferior to white-collar professions, creating a divide that is toxic and unhelpful. As leaders, we are in the position to change this narrative by making mental health a priority and treating workers with respect and dignity. We can begin to reverse the cultural stigma that holds them back. We are in a unique position to reshape the public perception of the trades, guys, and show these workers that they are not just manual laborers, they are skilled, valued, and integral to our country's success. So, the most important thing we can do, guys, is we need executive leadership to buy into this. The guys in the field need permission from the guys in the office to make mental health a priority, okay? It's not that we don't think mental health is a priority, okay? It's that we don't have the time to focus on it. As a superintendent, my job is to get this job done as quickly and safely as I can, right? And I'm not gonna waste time talking about mental health if that's not a priority within my company. So it's really critical that the executives, the business owners are giving their guys in the field the permission to focus on this and make it a priority, okay? Leadership sets the tone for the entire organization. If mental health is not a priority for you, it won't be for your employees either. By actively engaging in mental health initiatives, you set a positive, proactive example that helps break down the stigma around asking for help. Again, we're not expecting anyone to be therapists. All we're asking is that we create an environment where mental health is recognized as a key aspect of safety and performance, just like physical safety. Your support and commitment in this initiative will influence your entire workforce and ultimately transform your organizational culture. There's a clear return on investment when it comes to mental health initiatives. When you invest in mental health support, you see increased employee engagement, improved safety, reduced turnover, and a better overall performance. You'll not only save money, but you'll also create a loyal, dedicated workforce that values the support they receive. I'm gonna kind of skip through a little bit of the end of this, guys, just because I have Sarah coming up to give us some real world applications for how we can kind of deal with stress and some things like that. But quickly, some of the takeaways for this, guys. We want to create a supportive culture, and that starts with leadership. So leaders, be open, be approachable, and be committed to normalizing mental health discussions. Let's do some training and education, ensure all employees understand how to spot mental health struggles in themselves and others and how to address them proactively. EAPs are a vital resource. Make them easily and readily available. Educate your guys on how to take advantage of that kind of stuff, right? They might know that it's there, but they might not know what that first step is to actually take advantage of that program, okay? Give them baby steps. You might have to handhold them a little bit, okay? We're not used to asking for help, I will tell you that. Mantherapy.com is a super easy way, I think, guys, if you're looking for a way to kind of break the ice at your company. Mantherapy.com, they'll send you a bunch of free posters, all kinds of awesome resources there that you can put up around your job sites and your job trailer, wherever. The more little things like that you do, it's going to show your guys that you care about it, and it's going to, like I said, give them permission to actually take time and focus on this stuff in the field. I think that's really kind of about all I've got at this point. Any questions or comments that you guys have real quick before I turn it over to Sarah? Mantherapy. Mantherapy.com. Okay? Yeah, write that down. And like I said, guys, it's an awesome resource. You get some free posters, all kinds of good stuff. Yes?
So I just, with my own story, like the microphones, mental health is near and dear to my heart. And I think people, especially the Gen X era, we do not believe in talking to people. We feel that that makes us weak. I was in IT for 20 years, and you don't let your guard down whatsoever. But honestly, it was at a time that I was flying a lot. I was in first class. I, had it all, and I had a major panic attack right there, and had to get off the plane. And from there, I have suffered from anxiety and depression ever since then. And so that's why I'm very open, and I have found that people that I work with, one guy that was very well known in the IT market, he wasn't around very much, and so I finally asked. He suffered from anxiety so bad, he couldn't get out of the house. And this is a guy that's traveled all over, made big six-figure salary. So I guess my point of this is we come from an era where we've always kept quiet because we don't want to look weak. But please, 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 talk to someone. It's so common now, and especially with the juniors and seniors that are here today. Unfortunately, my daughter went through a period of thing and now suffers from anxiety, and it was because, holding stuff in. So, really talk or go to talk to someone, or be there for someone, and don't make fun of them and don't bully them, because this is a very common thing. But if anybody wants to talk to me, I'll give you my card. I'll tell you my whole story. So.
That's awesome. Just before I get off the stage, community, again, guys, is so important. Be a leader. Be open to showing that you are vulnerable as a leader, right? We need men that are willing to do that. I think we need men that are willing to set the example that it's okay to be vulnerable and have feelings, right? Being a man is not being emotionless. It's acknowledging that you have emotion, okay, and being able to deal with that. That's what being a man is. So anyway, with that, Sarah.
Too short to stand behind this, so I'm gonna come out behind the mic. So how's everyone doing? Love the energy in the back. So I taught middle school for like 20 years, so that student energy, I love it. Those are my people. Yeah, love it. Really quickly, before I get into a little bit about me, just gonna do a quick check-in, okay? Really easy. Now that Tad has got us in, this is gonna be interactive, so brace yourselves, it's okay. A little, maybe push you out of your comfort zone. So let's just start it with a quick check-in. 1 is low, like Sarah, get me out of here. 5 is like, I'm still here with you. So just kind of feel into your body, your mind, and just, we can do this non-verbally, so just let me know where you're at. So a 1 is low, a 5 is like, I'm still here with you today. So go ahead, get it out there. Just want to read the room. I love it. No middle fingers, that's always a good thing. I love it. All right. Well, welcome. I think I'm waiting for my presentation to come up on the screen, so hopefully that happens. And oh, sweet. Technology. My day is awesome. Thank you for asking. I appreciate you. And then your name in the back that was just asked that great question. What is your name? Deb. I really appreciate that question. I'm going off topic already because I just love the energy. I love these conversations. I appreciate what you said about earlier, right? If we're gonna channel the the schmigma that Cal has trademarked here today, I think utilizing the language that we address people that work in the trades, right? I was just sitting on a panel and the question was about construction workers. To me, workers also has that negative connotation. So let's address the people that are doing this incredible career. They're iron workers, they're laborers, right? They're people in the field, and so trying to normalize and balance that out. So I do appreciate that statement, right? Thinking about there's a lot of ways that we can break down stigma. So glad it looked like most of us were in that higher 4 to 5 range. I'm gonna do a little stress management at the end of this today, get you guys involved, right? This is a lot of the work that I do is around stress, so be prepared at the end to get up and move a bit. So a little bit about me. I was encouraged about 8 years ago to bring wellness, mental health, suicide prevention specifically into construction. Have a dear friend who's a glazer by trade. She saw first responders getting access to wellness resources and said, hey, Sarah, do that in construction. So 8 years ago, I walked into the International Union of Painters and Allied Trades in Northern California at 6 a.m., and we had an 8-hour class with everything from suicide prevention. We wrapped it up with a full yoga class. And that's been the journey thus far. Currently, I'm in Northern California on one of the CHIP sites in a resilience trailer. And so people in the trades, the client, and the general contractors have access to not only this incredible break room, sensory space, they have access to me, a confidential champion that gives them the courage, gives them the resource, gives them the understanding that there's support systems out there. I'm not their EAP, I'm not the foreman, I'm not HR. I'm purely just a champion for them to know that talking about their mental health and well-being is as important around their safety and their overall health. And so I really appreciate the opportunity to be that well-being provider, walking the job site, leading yoga at 7 a.m. during the mass safety meetings, and just having the opportunity to connect with the incredibly skilled tradespeople that are building our nation. And so a bit about what I'm doing right now. My presentation's, is it coming? Is it here? No. Okay. Does anyone have any good jokes before this gets up? Because I'm lost. No, I'm just kidding. All right, let's do an activity because I got some time. Tag got us warmed up, okay? What I'm going to ask you to do is I'm going to ask you to stand up if you're willing and able, okay? And this is going to move pretty quickly, so I need you to pay attention, right? Students in the back, I will use my teacher voice, and I'm going to need you to come back, okay? So what I'm going to have you do really quickly, okay? When I say go, you're going to find a partner in this room. I encourage you to go somewhere else in this room. Go find somebody new. You're going to find that partner, introduce yourself, okay? Partner A is going to get about 20 seconds to answer a question that I'll provide. I'm providing all the questions for you, okay? And then I'm going to say stop. Partner B is then going to answer that same question and in about 20 seconds to answer that same question, okay? The role of the listener is just to be an incredible, active listener. Does that make sense? Okay, ready, set, find a partner. You have like 5 seconds. All right, here we go. You ready? The question is, question 1, partner A is going to answer, whether you live in the state of Colorado or not, what is the best part of Colorado? All right, partner A, share that with partner B. Go ahead. All right, pause right there for a moment. Partner B, what is the best part of Colorado? Go ahead. the same question, just the other partner's answering the best part of Colorado.
So why California, though?
Family, life. Yeah, I love it. All right, pause right there. Well, you guys are a good audience. I love it. Okay, find one new partner. I'm going to ask a different question, though. So find a new partner. This is going to be a different question. Really quickly. Okay, just a reminder. Partner A gets about 20 seconds, and then partner B is going to answer the same question. So don't overthink it. All right, the question is, you ready? This is just like some inspiration from some of the incredible work that's happening right now. You're going to choose one action word, whatever it is you want to take away from today, take away from this really impactful work. Choose one word, like your word of the day, the word of the month, whatever it is, all right, and share it with your partner. What is your one word and why? Okay, partner A, go ahead. All right, partner B, go ahead and share your word of the day. Partner B, your word of the day. All right, go ahead and thank your partner, and then I'm going to have you all come on back. I know this is a fun activity, but I got to pause you there. Thank your partner, and then come on back to the room. Go ahead, come on back. Come on back, come on back. Don't leave yet. Come on back. And you guys can have a seat now. You can have a seat. I think I'm still waiting for my presentation to come up, so. Hey, Tad. All right, come on back, come on back. I know it's like recess. All right, what was that activity like for you all to have to do, engage in? What was that like? It was fun? Yeah, I see some thumbs up. Okay. Most importantly, how did you know that your partner was listening? Eye contact. What else? Nodding, you just shouted out. What else? Agreeing? Yeah. Okay. So our topic that Tad and I are addressing today is suicide prevention and leadership's role. And I like to start with this communication piece, right? Those conversations, those questions were pretty easy, right, to answer. And so what I want you to think about is when we have to ask the harder questions about suicide prevention, around mental health and mental well-being, can those conversations emulate what just happened in here today? Okay? A great leader has the ability to truly listen, right? How many of you in the room with a show of hands are like amazing listeners? Where are you? Be proud. Okay. And how many of you in the room would like to be a better listener? Yeah, me too, me included. So yeah, we're all working on it, right? So sometimes in these incredibly difficult conversations that we want to have with people, the best thing that you can do is just listen and be quiet, right? A lot of the times in the opportunities, people just need to say what is on their mind, right? We don't need to offer advice right away. We're humans. We want to do what? We want to help, right? And eventually we get to that help, right? But can we just be positive, impactful listeners and hear people for what they have to say? Validate, right? They may be struggling. Validate all of that. Check judgment at the door, right? And provide them the opportunity to move forward, okay? So next time you get into that conversation, think about the conversation you just had with a friend in here talking about how great Colorado is, right? That conversation can feel the same for both you and that person that's receiving that information. So, any update on the presentation or 2 more minutes? Awesome. Okay, let me think. Well, let me just start from my notes and think about leadership's role in suicide prevention. As I shared earlier, I am on a construction site, a live chip site in Northern California. Todd Lassiter's garage is my office. And this is a double-wide trailer that looks like a mini arcade. And it's an incredible break space for our tradespeople to come in, have a break, have a nap, grab a cold drink. But most importantly, they recognize that there's someone on site that's there to be able to support them. And so I'll definitely answer questions about how to make that happen. But most importantly, let's think about how leadership is able to maintain and grow these types of programs. We're good? So just me. I'm just me, the presentation today. It's awesome. Yeah, go ahead. Yes.
So we're talking about mental health and anxiety and addiction, right? And young people, how they're so addicted to their phones, and not even just young people, my 32-year-old daughter as well, right? But weren't we as Maya addicted to pinball wizards?
We have a Pac-Man machine in our space, so maybe there's an opportunity to make that connection. So yeah, I agree. And I think the generational piece that it's Dave, right? Dave, I think the generational piece that you bring up, because there's an interesting dynamic of generations in here, is that we look at overall, there's a younger generation entering our workforce. There's an older generation leaving the workforce, right? Congratulations if you're retiring. Or how are we bridging the gap of communication to ensure that all of these informational pieces are being heard? So that's another piece of work that we're trying to do. So we're up. There we are. Awesome. Thank you for that. He'll answer me, or I get to do it? He'll do it. Okay, I'm going to put this down. So thinking about leadership, right? Kind of broke it down into these categories, thinking about the strategy of how leadership can support safety, integration, culture and awareness, training and education. So this is kind of the lens that I see action happening, right? We're done talking about the statistics, we're done talking about it, now we're actually putting these plans into action. So will you advance me, please? One more. Okay. So there's a mass safety meeting. We hadn't started yoga yet at that point, but that's my site in Northern California, getting to address the client, the GCs, and then the tradespeople. So in terms of leadership, right, are we identifying the crew and the team that needs to be part of these leadership teams to ensure that mental health and wellness is integrated into their safety plans, right? Most importantly, do we have the time to train and connect together? Most importantly, right? Where is the time to train and connect together? Thinking about consistent communication is one of the most important points up here, right? How many of you all have done something for Safety Week on your job site within your industry, right? How about Construction Suicide Prevention Week? How is engagement during those weeks? It's usually pretty amazing, right? And then what happens sometimes after that? The next day, the next week, what sometimes happens? It's forgotten, right? Kind of trickles out, right? So thinking about how positive, impactful leaders makes every single day feel like Construction Suicide Prevention Week, Safety Week, right? We need to elevate those weeks, utilize those engagement points to make this a consistent practice day in and day out. Obviously, leaders have the ability to quickly pivot and shift, especially in a construction industry, which they're trained to do that anyways. And then, of course, lead by example and be ready to listen. So starting off with a strategy for our leaders, you can advance my next slide. So safety integration, right? Take kind of a deep dive into what does safety and culture look like already on your site, right? Think about what is the culture of just physical safety. Is there an integration of mental health and well-being safety as well? And how do you blend those two together? And then thinking about how can you fully integrate those plans and prevention pieces into your overall safety plan, right? Mental health, total worker health is not an add-on. It's not in addition to. It needs to be part of everyday plan, okay? My next slide, please. Next piece is culture and awareness, right? Thinking about the culture, not just of the job sites, right? I just talked about a generational gap. Look at the demographic of who is on site, right? Who is within your organization, and how do they view mental health and well-being, right? How do we bridge any gaps? How do we use the most proper language to ensure that people have access to the same type of resources, no matter where they are on their wellness journey, right? Most important thing that I've learned is we meet people where they're at. And everyone's starting at a different starting line, right? Most importantly, they're starting at a different starting line. My word of the year, or one of my words of the year, is I'm replacing self-care. How many of you are familiar with self-care? How many of you engage in self-care? How many are like, I have no time for self-care? Yeah, who has time for self-care anymore? So I've replaced this with resilience, because resilience is a form of self-care. 5 minutes a day, 10 minutes a day, how resilient are you in situations, right, can be your self-care. 100% support the real self-care, but think about how resilient you are. And strong leaders are vulnerable. How many of you have been on a job site or in a meeting where your highest leader shares their wellness journey or their mental health journey? How many of you have been there? And how impactful can that be? It's the most, right? So think about how can leaders be vulnerable, feel supported, and be able to share their story. I'm gonna advance my slide. Training and education. How many of you all have been to an amazing training in your lifetime? Awesome. How many of you all have been to an amazing training because you were in the room with like-minded people? Yeah. How many of you have been in a training and it was amazing because of the content? Yeah. The trainings that we usually remember the most are with like-minded people because they make the experience, right? Just like this conference, and kudos to you, Nick, to bring like-minded people, passionate people to talk about this, right? Because this is what we're gonna remember, the connection. You probably won't maybe remember anything I say, right? But we've connected now. There's a community of connectedness in here. So think about that. The next time you lead trainings or are interested in trainings, right? We're not just checking the box, we're connecting people. And keep training people, right? You can train them in the same topic, the same content. The more you do it, the more connected that room of people is going to be. So think about that as you lead with trainings and educating your team. The work that I do on active job sites, the most important part of the work I do, disruption, zero work disruption, right? So we have to get creative. Leaders have to build in time throughout the day to ensure that not only tradespeople, but leadership has the opportunity to receive that training, right? I'm not gonna stop the job. I'm not gonna stop an active working job to be able to train, right? But how do we make sure that time is still a commodity in both production and taking care of the workforce? Train my slide, please. And then thinking about, most importantly, right? Because I don't like data either. Very rarely use data, but we do want to be able to track success, right? How does on-site engagement with mental health and wellness, how can we track success? And we think about it in kind of these three categories, right? So if we look about the usage of my space, most importantly, the support utilization is up, okay? And that could be more calls to EAPs, that could be just more visits with me and just an opportunity to connect, okay? The engagement pieces are more people coming to trainings, are more people interested in seeing what work is happening for them, whether it's within their local union, whether it's on the job site, are they showing up more frequently? And I'll leave you this last piece here. I think peer-to-peer connection is where our work is the most successful, right? Because I can talk all day long about on-site engagement, trainings, and education. If we get people connected to the person that working out in the field together, talking to each other, that's when we find the most success, right? So how are we ensuring peers have access to each other? Okay, amazing. I know I'm running out of time. I am gonna try one more thing with you all because you've been amazing, and this is just a glimpse into my life. So beyond just passionate about being on site and supporting an incredible working force, I believe in supporting stress management. A big piece of what I do is around stress. So raise your hand if you have any stress in your life. Okay, everyone's hand should be up, right? Because there are two kinds of stress. There's eustress, our good stress, and there's distress, our bad stress, right? And so what I like to coach people on is like, how do we manage our distress, right? So in the light of a Sarah breakout session, we're gonna do a little hands-on, not hands-on, but interactive activity. So if you're willing, I encourage everyone around the room to stand up. I'm gonna push you out of your comfort zone. I'm gonna do it with you, so don't worry. Cal's taking pictures, but this won't go on like social media or anything like that. So just roll your shoulders back. Where do you all feel your stress mostly? Shoulders, neck, head, stomach. Sometimes people like call out their partner. That's not okay, don't do that, okay? So what I want you to do is roll your shoulders back, stand really tall. I do a lot of breath work. How many breath work or yogis are in the room? Love it. Yeah, get excited. Yoga is amazing. Okay, we're gonna do one breath work together, and I promise it's not scary. Okay, this is called the lion's breath, all right? And so what it is, I'm gonna do it with you, okay? You can close your eyes or you can look down, and then that feels sometimes a little bit more safe, okay? And this is a great stress tool. It's a practical tool. People will know you're doing this one, but I offer others that people don't need to know that you're doing it. But we're gonna do it because it's fun. So you're gonna take a nice big wide stance. Think about all that stress, right? Where are you right now on your stress level? Like a 1 through 10. 10 is high, 1 is low. So just think about maybe your stress. Again, with like fingers, 1 is no stress, 10 is I'm super stressed right now. Let's see what you got in the room. Okay. There might be some 10s because I'm gonna make you do something that might feel a little uncomfortable. All right, so here we go. We're gonna do it together. So the lion's breath is a great yoga. It's a great stress reliever. What it's gonna do is it's gonna be a big inhale in, okay, don't do it yet. And then the exhale, you stick out your tongue and you make like a cool lion's roar. Guys, it's so cool if we do it all like really loud and you just let all that shit go. Sorry, we're in construction. We can swear, right? Okay. You can tell I work on site, right? All right, here we go. Let's do it. Or maybe do it twice. Like, let's get loud. We got this. All right, so deep breath in. Stick out that tongue. Let it go. Yes. Doesn't that feel good? All right, let's do it one more time. We're going to do it one more time. We're going to take a deep breath in. Stick out your tongue. Let it go. Oh, yeah. Does anyone feel a little better? All right, you guys can have a seat. You can advance to my next slide. I think I'm running out of time. Oh, maybe. Close. I almost ended right on time. I'm good. That's my QR code if you're interested in seeing what on-site engagement looks like, what trainings look like. Happy to connect with you all. Nick, again, thank you for the opportunity and time to be here, and Tad to share the stage. But happy to answer any questions about on-site support or just what I do in general, and then I will turn it back over because I know we're close on time. So any questions before I depart and make you do any more breathing or yoga? Thank you.
Thank you, Sarah. I feel like a lion. Rawr. I like that. That was good. Yeah, I do box breathing before I go up and do speaking. The breathing is like a real technique. I love it. Thank you for that. Awesome. Okay, well, let's take a 10-minute break. Our next speakers have agreed to get us back on time so that we get out of here on time. So take your 10 minutes, do what you got to do, and come back in here or the next room.
Are y'all ready for the party to dance? Y'all didn't know we were having a DJ, did y'all? Wiki, wiki. That's all I got. All right, keeping us on track. My name is Monica Jacobs. I'm with DPR Construction. If you haven't stopped over to say hello, please do so. Our next session brings together two passionate leaders in the field of total work health, Dr. John Narain and Mark Ashby. Dr. Narain is a seasoned occupational health professional with a leading voice in bridging the gap between research and real-world application. His work centers on how we can use evidence-based strategy to support worker well-being in high-risk industries like construction. Hey, peeps. Thank you. Mark Ashby brings decades of experience from the field as a construction safety professional and leader who spent his career turning these concepts into tangible programs that change lives and company cultures. Together, they'll explore how organizations can move beyond compliance towards cultures that truly value and protect their people through collaboration, leadership, and a shared commitment to well-being. Please join me in welcoming Dr. John Ryan and Mark Ashby.
All right, good afternoon, everyone. I'm so excited to be here. My name is, you can just call me John. I am the executive director and founder of Recovery Friendly Leader. We train managers how to support employees in recovery and those that are struggling with addiction. We show managers how to have those difficult conversations and how to do that professionally and within what they're allowed to do in the workplace. And we are newer members of ASA Colorado, and very excited to be here tonight.
All right. You guys, they stuck us after lunch, after the district attorney or the attorney general, after all these great presenters, so you can tell right now that we are the bottom of the barrel. And I apologize for that. So, no, I'm just kidding. We have a great presentation and been working with the doctor now for some time, and I tell you, I just am so excited that we can be here. And we need to get down to some of the real reasons of why we're here, and that's that the construction reality. Things in the world of construction are tough. Y'all lead the industry on. You all lead the industry with some of the highest substance use disorders in the entire world. Unfortunately, and I don't want to have to be the bearer of bad news, but 15% of all construction workers have an admitted substance use disorder. So if we look at that closely, what does that mean? The national average is 8.9%, so it's almost double what's out there for everybody else. And we look at that, they report 16% have a heavy alcohol use rate, 11% illicit drugs, and those are going to be the ones that are illegal, okay? So unfortunately in Colorado we've got alcohol and we've got cannabis, so it's everything else. So methamphetamines, amphetamines, fentanyl, all the big drugs that are out there. Construction workers are 7 times more likely to actually die from opiates, which is incredible. And out of the entire workforce, construction workers make up 25% of all fatal overdoses. And it's a sad reality, but a lot of this comes back to stigmas. It comes back to shame associated with having a substance use disorder, which is not appropriate. And we can't fix what we won't face. If we're not willing to step up, if we're not willing to address this issue, then nothing is ever going to change. And that's kind of why we're here today. So.
Next slide, please. So we use, this is me? Oh, there you go, thank you. If you guys remember, we used Slido a few times today. Do you guys still have that on your phones? If not, there's a QR code on the screen. Actually, does this go back? Construction reality. Yeah, before we get to that, it's the wrong question on the screen, but the question I want to ask everybody is, this topic is about recovery-friendly leadership. And I just want to know from you guys, when you hear that, what is that? What is a recovery-friendly leader, or what is recovery-friendly leadership? As you punch in your answers using that code, I believe it's just going to pop on the screen, and we'll see what you guys think. Relatability. Oh man, this thing tells you how many people are typing. That's pretty cool. Integrity, nice. Empathy, support, yes. Vulnerability, listener. Community, I see empathy a lot. Peace, love. Discipline, that's a good one. Safety, integrity. Authenticity, strong. Compassion. Yeah, I mean, guys, you're all on the right path there. I mean, if I could just simplify it, a recovery-friendly leader at its base is just someone who's able, who's willing and capable of supporting an employee. So that could look like a coworker, right? Because sometimes we go to our coworkers because we're too afraid to go to our managers. We're more willing to trust them with something and explain something to them, or to share something that really is so personal to us. That could be the supervisor, a manager, the director of a company, anyone who's able and equipped to support employees. A recovery-friendly leader works somewhere that's going to support them, supporting employees. I mean, the last thing we want to do is help an employee feel comfortable coming forward to ask for help just to find out we work somewhere that's zero tolerance, because we just cause some harm. That employee may not ever trust any workplace again if they're struggling with anything at all. So we want to make sure that we do work somewhere that has these principles, this culture, the policies that are going to protect the employee and keep the workplace safe collectively at the same time. And also, a recovery-friendly leader is going to go back and practice what they've learned. We had a lot of good information here today, and we wouldn't be doing our jobs, or we would be doing, honestly, our company a disservice by not going back and actually trying to implement the things that we just learned here at today's session. So, great answers, guys.
Thank you. So why does it really matter? Why should we go through all the trouble of putting together a program for people? Why should we push? And it doesn't happen overnight. Really, it comes down to 3 areas, and we're going to look at the safety part of it first. And that's really that it just costs a lot of money. Unsafe decisions, delayed judgments, they lead to fatalities. And if you've been on a job site where someone's been hurt, things shut down. If we're waiting for OSHA to come in and do their investigations, things shut down. And it really does take a toll on your people emotionally. And the human factor of it is that obviously we know everybody matters. Every human matters out there. Okay? Every person has a name. Everybody has a family. They have people that they care about. Substance use isn't just a moral failing. I think a lot of times we look at that and see it as something that's wrong with a person, when in reality it's usually just a symptom of stress or trauma or just life skills. I worked previous to this as a police officer for 24 years, and I gotta tell you, I've got some stuff that I carry with me. And is that my fault? And it's not. And so really, I look at all this, and why does it matter? It's because it's you, it's me, and it's the people that we care about. On a business side of it, it really leads to more incidents. Impairment leads to more incidents. And the downtime and the claims that we put together, they add up. And here's the bottom line, that if employees feel safe and supported, they stay. How many of you have retention issues right now? How many of you are finding it difficult to fill your employment ranks? If people feel safe and supported, they stay. And that's something that's important for us to recognize.
So now, when we talk about leadership and modeling these behaviors, this is just a snapshot of what it looks like at 3 different levels of the company. Right? At the individual level, we're talking about how do we as leaders show up at work, both personally and professionally. How are our attitudes? How are our behaviors? How do we perform when we show up at work? And from the employee's point of view, what they're looking at you for cues. Like, can I trust my manager to support me? Can I share things with them and trust that they're not going to blow their head off or get angry or dismiss me or whatever it is, or they're actually going to be attentive and listen? At the crew level, right, when we talk about these supervisors or managers, it's about how they actually model these behaviors in real time, right? The way they communicate, the way they respond to concerns, and how they handle challenges that are difficult, right, to talk about in the workplace. I mean, when someone is having a performance issue and they're coming to you, or you're having to address that, and someone discloses that the reason is due to substance use, that is a whole different conversation, and we need to know how to handle that both professionally and without crossing lines into trying to be a treatment provider or a counselor, because that's not the role of the manager in the workplace. And also at a company level, when we're looking at everyone all together, how are we showing up in our culture? Is the way we approach our decisions aligned with our mission and our vision of the company and the values that we decided that we are going to live by as a company? So with that being said, is there a way to reset that?
Yeah, it's not working very well.
No? Okay.
Let's just add to it.
Okay, let's add to this one then. So let's discover, when you hear core values, who knows what core values are? Just shout it out. I'm going to call on someone. Yeah.
They're what you live by, like your personal code.
values that are down to your core. They're what you live by, right? They're principles, are your beliefs. So I want each one of you to name your top 3, thank you very much, by the way, your top 3 core values, the things that you personally live by, and just share them in the Slido app. Integrity, empathy, kindness, loyalty, integrity, love, integrity, grit, grit is a good one, empathy, commitment, trust, integrity, caring. So I'm seeing a lot of empathy and integrity. It's a very, very good group that we have here. Yeah, and if you noticed, a lot of people putting integrity and empathy, that's how a company forms what their personal values are. The mission, the collective culture, right? The people that made up this company that share these same values, that's how we discover what the values are, what's going to drive our day-to-day actions at work, right? In order to really support people and to guide them effectively, we got to know what it is that's going to drive those decisions. Are they aligned with integrity? Are they aligned with empathy? Right? Core values, like I said, this is how we approach situations, especially when it comes to difficult ones with employees dealing with substance use challenges in the workplace. So values are meant to be just more than just words on paper. Right? They're meant to really, really be the thing that that guides how we live and interact with each other in the workplace. Yeah.
All right, so I'm not a podium guy and I'm not a stage guy, so I'm going to stand right here. That way we can pressure you into talking some more. But let's dig deeper. Let's go into the individual level and what does that mean and what does that take. So let's just be honest here. People will do what they see you do. They will say what you say, and they'll act the same way that you act. They're not going to sit there if we stand up here and lecture you for an hour and tell you how to be, but we act opposite. They're not going to do that. It's important that we act with vulnerability and integrity. And I've got to tell you, I come from a world where you had to be tough, you had to put up with everything, you had to see bad things and not worry about it. And I am so not like that anymore. Now, I'm not at the Hallmark Channel level yet, but I'm getting there. But I truly do. If I'm happy, you're going to see I'm happy. If I'm upset, I share it with you. And the empathy over judgment. How many of us have something we'd like to change about ourselves? All right, keep your hands up. How many people have more than 2 things? How many people have 3 things? All right, I'm like at 15, so we're not going to go there because it's going to be too long. But we all have things that we need to change. And I've got to tell you a story really quick. It's somewhat embarrassing, so I apologize ahead of time. But growing up in a household with a substance use disorder, my mom used alcohol to combat anxiety, depression, and a bunch of other things that she was dealing with. I translated that years and years later to when I was a cop. I would pull over people that were DUI. That's my big thing. I look for people that are on drugs. And so far, you guys look okay. I haven't made it to the back yet, but I'm just going to stay up here. It's all good, guys. It's all good. The students are all like, hey, leave me alone. But I found myself treating people differently. I would treat women harshly. Not mean, not illegal, nothing like that, but I was snappy, I was rude, I was very just, all right, this is that, have a good day. And I finally had a moment with myself where I said, you got to stop. You've got to stop and not place those feelings onto every other person in the world. So whatever you've gone through in life, wherever you've been, you can't let that be what drives you to treat people differently. So act like you want to act like you say, make your words, make your actions, okay? And on an individual level, welcome people who are going through these challenges. You heard the Attorney General say what? That these people that are going through this are the strongest people in the world, okay? Treat anyone going through recovery in that same way, and that's important, so. All right, on the crew, how many people are supervisors? All right, good. You got to lead your crews with integrity. You've got to lead them with honesty. You've got to empower your supervisors on what to look for, okay? Both of us, the doctor and I, both train in reasonable suspicion, and that's something important. You've got to be able to know when behaviors indicate that there might be a substance use disorder. If we can stop that behavior before it causes injury or harm or hazard, then we're doing ourselves a favor and we can intervene quickly. So you need to empower your supervisors on what to do. You need to respond to people in a way that's caring, not punitive, not with anger, not with disgust. And then we need to promote the peer support systems that are out there as well too. I have personally gone to counseling. I've personally used EAP. I've used all sorts of different help because I had to, because I needed it. And I encourage you to do the same too, that if you get into a position in your life where it causes you harm. And then what would a recovery-friendly crew look like? Well, we probably don't start off our safety briefing with, oh guys, I drank so much last night. Well, you were at the Rockies game, so I give you a little credit. But honestly, we have to start modeling the behavior that we want to show. And promoting or encouraging or glorifying substance use can't be a part of that. It just can't be a part of that. So model the behavior, act as an individual. Start over. Act as the individual you want to be, but model the behavior that you want your crew to have. And nobody on your crew should be ashamed or embarrassed or scared to come to you if they're not in that perfect place. Okay? Thank you.
Yeah, thanks, Mark. So let's take a look at a scenario, what looking at all this stuff looks like in real time here. So let's say your construction company is hosting its annual holiday celebration at a local event. The entire crew, from project managers to field employees, are invited. Details of the event were shared in advance. The event includes food, music, a sponsored bar serving both alcoholic and non-alcoholic beverages. During the evening, Tim, a valued crew member who's new to recovery, walks up to the bar planning to order a non-alcoholic drink. However, when they look around, they notice everyone else has ordered beer, wine, or a cocktail. They suddenly feel uncomfortable and uncertain about what to do. They don't want to draw attention or feel out of place in front of their coworkers or supervisors. So my question, or our question to you is, as a supervisor or crew leader, what are some things you can say or do to help ensure that employees in recovery, or those choosing just not to drink, feel comfortable, feel included, and supported during company events?
Yeah, offering non-alcoholic options or even mocktails. Mocktails are a great way to blend in with other coworkers, and they generally don't even know.
So having a non-alcoholic offering, and maybe showcasing that as well. Yeah, great answer. There's one up here, Mark.
It's a race. One of our trade partners, they actually have sober tables. So everybody that is in recovery, even people that are not necessarily in recovery or dealing with substance use disorder, they sit there, and the agreement is there will be no alcohol at this table.
So having a designated area,
Yeah.
just with
And
non-alcoholic.
it was the employees in recovery, it was their idea to come up with the sober tables.
Oh, awesome. So not only did you have that offering, you had that input from them, right? That's a inclusion value right there. Thank you.
If you are leadership or know that you have somebody on your team that is new to recovery, making the choice yourself to help model that it's okay that you're not drinking that night, and kind of in solidarity, show up from them that way.
It's an interesting answer. It kind of fits the theme of what we're talking about, modeling it yourself. By doing that, we kind of normalize that it's okay not to drink at this event, right? Someone can then feel less fearful about maybe they all have eyes on me. Why am I not ordering that drink too? Because my manager should. That just showed that it's okay to do. Thank you. Yeah, I mean, these are all excellent, excellent answers.
Thank you. So when we're looking at this, we need to respond in an appropriate fashion. But how often have you known people that when they actually hear something, they blow it off or they don't respond at all? And that's the biggest thing that we have to worry about. We got to worry about the assuming that it's not a problem, that we're looking at it going, oh, that's just Mark. It's no big deal, okay? He just acts like that. Or maybe to just walk up and accuse somebody or ignore it. All of these things are not proper. So obviously we want to observe the behavior. We want to pay attention to our crews. One of the things that I preach a lot to my trainings is that you have to know your employees. So supervisors, you've got to know them. You've got to know their name. You've got to know what they're like. On a normal basis, if I'm not trying to be your best friend and say bad dad jokes, I've got plenty if you need them, then there's something wrong with me. You better pull me aside and be like, Mark, are you okay? I don't need you to know my birthday. It's in May. My favorite color, blue. My least favorite dog, hound dog. You don't need to know those things, but it's important that you know when I'm off. Because your first sign of telling if something's going on, if that person's not normal, to the normal that they establish. And then what do you see? What do you hear? And what do you smell when you document? I really want to encourage you to use tangibles, and these are signs, they're not symptoms. So a sign is something that doesn't matter who you are, what you are, or any of the other factors. It's just a truth. It's just a truth. And that takes things into the discussing with the employee as well, too. Again, consider that you're in the seat and they're not. Maybe the roles are reversed. How would you want to be treated? And a lot of times I encourage people to use I statements. I smelled this. I saw this. I heard this. Okay? Those are important because it allows you to put the behavior in front of you, not in an accusatory way. And then obviously we've got to take action when action is needed. You can't be somebody's friend and leave them on the job line. Okay? We talked earlier with some steel guys, and they're like, if there's something wrong, I can't have them up in altitude. It's just, we have to take action. All right? But we can do so in a way that doesn't demean that person, that doesn't embarrass that person. So finally, if we protect the person, we protect the team. And you are obligated to do something, okay? Just treat others like you want to be treated, but definitely take action and take good documentation along the way.
So now what can we do at the crew level, right? We talked a little bit about the inclusive work culture, but what does that really look like? I'm a person in recovery. What that means for me is I haven't used drugs or alcohol for many years because I don't know how to. I've tried many times to use it safely and responsibly, and it does not work. And I remember years ago when I was sober for a few months, I was working at this company, and I relapsed. I returned to use, and I missed work that morning. I came to work early on a Tuesday. I saw my boss come in, and I couldn't live this lie. So I gathered whatever courage I could. I went into her office. I closed the door, and as soon as she looked me in my eyes, I admitted that I did not come to work because I'm an alcoholic. I didn't drink any alcohol. But that was the closest thing I could come to because I couldn't admit that I didn't come to work because I was too high on crystal meth the whole weekend. Why? Because I'm going to get fired, because you're going to judge me, because that promotion that I want later on is never going to happen, right? So when we talk about inclusion, how do we look at people who are addicted to drugs no differently than those addicted to alcohol or marijuana? It's all a substance. They all fall under the umbrella of substance, but we treat each drug differently, and then we treat each people differently who are addicted to different things because of their social acceptance, because of their legality, whatever it is. It's all addiction, as we learned today, right? Cal did a great presentation on it's all addiction, right? There was no specific drug differences. It's all addiction. When we talk about policies, we mean how do our policies reflect the values that we all just determined that we have collectively? Right? And some of those include having fair hiring practices. If there's a gap in someone's resume and it's because they went to treatment but have made a decision to turn their life around, how do we not hold that against them and give them a second chance? There's a lot of programs out there with models built around how to do that in a way that's both effective for the individual and the workplace. You know, I worked in workplaces where the policy says one thing. It says we can have a 15-minute break. It says we can have lunch. It says we can leave at 5. But if you looked around, everyone who did not do that, who did not take a break, who didn't take a lunch, who stayed late, they were the ones getting promoted. And you were never to ask your manager and put them in a position to admit that. Heaven forbid, because they're going to find a way to fire you after that. So are we demonstrating as managers that we mean what our policy says? When it comes to accessing supportive resources, do employees have a clear pathway and understand and feel comfortable using things like EAPs, which we heard today? Just because you have them, do employees actually understand that they're confidential and believe you? I worked somewhere where one of our team members needed a 12-step program, and the manager was so supportive to her face. But I was privy to closed-door conversations where they made fun of her for needing that cult, for needing God. And then when it came time for me, do you think I was going to admit it? I know with how they really felt. So my access to a supportive resource was not exemplified by that manager anymore. He took it away from me. And the whole point of all this is leading by example, right? Are we expecting employees to show up on time and we come in an hour late with a Starbucks in our hand? Are we demonstrating the same standards that we expect out of our employees or are we just telling them what they need to do and we're exempt from it as well? Right? This is all about how to show support. I had a call with a workplace that was trying to understand how to uninvite an employee to a celebration because they may have a problem with drinking. I said, well, first you have to change the purpose of the celebration, because this is about come if you can drink, and then we'll celebrate our new client. But if you're trying to do a team building, camaraderie event together, then we got to talk about how to show them that, and it doesn't surround itself around alcohol. And we luckily did come to a solution that worked for everyone, and it was great. Tools and resources that you guys can use when you go back to your workplaces. The first one is the Colorado Recovery Friendly Workplace Toolkit. It is a kind of a step-by-step guide of how to become a recovery-friendly workplace yourself. There's some practical strategies in there involving sample policies, culture, resources, services and programs that you can offer your employees. The Colorado Recovery Friendly Workplace Initiative is here, who can help you become a workplace that can support employees. Recovery Friendly Leader, the booth right next door, we do the managerial training. In fact, if you're a business in Adams County or know someone in Adams County, you have people working in Adams County, we have a grant for the next year to help train them. So come talk to me afterwards. And Mark may have a few more.
Yeah, National Safety Council has stuff as well and posters that you can put up. So you can go along the internet and get this information as well too. Maybe you put it on the back door, maybe you put it throughout the workplace in the break rooms and stuff like that as well. And make sure that the numbers on those posters work. So if there's a website, make sure it actually connects. If you're using a company and you change, make sure you put the new company information up. That information is only valid the one time that somebody goes to use it. And then if it's not right or wrong, if it's wrong, they're not going to try again. And so that could be a failed attempt right there at success. So, all right, leading by example. Is this possible? And the answer is absolutely. So I met Nick Williams years ago, and we worked with his company, Absolute, for a long time. And we built together a policy of inclusion, of an empathetic background. And we didn't scare people into, you will do this or else you're going to get fired. We had a case where one of the leaders of the company had issues. Life happened, right? And things went from worse to worse to worse. And finally, I showed up. I did some limited drug testing, and I showed up. And we didn't have to do any drug testing. The individual started crying, ran to me, hugged me, and started telling me exactly what was going on, because he was waiting for me to get there so that we could put the process of healing into place. And I've got to tell you, I've never forgotten that moment. That was huge. Is it possible for you and your company to do this? Absolutely. It doesn't take that much. It just takes that you put your caring self forward, and you may take some risks. It might get a little emotional. It might get a little mucky at times. So be it. You guys are big enough for that, okay? So lead by example. Make sure your policies don't encourage you to inadvertently cause people to relapse, to put them into scenarios. And I was out of state doing a conference for a huge electric company. And the owner of the company literally stood by the counter, by the side of the stage with his watch like this. Within 1 minute, I got done. He looks at me and says, "Thank you very much." Okay, guys, out in the lobby are the beers. Remember, you only get 2. And he looks at me. And there were probably 1,000 beers out in the lobby for about 200 people. There were no alternatives.
Yeah.
There were no alternatives. So you tell me, what's the outcome of that going to be? We've got to put traditions or old habits to bed. We've got to start new, and we've got to start doing things better because your people are worth it. So.
All right, as we close today's session, I know we're coming up on time. Again, I'm all about the action and solution. So out of everything you've learned today, you've heard today, even in this session right now, what is one thing you're going to take back to make your workplace more recovery friendly, to make your workplace a place that employees who are either struggling or just trying to maintain their sobriety or recovery, whatever that looks like for them, they feel comfortable enough to do so? See, 8 people typing, 6 people typing. I scared 2 people. Try to get leaders to lead by example, yeah. Call Mark and John. Yeah. Yeah, you can absolutely call me.
Take the alcohol out of the fridge. There's a start.
Yeah. The cafeteria fridge. Is that the students? You have alcohol in your cafeteria fridge? Oh, man. Be vulnerable. These are all great. I'm going to encourage all of you, before I turn the slide, just take a picture of what you see here on the screen. Remember what's written here so that we can actually take it back and at least try something. And I encourage you to try something that someone else wrote too, because we do this together. We do this collectively. Other people have great ideas that we can take back and implement as well. Key takeaways.
All right, you guys, we are so thankful for you. We're thankful for your time today. And the fact that you're all vulnerable today means the world to me. So thank you so much for doing that. We both work for a living. If we can help you, please let us know. We'd be happy to step up and take care of you. But regardless of that, please just make a resolution for next year to do something better. Take that list and do something better next year. Thank you all for this. We appreciate you. Enjoy the rest of the day.
We have plenty of time for questions. Did you guys already do that?
Sure.
Did you already do that or no?
No.
Okay, good. Yes.
You want your water?
Yeah. Does anybody have any questions for this? Okay, if you do, raise your hand. Go ahead.
Okay, I just want to take a moment to celebrate one future leader in the industry. Jada, stand up. Jada. Oh, Rita, stand up.
She's back there. The person
Yeah,
talking to you is over
stand
there.
up. So Rita, what is it? Rita. Yep. So Rita has been waiting all day to win a set of Legos from my neighbor over here. And she won it today.
Oh, nice. Good job.
Look, bring it up. Raise it up, Rita. Raise up. Where's your Lego set? Where is it?
Right in
Raise
front
it
of
up.
her.
Nice.
I have a question. If you guys had to answer this question like simply and in a way that we could be super efficient, leaving this room, everyone in this room, what is one thing that you would recommend we all leave and start doing on Monday to be better recovery-friendly leaders without a budget without cost, without timelines, what's one thing we can start on Monday?
Yeah, that's a really easy one. So you see that green table? It costs nothing to talk to somebody and become a recovery-friendly workplace. The steps involve the assessment, the advising sessions, the training. It is 100% free. So, and they can also answer questions of where to go from there as well. I also provide free consultation. So you can start the conversation. If you don't know where to begin, those are 2 free conversations you can at least start having so that we can meet you where you are and see what's going on. What's the temperature like at your workplace?
All right. I would say stay engaged with your people. I would say learn to know your people. I've said that already. Stay engaged. Watch them, care about them genuinely, and just look to see if things are different. And if they are different, then be brave and say, hey, let's talk.
Cool. Thank you, guys. All right. So hey, beautiful. Okay. So we are ahead of schedule. How the hell did that happen? Good job. We're a little bit ahead of schedule, so let's let this room catch up. Let's take 10 minutes. I'm going to tell them the bad news. They have less time. But let's stay ahead of schedule so we can get you guys out of here on time. So how about at 3:10, we get started with the next session in here, and I'll tell everybody next door. So if you guys want, this is the final session of the day. In here is Beyond Compliance, creating a family-first mindset with David Ruddy from Pinkard and Matt Ogle from J.E. Dunn. And next door, we have Back to Work, Built to Last, and that's Return to Work Strategies from Don Rivkin with CRS. All right, see you in 10 minutes.
Well, good afternoon. We are going to get started with this session. 1, 2, 3, here we go. So the Ascent starts here. This is the safety summit that's put on by ASAC. This has been pretty awesome, yeah? Yeah. But I guess not awesome enough because people have left. People have left in droves. It's okay. That's all right. We will have a good time this afternoon talking about this journey as it relates to working in our construction world. Who works in construction that's in here? Right? Yeah. Okay. Very good. So my name is Dave Ruddy. I've been a safety guy since 1984. Started a couple days ago, or decades ago, I guess. And it's been a pretty awesome journey. I've seen a lot of changes. Started my career in the United States Coast Guard back then in 1984. They sent me to the OSHA Institute in Des Plaines, Illinois for respiratory protection. It was my first OSHA class. And I've been doing it ever since, on and off here and there, and I've gotten to meet some great, great people. Let's see, I worked for Pinkard Construction as their safety manager for the past 10 years. And before that, I did some consulting work, and I worked in the oil field for a while, utility contractor for a while, and even a safety guy at Home Depot for a little while. That's kind of boring. Safety guy at Home Depot, that was kind of boring. So I got back into construction. So here we go, right? So in the beginning, what happened in the beginning? God created the world, right? You chose to work in construction. That's what happened in the beginning. I'm not going that far back, okay? Right? Or maybe you didn't. Did you choose to work in construction? You chose to? I've heard a lot of people say construction chose me because of dad or uncles, right? So I like to think I chose to work in construction. It's a pretty awesome place to work, isn't it? Can't imagine sitting behind a desk all day long. Nothing against the lawyers, but they do a lot of desk sitting, okay? In the beginning, your coworkers taught you how to do it, right? Who's got a mentor, coworker person that taught them how to do something? Run a skill saw, run a demo saw, run a piece of equipment, excavator, whatever, right? Your coworkers taught you how to do that. Do you think they taught you how to do it the right way? Did they maybe teach you any shortcuts? Maybe, yeah. Okay. So in the beginning, you chose to work in construction. Your coworkers taught you how to do it. You've done it 100 times before, haven't you? How many times have you run that skill saw across that 2x4 while you're on your shin? Or run that demo saw without any hearing protection? Okay? Hundreds? I wish those kids were still here. I really wish those kids were still here. Because they're the ones that need to hear a lot of this stuff, right? We don't want them to move down the shortcut path, okay? So in the beginning, you know the game plan. How do you know the game plan? How do you know the game plan on your construction site? The beginning of the day, how do you know? How do you know the game plan? You got to communicate it. Who communicates that game plan? Who? Superintendent? Who else? The foreman? Safety personnel? Okay. Okay. How about your wife who says, hey, don't forget I need you home by 3 o'clock to pick up the kids to take them to the baseball practice? Oh, that's not what we're talking about? Oh, okay. All right. But some of us have outside game plans that affect our day, don't they? They do. I got to get home and take the horse or the vet's coming to take care of my horse tonight. So I got to get out of here, right? Okay. So, you know the game plan. The game plan is just the beginning. What does that mean? The game plan is just the beginning. What does that mean to you? Anybody? Okay. Okay. Unknown. The game plan is just the beginning. We know we're going to be victorious today and nobody's going to get hurt because we did our pre-test safety planning. We've been lined out by the superintendent. The foreman told us all the hazards of the job site. I am trained to operate this skill saw properly. I'm trained to stand properly on this ladder. Okay? All right. You're still stuck in, I'm not sure sometimes too, though. If you're a new person getting into this industry, you might be stuck in, I don't want to ask that question. I don't want to look like what? I don't want to look like the fool who doesn't know how to use whatever it might be, that powder actuated tool. It looks pretty simple. I put this little thing in there, and then I put this other thing in the other end, and I push down, and it goes boom. How hard can it be? Okay? Anybody ever been in that position where you're like, oh, I don't want to ask that question because I know how to do it, and if I don't, I'll figure it out. Right? Yeah. I was chipping paint off the flight deck of a Coast Guard ship back in 1980, and we were using these things called needle guns. So needle gun is run off of air pressure, and it's got needles that puncture the paint so it chips off the steel deck. And it's run by pneumatic. I'm like, yeah, that looks pretty simple. So I had my safety glasses on. The needle gun started having troubles. So I better do something to fix it or I'm going to get in trouble from the chief. So I go and I take the quick connect apart. Still full of air pressure, right? The one end goes, bam, hits me right in the cheek, right under my right eye. Okay? It's like, well, this is not good. I'm going to sick bay. I hadn't been trained. I didn't know. Nobody told me. Nobody told me. Okay? I was stuck. Well, I'm not sure, but I'll figure it out. Okay? So in the beginning, there's a moment before the fatal choice. Okay? What do you see in this picture? What do you see? You see a guy standing on a ladder. Okay? Where is he standing? Is he supposed to be standing there? Is there somebody else in that picture? Yeah, there's another guy.
Taking the picture.
No. There's another guy in front of him standing on a ladder properly.
Okay? Could this be a fatal choice to stand on the ladder this way? It could be. You know what happened 30 minutes prior to me taking this picture? We did a toolbox safety talk on proper ladder use. Do that again. Don't. We just had done a toolbox safety talk on how to properly use a ladder. If what? Oh. I even pulled the ladders out and stood properly, and I just was floored. And I walked around the corner, and when I take photos of our job site, these are my guys, Pinkard guys. I was just like, rah. Okay? So, you go from a worker to being a scared human. Yeah, that happens right before that fatal choice, because if he's, right? Oh, Nikes. He's that scared human being. Okay? You've been trained, you know the risk, you've got the training, and yet what do? Sometimes do people make a choice? They make a choice. Why do you think that fella made that choice? What? Convenience. Okay. What else? Complacency. Schedule. Why didn't the other guy stop work and say, whoa, dude, we got to get a taller ladder? Schedule. Yeah, this is a job that's really hard pressed to meet the deadline. Okay? But he made a choice. Well, you made the choice. It's your choice. I'm just trying to help you get the job done. Okay? Okay? But wait. Ooh, no one told me about these hazards on the job site. Nobody told me about this ambulance ride I could take if I don't do this properly. Nobody told me about losing a finger. Nobody told me about the opportunity I have to stop work, maybe. Or maybe I was just grab-assing instead of paying attention during that part of the training. Okay? How's this going to get fixed? What's this going to look like? Got an aerial lift with a guy coming down in a stretcher, getting ready to go on a gurney. How's that going to get fixed? What's that going to look like? You know what? What is his family going to think right now? When his family gets the phone call, hey, Dave's not coming home today. He's sitting in the hospital bed. What's the family going to think? You guys ever heard safety first? Yeah, have you seen it? In posters, hanging on walls, on signs. I was walking a warehouse one time, and I saw family first sign. Like, family first. And then it said, safety always. So I have absorbed that into my lifestyle as it relates to going out and talking to people and coaching people on job sites. Family first, safety always. How does that sound?
It sounds good, Dave.
Does it sound good? Why, Nick?
Well, I know you, and I know you believe it, and I know you live it.
Anybody else? Why does family first over safety first sound good? Okay. Priorities might change based on the schedule. Because what's really king on a job site? Go ahead and say it. Production, schedule. I've been a safety guy for, like I said, 4 decades. I know what's king on a job site. Okay? But if we can take family first, safety always, and combine it with schedule and productivity and quality craftsmanship, what are we going to wind up with? A great product and a safe job site and a family that you get to go home to and hug still, or ride the horse, or do the fly fishing, or play soccer. whatever it might be, right? Family first, safety always, okay? So, who's going to care for me? Who's going to care for that guy? Quick story. Guy fell off a ladder, broke both of his wrists. Who's wiping his ass for 6 weeks? True story. Right? Who's taking care of that fella for 6 weeks? I'm telling you, I don't want to be that guy. Okay? What happens to me now? I'm the coach for the Little League soccer team in my community. And I have a broken leg because I fell off that ladder you saw a little bit ago. How am I going to coach these little guys? Or I'm the choir director at my church, and now I'm in a wheelchair. How you, right? So we heard a lot today about money, how much it costs in direct and indirect costs. We're talking like $200 gazillion in some places, right? I mean, at least billions and trillions, right? My bottom line when I do a new hire safety class for my fellows at Pinkard, my bottom line is exactly that. The family, the community, the events with your children, that's at the bottom line of my photograph as it talks about how much an injury costs. Because that's really the bottom line in my world. How much damage did I just do to my family because I chose or didn't know or wanted to take a shortcut? Because that's what I was taught by some other guy who's much older than I am. Well, he's got to know. He's still got all his fingers, right? Okay. There's this concept, if you will. Think of this road you're traveling on. It's the safe road. It's the OSHA compliance road, or it's your culture and you have a better than OSHA compliance safety program, which is great if you do. What's on either side of a road typically? A shoulder and a ditch, right? Shortcut. There's a shortcut side. What's on the other side? Complacency. You get complacent, what might happen to you? You might skip that JHA one morning. Oh, we've done this. We know what we're doing. Oh, it's just training on how to use a demo saw. Really? I don't need to do that. I've seen the guys do it. You take that shortcut. You get complacent. Oh, okay. So, how many times this has got to happen? How many times do we have to put men and women in the hospital? What do we say? We lose 1,000 construction workers every year? How many times do we have to lose 1,000 construction workers every year? Or the tens of thousands that wind up in the hospital? When is enough enough? When is it? Is it when my family member, my son's an electrician, when he gets, hurt or, peripherally never killed on a job site? Is that going to be enough? We got to think about that. It's a personal thing. Did you make a choice to take that shortcut? Oh, I hope not. Okay? We've got this thing called normalization of deviation. I'm sure many of you know what this is with regards to safety professionals, but here it is. Okay? We grow into accepting a standard that isn't necessarily the correct standard, and we continue to do it because nobody called me out. That guy standing on that top step of that ladder, you know that wasn't the first time he'd done that, right? You know it wasn't the first time he'd done that. It's the first time I caught him. Okay? But we get into this normalization of deviation. That just is that's that ditch side of the road where we get complacent. Okay? Not good. Not good. Here's a poem. Take a minute to read, I will. Okay? As it relates to safety on the job site and how, who's seen this poem? Anybody use this poem as a toolbox safety talk? I use it as a toolbox safety talk on at least 6 months or so. But here it is from Don. I could have saved a life that day, but I chose to look the other way. It wasn't that I didn't care. I had the time and I was there. But I didn't want to seem a fool. Oh, man, I don't want to be a fool. Okay? Or argue over a safety rule. I knew he'd done the job before. If I spoke up, he might get sore. The chances didn't seem that bad. I'd done the same. He knew I had. So I shook my head, walked by. He knew the risks as well as I. He took the chance, I closed an eye, and with that act, I let him die. I could have saved a life that day, but I chose to look the other way. Now every time I see his wife, I know I should have saved his life. That guilt is something I must bear, but it isn't something you need to share. If you see a risk that others take that puts their health or life at stake, the question asked or thing you say could help them live another day. If you see a risk and walk away, then I hope you never have to say, I could have saved a life that day, but I chose to look the other way. Oh! Does that move you a little bit? Yeah. My father fell 25 feet in a foundry back in Wisconsin, back in 1968. Pre-OSHA stuff, right? We no work comp. My mother wasn't working. 8 kids. We went on welfare. We went on welfare for about 6 months before Mom could get into a position that allowed her to make some money. We had to go to the county garage to get bags of flour, a sack of rice, a brick of cheese, a coffee can size deal of peanut butter. That was really devastating. Yeah, that was really devastating. Thankfully, he did not die, and he moved on with his life, and we all got better. But that was some tough times, man. That was some tough times, okay? So how many hurt families, right? We talked about 1,000 every year, okay? Anybody got a personal story about any of this stuff I'm talking about? Family first, safety always, injuries that affected your families? Yes, please.
So 15 years ago, I work for a waterproofing company here in town. We do architectural and civil work, and we were installing some hot fluid applied waterproofing that honestly was just kind of a freak accident. It wasn't anything that anyone did. It wasn't a bad decision. It wasn't necessarily a shortcut. It happened to me as a result of me. It wasn't something anybody was doing, messing around on the job site or anything. I was pouring hot tar from one bucket into another bucket. Anybody that's done this knows that those buckets get extremely sticky on the outside. My buckets touched, and I didn't realize it because I was looking down through the base of my glasses. Mm-hmm. Anyone who's done that knows that you lose that plane of vision. My buckets were in that plane of vision that I did not see. They were touching. And when I stood my bucket back up, the hot tar spilled out of the bucket and onto my arm. Within about 3 seconds, I had a full thickness 3rd-degree burn. And I had hot tar all down my legs, all over my boots, everywhere. I was wearing long sleeves. I had leather gloves on, whole 9 yards. We learned a lot of things that day. When we have women in the field at our company, we do not allow women to wear women's clothing in the field. That was a lesson we learned that day. I'm almost 6 feet tall. I have a very large wingspan, and I was wearing a women's long sleeve shirt. Women's clothing is not made the same as men's clothing. So although I was wearing a long sleeve shirt, when I reach out my arms, my sleeves pull up because I have a huge wingspan, and the material went down my glove. So, although it was only on one hand, the life-altering things that happened were crazy. I was seen at the clinic. The doctor misdiagnosed the burn. I knew instantly that it was misdiagnosed. He diagnosed it as a first-degree burn. And because it was an occupational clinic, I was sent back to work the next day in the field. You were talking about the gentleman that broke both of his wrists. Super fun being a female in the field and walking up to your male foreman and having to have that conversation, because it wasn't until I was in the field that I realized I couldn't unbutton my jeans to go to the restroom. I had to walk up to my foreman. I was like, I swear to you, dude, I'm not going to HR, but I need your help right now. I'm not that person. We're not going to do this, but I need your help. I had 5-year-old twins at home. I couldn't pick up my kids for weeks. I couldn't take a shower, so I ended up having a skin graft 4 weeks later. I couldn't get into the shower because they took the graft from the front of my leg. I could not get into the shower for 6 weeks. So I was going to like a hair cutting salon, like a Great Clips or whatever, because back then they would wash your hair for free. I was going there every day to get my hair washed because I couldn't get in the shower. My body could not get wet because I couldn't get my hand wet, I couldn't get my leg wet, I couldn't do any of it. In physical therapy, my goal was not to get better. My goal was simply to put my hair in a ponytail. That's it. Because I didn't have the strength to open a hair tie. The stupidest, simplest little shit becomes your goal. Twisting a doorknob becomes your goal. I could do everything. I could drive, I could move. I had everything else. I was fine. But the stupidest little things become your goal.
Wow.
It's crazy.
Well, thank you for sharing. And we're glad you're here and able to do what you can do now and loving on life with your twins.
Safety manager.
Love it. All right. Any other personal stories? Sure, we could go for a long time. All right. Reasons or excuses, are there any of them good enough? Oh, I missed one. Thank you.
In 2003, my dad was a welder, and he had a really bad fall at work and had to be flight for life to the hospital. So I was 5, but I still kind of remember some of the longer term impacts of that. I don't remember all the details firsthand, just sort of like what my family was telling me, but I remember he was flight for life to the hospital. He broke both arms, both collarbones. He had reconstructive surgery on his right arm and wrist area. My mom, thankfully she was working at that time, but she had 2 kids, me and my older brother. So we were staying with family friends while my dad was in the hospital. My dad was senior, my brother was junior, and the friends he was staying with, they went dirt biking, and he had an accident and broke his collarbone. He was like 13. I don't think my parents had cell phones yet at the time, so they just brought my brother to the hospital that my dad was at because they knew my mom would show up eventually. And then the doctors got confused because they had the same name, put him in the same hospital room. My mom came to see my dad and saw my brother also in the hospital. And it was tough to recover from that. He was in a similar situation where he was casted up both of his arms for a long time, and then after, his recovery, because he was a welder and had reconstructive surgery on his wrist, he couldn't do his trade anymore, really, and so he pivoted and became a safety manager and really turned that story around, and worked in construction and safety for the rest of his career. But that was in 2003, and in 2018, I lost him to alcohol. So coming to events like this, I just want to say thank you.
Thank you for sharing.
Talking about stuff like this is really important. And you can't ignore the connection between near fatal events or any kind of traumatic event at work and what might seem like an unrelated substance use after. So just thank you for presenting, and to all of the speakers, this is a really important topic.
Absolutely.
Thanks.
Big hug to you. Oh my goodness. Oh my goodness. I don't know if I can take any more personal stories. But again, no reason, no excuse. They're not good enough, right? Raise your hand if you agree. They're not good enough, right? They're just not good enough. They're not, okay? All right. When was the last time you took safety stand for yourself? Ooh, I'm not doing that. I'm not doing it. That's a good thing to do. That's stop work. I'm not going to do it, okay? Or your coworkers, right? Huge. Got to do that, okay? Bingo. You're up there, Chief. Video guy. Is it coming? Okay. Little quick short video. Pretty short, huh?
I'm on a roll. I'm on a roll.
You the backhoe guy?
Yeah. How's it going?
You two looking for work?
Yes, yes. Hey, Derek, do you want to take those out?
Every time he leaves for work, I worry.
All the training I got was basically just passed down.
Greg! What the hell? I'm playing on the skill saw. This'll work.
Hey, Lucky. Yeah? I need you to get the nail gun off the roof. You know what you're doing with the ladder, right?
Yeah, yeah.
And get the big ladder.
Ryan, pass me a pencil.
You gotta be focused when you're doing this. You don't have time to be thinking other things.
Just like his old man, safety first.
Please answer the question directly, sir.
I was under a lot of pressure.
The supervisor's called for me by name.
Hey, Tony, you gonna send that concrete or what? It's coming. Just give me a minute.
The last thing I said when he was going up the ladder was watch out for that hole.
You want a frickin' safety meeting or what?
No, I was just thinking.
Just do it.
You know where the gas and the electrical lines are?
It's pretty obvious. Just feel your way in. You'll know if you hit something.
There's no secret to any of it.
Supply tomorrow. Right? Rich doesn't know if they can supply them tomorrow.
Could change. Pull me out.
That's a great place to go get some videos, by the way, if you don't get videos, or if you want a place to get videos. Why? Why? So we're inviting you to choose to work safely. We're inviting you into the world of safe work habits, where they're the norm, to accept this invitation for your family and friends. I worked for a contractor one time, and every incident that occurred, the individual that was injured had to take the incident report, corrective actions back to his family, and his parents or his wife had to sign off on it. That had a big impact, okay? All right, so ways to get help. Certainly there's lots of ways. You can go through CEF, right? We can go through the OSHA Institute. We got trade organizations, safety professionals. Certainly you got a safety program. And certainly we empower you to use your stop work authority. It's not just authority, it's a responsibility. It's a responsibility that you have to take seriously, okay? I don't want to go through any regrets on my job sites.
You're going to introduce Matt.
I will. Okay? No regrets. Family, whoop. Oh, you can't go back. Shoot, can I? Family first, safety always. If you take that out of here, man, you're going to win. Okay? Very good. Any questions? Probably not, because we got another guy coming up. But thank you. So this is Matt. Matt is going to have a conversation with you about, well, I'll let Matt tell you all about it. Okay, I'm trying to stall a little bit. He asked me to stall a little bit.
Okay.
He's got to load you up.
Got it. All right. Well, thank you for staying and being part of this last presentation. So I understand that Nick and I are between you and the weekend. So again, thank you for staying. And I think we learned a lot. It's such great to have a great community here in Colorado and here in Denver of safety professionals and people that are passionate about safety. So my name is Matt Ogle. I'm a senior safety manager with J. Dunn here in Denver over Rocky Mountain region, Colorado and Wyoming. And I've been with J. Dunn 20 years, been in safety for 31 years. So my presentation is on, beyond compliance. So family first mindset. So don't have a lot of slides, so good news. But I wanted to share kind of what, just something that we're, J. Dunn, we're using here within J. Dunn that we found really good success with. Might be something that might help you. So, I don't want to go over these too much. I think we've all kind of been over these statistics too much. And, they are preventable, right? Again, more statistics for you. But, so, has anyone in here, besides Cal, heard of LYRA? Oyra? Anybody heard of LYRA? Okay, great. So about 3 years ago, our benefits group discovered LYRA, and it's a company that basically provides access to mental health therapists. And 3 years ago, my company invested in human resources, humans, and added a benefit that we are provided 12 free of charge therapy session, coaching sessions a year for not only our employees, but also the people who depend on them. That's a great investment, right? I was talking to Cal and Nick yesterday. When I think of mental health and mental, therapy, I think there's a stigma. I think there's a stigma about people getting therapy, and I think we need to disband with it, right? I think we need to look at people that are getting therapy as like kind of mental health athletes. I think when I think of, when we have a significant event in our lives, why we shouldn't have to go, I think the worst case scenario is getting therapy at that time. I think being proactive, getting a relationship, learning about your mental health, making sure that, having that therapist that you're working with, so that when you do have a life and event come up, you're prepared for it. Just like you're not going to go from couch to running the Colfax Marathon. You're going to have better success if you start working with someone professional and have success with that. So I've got 2 videos. I'm praying that they're going to work. Okay. So 2 of my coworkers, and just want to share their experiences with using Lyra.
And really didn't understand what they were, just kind of brushed them off. I was stressed on a regular basis. Work came home, and home went to work with me. There was no boundaries between the two, and I really didn't know how to create a healthy balance. I have tried therapy before with 2 or 3 other therapists that just didn't work. Some of the reasons they didn't work: cultural backgrounds, not feeling understood or heard. Culturally, there are things that I don't want to have to explain in the process of dealing with my issues today. Seeking out a therapist, for me, importance was being able to see myself in my therapist. So that meant a woman, that meant a certain age range, that also meant a woman of color. My Lyra therapist is great, and she is basically the girlfriend that I never had and can tell her anything, and she cannot tell anyone else. Part of therapy is being vulnerable. Part of therapy is sharing your deepest, darkest secrets and fears, and the things that we deal with on a daily basis a lot of times come from the places that we grew up, or they come from the environments that we were raised in. What I want people to know about me is that the person that comes to work and puts on a brave face sometimes is insecure, sometimes wonders, am I doing this right? Therapy is an ongoing process. It's allowed me to be vulnerable with people I work with. It has also helped me understand that having a bad morning doesn't mean I have to have a bad day. If someone was hesitant or scared about taking the first step for seeking mental health, I would ask them, what do they have to lose? You have nothing to lose and everything to gain.
Again, these are my heroes, right? Nothing to lose, everything to gain, And when in respects to safety, okay, I think we've all worked with people, or we maybe have been involved in an accident investigation, and we'll ask just some questions about like hey, what's going on? How are they doing in their life? And they have any family issues? Like, yeah, that person's really mentally loaded, right? Well, that's probably a contributing factor. That might be a contributing factor to that incident or injury, right? And how many people want to interact with these people that are actually maintaining their? I really like the term that Cal brought up is mental health fitness, right? They're not going out to run in the Colfax Marathon tomorrow. They're preparing now. So I think all I would just like to ask, and just let's do away with the stigma about people getting therapy. I think we should say, hey, I want to be more like that person, right? So that's what I just wanted to share this. We're using Lyra. There are a lot of other competitors, but I just wanted to show what we're using and just an option. I can get you in touch with our benefits group. There's some other contractors that are using Lyra, so just wanted to share that. And then lastly, is I want to talk about Narcan. So Jay Dunn, 2 years ago, in Oklahoma City, we had an insulator during break, overdose, and die. We said, hey, we've got to do something about this. So we started looking at getting Narcan out on our projects, worked with legal, got the Narcan on our projects, revised our first aid, CPR, AED training to incorporate Narcan. And you know what? Last year, we had a Mason down in Pueblo, Colorado, overdose, and he is alive because of what we did. So we had a Mason, his coworker came looking for him, couldn't find him, opened up the porta pot that was locked. The guy basically kind of unresponsive, fell out. He went to the trailers. My safety person was taking the day off, but the superintendents who we had trained and had Narcan on the project, they came out and responded. They brought the AED out. They did 1 dose of Narcan. He started to come out of it, but then kind of faded. They did a 2nd dose, and he started coming out of it just as the EMTs arrived. So, I'm proud to work with Jay Dunn, 101 years old. We're not the fastest company with innovation and stuff, but if we can do it, you guys can do it too. If you want to do Narcan, get the Narcan out there. Because it does save lives. And if you want a story, use that story. And it's not in California, it's right here in Colorado. So, that's all I have.
Thank you, Matt Ogle. Matt and I go back a long way. I learned a lot from Matt. I used to say that Matt was the safety guru that taught me trial by fire. We went through some tough jobs together. And yeah, hey, I need your help. Hey, I need your help. No, we really, you helped me do so much. Appreciate you being here today. It's come full circle. Thank you guys for sticking around. There's only a few of us left. Hey, we're old pals at this point. Yeah, let's party. Yeah. Speaking of partying, I got plenty of Narcan left. So if anybody wants to have some Narcan, I have some. What do you mean? Hey, you got to take Narcan to the party, buddy. You got to take Narcan to the party. If we need to leave with any Narcan, then I failed. So please come get the Narcan and take it to your job sites and take it to your folks and save some lives. Thank you guys to everybody who was a part of this. Thanks for sticking it out. We are going to do this again next year, and I'm going to need a lot of partners and help and people and things. So if you want to be involved next year, just let me know. If you want to be involved in ASA, let me know that too. Thank you for being here. And thank you desperately to the people who care about this work, have done the work. I often say that ASA exists as a facilitator for those that are really doing the work. And that's the people you guys met today. So make one last connection before you leave. But as far as I know, we're out of here. So thank you guys.